Good evening, everyone. Welcome to the fifth edition of CSR Health Impact Summit and Awards. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health awareness, advocacy, and behavior change. We initiated discourse around enhancing the contribution of our industries and corporates in the health of India's people through their CSR effort in 2017. And it was well received by everyone who understood the fundamental role of health in the growth and sustainability of a nation. But the pandemic gave unprecedented dimensions to this discussion. The global public health emergency that hit us early last year has multiplied the need for industry support many times. And not only industry, health today demands the urgent contribution from everyone. Talking about corporates, they have indeed risen to the challenge and augmented the government's efforts towards mitigating the pandemic challenges by reorienting their CSR strategies. But a temporary realignment may not work. The COVID has only opened a new front in India's long ongoing war against many other diseases that kills many more people in our country. Heart, lung diseases, stroke, cancer, and diabetes kill nearly 6 million people every year in India. The total global toll of COVID-19 stands at 4 million today. The number of under 5 deaths mainly caused by undernutrition or malnutrition, unavailability of clean water, and an absence of hygiene in 2019 stood at 8,24,000. The total number of COVID deaths in India is 4 lakh something till today. These numbers only hint towards the kind of health emergency we always have been and why we should have started much earlier towards fixing it. But it is better late than never, and the focus and zeal we see from all quarters, people to governments, and more relevant to today's discussion, the CSR activities of corporates need to go beyond the pandemic. The need to continue shouldering responsibilities of their workforce and the communities around them. And in the session, we will try to understand from the drawings of CSR and public health policies, public policies, how our industry can carve out a more permanent role in building of a healthy nation. So let me welcome the illustrious speakers who have joined us today on the inaugural session of 5th CSR Health Impact Summit and Awards. So we are being joined by Dr. Bhaskar Chatterjee, former Director General and CEO of Indian Institute of Corporate Affairs. Dr. Chatterjee is widely acclaimed as the father of CSR in our country. He was instrumental in framing and issuing the CSR guidelines for public sector enterprises. He played a major role in the inclusion of Section 135 in the Companies Act of 2013 and framing of the rules thereafter. We also have with us Professor Arun Kumar Rath, Chairman of Center of Corporate Governance in CSR at IIM Nagpur. Professor Rath is a much praised civil servant, educationist, corporate leader, institution builder, and a management guru. He has made significant contribution in various fields of Indian administration and corporate governance, social responsibility, and strategic management of public sector companies. We also have with us Mr. Ravi Bhatnagar, Director, External Affairs and Partnerships, Asia Middle East of Reckitt. Ravi is a global communication expert and is known for his penchant for driving purpose in the company and making people act as active social contributors. He is the brain behind several legendary public health awareness campaigns and interventions by RV, including one of its kind, Dettol Banega Swachh India movement, which has become a global case study in itself for promoting hand washing hygiene and cleanliness that yield better health outcomes. And we have with us Mr. Avilas Dwivedi, Head CSR and Trustee TPCDT Tata Projects, a passionate CSR and sustainability professional. Avilas leads the CSR function of Tata Projects. His vast experience includes grassroots level engagement, research, grant making, partnerships, and stakeholder engagement across civil societies and global corporations in the mining, metal, and power sector. And being an ex-gentleman cadet of Indian Military Academy, Dehradun, he also actively engaged in mentoring young talent for fostering leadership qualities in his personal capacity. So thank you so much, gentlemen, for joining this session today. And so let me begin with Professor Rath. Professor Rath, you have seen the calamity of COVID-19, which hit hard the country. We were not prepared, governments were not prepared, and almost everyone was not prepared at that time. But the interesting part was that we all worked like a team, and we put forward, I think, a most remarkable response to this crisis. As we have started that, and as I mentioned that we were always, in the middle of an ongoing crisis when it comes to public health. How do you see that a lot of additional focus, work from the government, industry, and even people, which has started from COVID-19, can be taken forward so that we can save many more lives which we lose every year? Professor Rath.
Thank you, Bishop Kamal Narayan. I must compliment IHW Council for organizing such event, which is very, very relevant in today's situation. I will begin with giving some disturbing facts, which are generally understood but not fully realized. The disturbing facts are very up to date, very latest, and coming from none other than the United Nations, which is very disturbing. It is just latest. Now, all the UN bodies, they have issued what is called the annual statement they issue, State of Food Security and Nutrition in the world in 2021, very fresh. They've jointly published a report signed by Food and Agriculture Organization, International Fund for Agriculture Development, UNICEF, UN World Food Program, World Health Organization. Jointly, they have issued a statement saying that three things which are very relevant for today's event is that they're giving three warnings. That one is there's the biggest increase in world hunger, malnutrition. In decades, it never happened because of the COVID-19. We are going to have a very serious crisis. Number two, the world has already gone off track to achieve the goal of eradicating hunger by 2030. We thought we'll eradicate hunger by 2030, but no, this COVID has upset all the calculations. And third, which is more damaging, the rise in food insecurity in 2020, last year, is equal to the previous 5 years combined. Means we have become far behind in nutrition. Since we're talking about health, we understand that there's going to be nutrition problem, deficiency, not on a small scale, on a mass scale. And that is very, very disturbing. And so there we must understand what is the role of corporates. Of course, government has to come in the front line, but then government alone is not supposed to do everything. nor government can do everything. Very clear. Now, I will take you back to 12 years for a reason. Harvard Business Review published a paper in 2009, which is very relevant for us today. You know, in 2008, the world was plunged by the global economic downturn. A crisis took place, which you see today, a similar economic crisis in 2008 onwards. And HBR did a study that in an economic crisis and downturn, what do the corporates do? This is very relevant for today. The corporations, the business, the private sector, what they're doing in a global economic downturn, in a crisis-like situation. People thought that they will withdraw from CSR, from education, from health, because that is the low priority for them, people thought. Surprisingly, the HBS study showed that in a crisis situation, the corporates are doing more and more of CSR. That is relevant, very relevant today, because they feel that if we do not help society, when society is in crisis, society will not help us, and we cannot do business without social support. So that must dawn upon every business, every corporation, private, public today. And they must realize this is a golden opportunity for them to show their commitment to society, to the poor, to downtrodden. And then, because they are going to have problem, they must have customer base, they must have social support. Therefore, my hunch is that, and I have done a lot of study, that corporates are going to come in a big way to take much of the load, not the entire load, of the crisis, particularly in the field of health, nutrition, and hunger. So that is the beginning which you should make. And I'm happy that civil society organizations, NGOs like ISW have taken a lead in sensitizing the corporates that here is not a problem for you. Here's a golden opportunity for you to show your social commitment. So I feel that Indian corporates are going to come in a big way to give a helping hand to society. And the UN report, the warning they have given, is very appropriate. People should know that many people are going to be hungry, people are going to be malnutrition, people are going to be having health problem. COVID will go, but it will leave a plethora of problems. So I think initially this is my comment to
Thank you so much, Professor Rath, for highlighting this, and also bringing very emphatically the whole discourse around nutrition and hunger. And I just quote one of the recent report also in media that around 230 million middle class Indians have now been pushed to almost to a situation which is, let's say, earning of less than $5. So all these are going to complicate the challenges we were already facing. Avilash-ji, I would like to come to you at this point of time. Tata Trust and Tata as an organization has been one of the, I think, among the largest contributor through its various CSR sustainability efforts, and it date back very long. With the new complication arising, and you people have tried to do, I think, substantially hard to kind of mitigate the problems of COVID-19 or the challenges created by it. How do you see going forward when we are we had a lot to tackle, which has got further aggravated, and we have got a lot more to tackle? How do you see organizations like Tata Trust taking forward its focus, and will it have much more focus on health and related component, as we expect from even the government that they should be increasing the spendings on health which has been, I think, dismally low so far. And only the COVID, time they have been increased, but will they continue? And similarly, how organizations like yours are going to take it forward? Avilash ji, yeah.
Yeah, first of all, thanks for this opportunity to be a part of this discussion. See, looking at your question, what does Tata Trust or Tata Group as a such think of in terms of taking these things forward? Health has been definitely one of the key areas for us to intervene in. If you know, be it the manufacturing set of companies which Tata Group has, or the IT companies which don't sit heavily on the ground, they've looked at health as one of the integral areas to get in, and looked at not just in terms of investment for improving or augmenting infrastructure, but also building capacities in the ecosystem. Predominantly, that is critical, because health is also about well-being. It's not that you have a problem, you cure it and have the resilience to cure things. TMH, Tata Memorial Hospital, for that. It's about curing things. I'm talking more about the curative part of it. But even there are preventive things which are required in the health ecosystem. At a national level, if you see the year-by-year investment done by the companies across various sectors, you find health is the second highest area in terms of expenditure done by the companies after education. But what's important, and where I would like to bring in, is that element that it's not about just corporates. If you see Doing Good Index 2020 of 18 Asian economies, if you look at the entire pie of developmental expenditure, 16% of that expenditure is CSR funded. 16% comes from individual contributions. Then there are institutional developmental institutions who fund, and government funding is critically there. Everybody has been trying to do something or the other with all good intentions, objectives. Where there has been convergence, where there has not been duplication of efforts, things have gone pretty well over there. At Tata Group, when we try to do the chairman's message is very clear that bring convergence. If you are taking a geography, can Tata Group companies come together and address a problem? Can technology create a great enabler in addressing things? Is it just about brick and mortar? Presently, not so. Building capacities, right kind of technology, getting the people more and more aware of their things, there lies the answer. And we are working closely with stakeholders across the length and breadth of the country to see that we may or may not have realized earlier, but now there is realization amongst all, and now it's all about building resilience. It's not about, no matter how it's a kind of like disasters. We were not earlier getting prepared, but now preparedness levels have gone up, and the government and the various other stakeholders are doing it. Similarly, for health, there is intent to get into that. How much will that happen? 55, it will be over a period of time. Technology definitely is very critical, and sharing of competencies. It's my view, but somewhere or the other, the shared value proposition would have really encouraged more and more to look at CSR more strategically, and that would have really made much of a difference in terms of companies who have the competencies. Let's look at two buckets: health organizations which have their core competence in the health sector, and other organizations who don't have that competence in the health or sanitation sector. While the former have the competence, they can build those things into the ecosystem. A simple swab testing. How do you make swab? How do you get swab testing done? And how you create MSMEs to take things further? That's a kind of a share and value proposition which corporates can offer into the market, while others can support those kind of initiatives. maybe there may not be their competence. So that mixed blending is very, very critical. And so it is happening. It is there. Knee-jerk reaction is no more going to work. And while we are still trying to grapple to understand this pandemic as we move with new things happening, but yes, resilience is making if you have two resilience factors, positive and negative, how you outcome outpar the negative ones and create a net positive resilience in the community is critical.
Thank you so much, Vilas ji, and also for highlighting that it is not about just curing the diseases, the burden of which we have, but also encouraging the overall well-being of the nation, so that we have a lesser, morbidity or burden of diseases, and have a more productive population. You have talked about a couple of interesting things, convergence, using technologies and creating shared value, and also building resilience. Let me go to Ravi on this. Ravi, I think the last 2 years have been definitely something where, as for everyone, also for, I think, Reckitt, or for the work which you were doing, almost decades have happened in the last 15, 16 months. And I know that you have a special interest towards using technology to bring the interventions. How has been these, last couple of years, and how Reckitt and Dettol have taken important interventions and continued those interventions? Because one of the major challenge along with the pandemic came is that the disruption of ongoing activities. So how you manage to continue them and also enhance them, which we have seen a lot work happening. How it has been, and what has been the role of technology?
Thank you. First of all, it's always a privilege to come back to, the sessions what you moderate and, the work IHW does. I have few submissions, 2 years have been really, really different. And I will not say they are very difficult. They were very difficult. But definitely a lot of learnings can be derived, because this will be a world which will have a lot of zoonotic disease in future. It's just the beginning. In my whole career, spanning around last 18 years now, I got chance to respond to Ebola, to SARS, to MERS, and now COVID-19. Although I'm not a medical doctor, but in the various roles and various capacities, I have led the programs. One thing is for sure, hygiene is at the center of all the zoonotic disease as of now. And I would love to quote a gentleman called Atul Gawande, who has written a book called The Checklist Manifesto a few years back. He's a Harvard Medical College professor. 10 years back, I started looking into that. And when I was working with the Hillary Clinton in my last avatar before joining Reckitt, it was really, really interesting, what kind of reactions I was getting, why hygiene, why diarrhea, why cholera. These are all, old world problems and everything. So why hygiene? Ultimately, I landed into Reckitt by the virtue of the good karma. I came here. This is 7th year running, and 2 years have been really, really exciting. Exciting in terms of there was a time when I used to see Beyond and other channels and read, international newspapers. I just need to use the numbers 1,000 deaths in China, 500 deaths here. The numbers is in millions now. It's no more a number which you see in the TV. The deaths came closer, the mortality came closer, the morbidity came closer, the fear came closer, the emotional traumas came closer. Even the domestic violence incidents also were very closer somewhere. Everything changed in these 2 years. Definitely technology has a very important role to play, and we have been using technology in 2 of the big Dettol campaigns. One is the TikTok campaign, when TikTok was live in India, which reached out to billions of people across the globe, starting from India. almost every celebrity took part in that and made sure the behavioral nudges are being used and the message is created in a fun way and others also use it, especially on the hand washing. The whole TikTok campaign was that. Second big thing which we did was, which is still going on, which is Dettol salutes. So someone really asked me this question, Ravi, like, when everywhere there is distress, still the numbers are 40,000 plus in India. Why you are saluting the heroes and why you are bringing Amitabh Bachchan again on the show and why your global CEO is coming and, but my take is very different. My take is like using technology for the Dettol salutes where you have everyday people. It's not just the Lutyens Delhi or cream la de cream who are in the position of power or position of dominance to break through all that and reaching out to a ordinary rickshawala and ordinary a guy who is taking people for the funerals and helping people and ordinary citizens, like from Leh Ladakh to Delhi to Orissa to Kokrajhar to all the places in India. So that gave us a very big opportunity. We thought like we will just salute 100 people. The momentum started with that. And it's 33 million plus people who are being, saluted by their friends and families. I'm getting a lot of requests like how to be a part of this. If technology was not there, Kamalji, this whole campaign would not have been successful, neither TikTok. This has merits as well as demerits also. As we know, like hand washing is as basics as it is, and Dettol has a role to play, like other competitors of Dettol also have. So somewhere I will never say like, alone Dettol can also do this. I will never take that courage to do. Although we have beaten our, the nearest competitor 2 years back and we came on the number 1 position and we still sustain that position. But I will never say all that. This is the whole strategy of SDG 17 is the most important, which is the partnerships and alliances. I'm privileged to work with the group from the TCS, the Tata group, when, Ronnie Screwwala to Airtel, to Vodafone, to many other corporates in over last 7-8 years, which I have spent with Reckitt. And there is always a power of partnership because 1 or 2 people, if they have to take all the burden of technology or reaching or outreach, it is very, very difficult unless technology comes for the rescue. It's very, very difficult thing to achieve. One thing what, my previous speaker has actually just said, like, which was on the nutrition bit. That's super exciting. We've used blockchain in these 2 years, how to reach out to the most marginalized communities across tribal districts, which is around 90% tribal districts of Amravati and Nandurbar in Maharashtra. How you use the blockchain and taking the blockchain from the financial market to the social development sector and using that and making sure your every penny which is invested has a X return on investment and the monies are going to the right places and to the right people. Using AI for reaching out to the kids during this, COVID times. That's again fun thing. We created Jubi, Hello Jubi. So it's there on, the Android platform. So plenty of digital first interventions took place and they are not very small pilots. Like when I say use of Hello Jubi, it means around 20 million kids using Hello Jubi in India. When I say partnering with the Byju's and the Whitehead Junior for the coding, some people say it's fad, some people say it's fashion, some people say they are in trouble. For me, what is important is like kids need to be engaged in the modern ways of doing the things. And my experience of working with Dr. Kalam over the years when he was alive is basically like how we focus on the science and how we focus on the math and hygiene also. It's very easy, like, there are a lot of gyan people give. Okay, you wash hands 20 seconds, very good. So when you ask the kids and the teachers, what are the top 3 reasons why diarrhea happens, or the 3 bacteria or virus or fungus, 99.9% can't answer this. So using science as a media and the medium to reach out to the kids through the digital interventions is something which I have seen. And right now, Umarji, like as we are talking, like yesterday I was in Rishikesh. So we are putting a digital studio with the Jiva, which is one of your partners, Parmarth Ashram. So all the Gurukuls in India will be having the curriculum in hygiene. This is the first place I am announcing this actually, which will be a digital platform where all the Gurukuls will be attached and the hygiene curriculum will be taught in Sanskrit. And Uttarakhand has a first language as Sanskrit. We have it in 14, 15 languages, including Braille and other things. But nevertheless, I see digital has a big role to play, and digital first is the time. And maybe further times will be more challenging when this third wave comes, if it comes. Otherwise, also businesses, transactions, fiduciary, finances, social, epidemiological things, everything is moving digital. Then why not the social also moves digital in a very big way? Although there is no replacement, I would love to focus on this, of the field work and the community work. So somewhere there needs to be a final balance between the two. Thank you.
Thank you so much, Ravi. And a couple of things which you mentioned are very, very important from the adoption of healthy habit among the masses, and encouragement and communication definitely goes a long way. And that is what you tried, the examples which you quoted here, that how you actually make people adopt those healthy habits, because that's very, very challenging when it comes to public health management. Let me go to Mr. Rath on it. And Mr. Rath, Ravi also mentioned about one word I would like to take from here is the power of partnership. You have been in the government and retired as a education secretary, union education secretary. CSR has been institutionalized. There has been also a lot of frameworks which guide organizations to, kind of drive their CSR activities on many areas, strategic areas, aspirational districts and areas and all that. How do you see this power of partnership is, going to further be built between the government and the private sector? And especially for the areas like this, where there has been a lot of mistrust also in the past. So how do you see that? Is the power of partnership now being appreciated at the government side, and the government now sees that, okay, this is the area where these industries, those companies, corporates who have the know-how, technology, are also, the inroads to the grassroots level can do it better, and we shall actually encourage them to do it better. How do you see this shaping up further?
Kamalji, very relevant question you have raised. In fact, this is at the heart of CSR. When some people suggested that why should government expect companies to spend 2% of their profits on CSR? Why not collect a tax? Collect a tax. You are collecting corporate tax, take 2% more and then spend it. That is negating the partnership. Do you know that India having far-flung corporates, far-flung business, the mining areas, the steel plants, the people who are in the backward areas, having the plants there, if you collect 2% from them and go to Delhi, and who spends it? You cannot. Those who say, what does government collect 2% and spend? It is negating. It is not the money alone which is important. Who is providing service? It is the corporates who are present there, right there. Private business, public sector, MNCs, steel plants, mining areas, everything is right there at the place where the poor people are living. The heart of partnership is heart of CSR. Therefore, no way we should collect tax of 2%. Let the units, let the industry, let the business house, let the mining area, let the mines, let them spend from their pocket, from their money. Two things happen. That they will get a goodwill of the people. The people will feel that this company has come to our village not to fleece us, but this company is a friend, is a benefactor, for us. So they will support the company. Now, let me tell you that I have seen, being in the board of so many companies in the shale, NMDC, mining, MCL, Coal India. I tell you, when the company at the unit level, in the field area, they spend the money, there are two advantages. One, they are there to spend. You do not get somebody from Delhi to come and spend time there and spend, but they are there. And they know the people, people know them, so they get the goodwill of people. So it's a two-way, it's a win-win situation. As a Porter said, win-win. You are not giving somebody, you are also getting from somebody. So win-win is very important, is the heart of partnership. You know, Starbucks example of win-win partnership. What Starbucks did? Starbucks is a big company, but they had coffee problem, supply of coffee. So they went to the coffee farmers that please do not create crop which is not ripe. They would sell the crop at a very unripe stage. So they got all bad raw material. So the Starbucks went to stakeholders, to the producers, the poor farmers, and said, please, I'll support you. Provide good coffee beans. This is partnership. Who wins? Starbucks wins. And the farmers also win. It's a win-win. So partnership is at the very heart of CSR. Without partnership, it is not going to progress. When both sides feel that they're winning, then CSR happens. It is not giving. That what Mahatma Gandhi said, the joy of giving. I am giving you. I am grateful to you that you are taking. It is not that I am giving you some dole. I am giving you something which you are accepting. I am grateful to you. I touch your feet because you are accepting my gift, not a giving somebody and throwing some at somebody. So win-win relationship is the heart of partnership, and CSR should be seen more as a partnership than just spending.
Thank you so much, Professor Rath. And important point is, definitely the contribution of CSR, not only CSR, even the government and even the I think the individuals. Vilasji said that a lot contribution come from individuals also. So the joy of giving and then helping that reach to the right people and address the problems is very, very important. And let me just take this partnership discourse a little further. Vilasji, well-being, you mentioned that, like for example, when we think about Tata's contribution towards health, the first thing comes in mind is that Tata Memorial Cancer Center. And, but as you mentioned that beyond this, the well-being of the people is also something which need to be equally given priority to. And this pandemic has highlighted, I think, to a large extent, and kind of made it more on an emergency mode that we need to, kind of rebuild or build from scratch our primary care infrastructure, which is the most, I think, going to be important component if we really want to build and achieve the well-being of our population. There are health and wellness centers which are being, proposed, which are government working on it also, but at the same time, they are not there in as much number or in as, kind of in the form, shape, which are required to achieve the well-being goals, if I can say so. How do you see corporate like yours with a massive reach across the length and width of the country, how this partnership, this power of partnership can be implemented in our primary care space, which is going to be the most defining, I think, infrastructure for all that which may be waiting for us, the third wave or fourth wave, or maybe the next, as Ravi said, that this is the world of zoonotic diseases. There may be many more coming up after Ebola, SARS, and the now COVID. Do you see the role of private sector, corporates coming forward, pooling in to build the primary care of our country. You are on mute, Vilashji. Abhilash, you are on mute. Yeah.
Much really depends on what are the aspiration vision of the company. So company to company, it may differ. There are companies who aspire to contribute in nation building through skilling. There are companies who aspire to contribute through education. Definitely, they might be into 3-4 areas, but there's always one thing which they try to do the most, because that's all about sharing their core competencies. So, yes, now everybody has realized that COVID might be an instance in our lives now which is there with us. So we will be also, as organizations, looking at those things and investing more. At the same time, trying to balance the existing things which we are doing as a whole. But here I would like to take the discussion further to one critical segment of the society which we are not talking about, and basically they basically bring the change at the ground level. And there I would like to bring in the civil society organizations. If you see, most of the companies, they don't do it themselves. They partner with not-for-profits, developmental organizations, some local, some regional, some national or internationally operating, to bring in those competencies. Well, just in the morning, I was reading a story of one of the health para-worker of one organization of Rajasthan. That village is cut off. It's a tribal village. It's cut off. There's no access road to that village. And this para-health worker, trained by the civil society organization, reaches out to a family who has lost the daughter-in-law, lost there's an old father, there's a child, and there's a son. Son has to go for livelihood. Old father has to stay at home, can't do anything. He can't take care of the child. Imagine the vulnerability of this family. And you don't have any nearby access road. Forget about a PHC. While those centers would come up over a period of time, but yes, these civil society organizations, these not-for-profit organizations, the founder trusts who have been working on the liberal views, the democratic values they have been promoting since ages, and they have been doing the groundwork basically on the ground. We might, as corporates, may have the money muscle to support those things primarily, but at this point of time, I would really voice on behalf of all those civil society organizations who have been quietly working, humbly working, not getting noted, but without any expectation of that as well. This particular segment of the stakeholders of all of these have played a critical role. In fact, and there they have brought in those connectivity in reaching out to the last mile. And those partnerships are very, very important. They have committed people. They know how to engage. They understand what challenges are on the ground level. Technical expertise provided to them from the other stakeholders, be it the government, in building such capacities really helps going further in building resilience at the community level. Health is one such thing, but if you see, everything has a intersectionality with each other. Climate change having impacts on agriculture, on health, and on various other things. So definitely partnerships are there. What more can corporate do, or what more can government do is not the question. The question is that yes, even before the 2% law came, they were still there, they were doing. And these organizations have been really working closely and trying to do things. The more we embrace them, the more a message goes that we all are together, and they are also very much there in the front and trying to make that difference, and we acknowledge them. That then the spirit of partnership is there. We can bring in our competencies of technology or have access to resources, be able to advocate with the government and make our voice heard. But in this scheme of partnerships, as you said, and in understanding the primary health level well-being part, while the infrastructure or the investments to get these things up and running might take some more time, but this particular community which is there in our ecosystem has done a great human service, and we need to celebrate more and more such things and support such innovative ideas, and which are many a times they bring in solutions which are low cost or even cost effective and don't have a cost to it. Yeah, the challenge lies with them. Can we take it to scale? That's where we can play that role in bringing it to scale and touching things more on at a ground level where the result is sustained. It gets converted into a positive health and hygiene behavior. That's more critical, and they have that knack to get it done immensely because of the decades and century of their experience and expertise.
Thank you so much. Yeah, but definitely the important area for the implementation of the all that we wish from the corporates to be doing is definitely these civil societies work as a backbone to that. Ravi, Avilas talked about the intersectionality of this, and also it depends on the aspiration of the companies, that which company want to work at, what are the agendas they have carved out for themselves for supporting the society. But that is where my point is that from 2017 when we started this, and we started talking that okay, let's first fix health, because if you fix the health of the people, many of those other things can be achieved by a healthy individual by himself or herself. While many of the organizations may be having a different, and it's thankfully health remains the second largest, I think, component is being spent by CSR. In this space, especially when we are talking about the, to fix the health first, and you have been, you mentioned that the specific example of Nandurbar and Amravati's work which you did, and you tried to solve many problems through one intervention, and you have also seen some remarkable, and you mentioned I think briefly there's some great in returns coming out of that investment, and that is where ISW Council at least has been pitching for that. Okay, no, first take care of the health, and it is going to give you a lot many kind of returns on your investment, if we can, and social returns on your investment. How has been that experience? And if I pick up that word of scalability, how scalable is your model which you implemented with the help of technology in this I think highly backward side of Maharashtra?
Thank you again, Kamalji. I'm not saying we do some fabulous work ourselves. There are people on the field. There are development partners. There is government. On the top of that, there is a bunch of researchers, which I would love to acknowledge. If you see the whole space of nutrition, and especially the SAM, MAM kids and all this, you hardly see the evidence actually. When I say about evidence, when I was looking into when was the last anthropological study done on the cultural nudges which impact the food habits, like eating millets or eating pokra, etc., etc. When was that last done? So what is being done is largely we talk about the calories, we talk about some modern foods. Parle-G, sorry to name the brand, Parle-G is in the hands of very little kids. It's in the hands of the anemic moms. But it's not their fault. Hunger is something which is very important to address. And somewhere, we all need to gear up, and we also thought we will do something which is at the intersection of the national purpose, brand purpose, and the company purpose. People reached out to us you don't make a single brand which will business-wise impact you on this. We said, for us, seeing the zero deaths in these two tribal districts, zero deaths because of, SAM, that was a dream, and we achieved that dream, Kamalji, in 2 years' time. There's zero deaths practically, and it's not me saying, it's a DLHS saying, and it's the WHO external evaluators telling all these stories. Great for us. We thought, okay, this is a high time. India has 117 plus or 117 aspirational districts. Earlier, Bimaru districts, economically empowered districts. So can I do something in 2021 which will reach out to 50% of the aspirational districts? And my plans are to reach out to 50% of the aspirational districts. And I have further modified my program and modified the technology. And the whole program is on the sphere of the pre-preventive healthcare. I have 3 domains. One domain is hygiene, second domain is health, and third domain, which is a big domain, is basically nutrition. In nutrition also, I'm just focusing on 2 elements. One is anemia, and second is the breastfeeding. I just want to focus into these things because I think as a company, we are good to address these 2 things. Not by the virtue of products, by virtue of all the nudges and the behavioral nudges which we have been studying very extensively. And when first time we all came together in the room, someone said, okay, UNICEF is doing this thing, World Food Program is doing this. I said, my model is very different. My model is very simple. I am not going to beat around the bush, and I'm not going to do something called advocacy, communication, and social mobilization. Instead of that, I will be having a targeted approach, not targeted in terms of numbers. I will be going to the populations which are BOP populations, below poverty line populations, last quintile, or, a different kind of, ration card holders. Like in Bihar, you have Musars. In Maharashtra also, you have multiple tribes who are Mahadalits actually. We thought, let's see where are the hotspots. Can we focus on the hotspots? And then, we build up to the bigger network of communicating to the people, etc., etc. We created the voucher scheme because when a kid is to be admitted through the nutrition rehabilitation center, it takes 14 days to 18 days. So we thought, is there a way to transport the kids better? Because these 2 districts have hardly any mobile connectivity. And the district collector has been writing to the Ministry of Telecom and many others to bring these services to these 2 places in both the districts, especially when you go very interiors. And, I'm very proudly telling you this thing, somehow we have cracked the model, and we have our return on investment study also. Broadly, 1 rupee spent gives us 40 rupee return on investment when you save a kid's life. We thought this is a very crude measure and very econometric measure to measure this. Can we also have the DALYs, which is disability adjusted life years, to evaluate this? So the whole programming for 2021 is based on the number of DALYs what we are going to generate when we go to half of the India's district. Tata Trust and the Tata Fellows have been doing some remarkable work on ground under the Swachh Bharat mission. We are also a very big partner. We have done plenty of work like Tatas have done, although we are nowhere closer to the magnitude and the depth and breadth of work which is done. But we are very excited to learn from Tatas, how they have put the Swachh Bharat, the mission people into the district level and the sub-district level, the Swachhta Preraks, and how they have changed the landscape in a record time. There are a lot of learnings, cross-pollination from the TB program, which was the RNTCP, Tata's program on Swachh Bharat, or, the program which is done by Airtel Bharti and the Vodafone on digitalization, and some of the global best practices. I will not name here Gates and others, but they are super, super big in this domain. I will talk about my, the fellows whom I am working with in India very strongly, and I believe in their work. And then again, this 50% of the aspirational districts will be covered by the power of partnerships. I am not going to do it alone. My partners are also not going to do it alone. There will be people like Mom Pressos of the world. There will be people who will be doing it online, offline, a set of researcher. I also, saw, Kamalji, one thing very interesting. I met more than 7,000 doctors and 22,000 approximately nurses and the paramedics. I asked them how you calculate the Z-score of a kid who gets admitted to the nutrition rehabilitation center. Z-score is basically to be calculated to see the SAM measurements. It's a severely malnourished kid or the moderately malnourished kid, etc., etc. Calculations are so tough. They come up with a big chart. They see it. They use their phone. It takes them 15 to 20 minutes. उसके बाद में भी, in Hindi I'm telling you, बच्चा 111 सेंटीमीटर का अंदर जाता है और जब बाहर आता है तो 105 सेंटीमीटर का रह जाता है, which is not possible in any ways. So the data metrics and all these things are very important. So we're working on the technology bit to take it to pan India, where based on 3 or 4 features which are visible on a child's body, you can actually ascertain the child is actually a ma'am child or a Sam child, and you can immediately start the intervention. And you should not wait for the lengthy algorithms and other things. So that's the beauty of the artificial intelligence. If I have 15,000, 20,000 kids whose parameters are actually mapped there, I can see the child edema, I can see the color of the hair, I can see the color of the eyes, and how the nails are. By this visual representation, actually, I can make out like, the Z, how is the Z score or anything like that. It's still under the trial phase. As in, totally loving Make in Bharat, Make in India concept, we thought like, let's do it in India, but we also learned what's happening globally. We reached out to some of the partners of so-called big UN, UNICEF and all. The cost involved of just doing the trial in India with them is so huge. Therefore, I love my partners like Tata's and others. The philanthropy is at the heart. It's not a business. I reached out to more than 5 international players. Can we beg, can we borrow that technology, and can we pay you something for those patents what you are just trying, which are still not proved? The cost is so enormous that will eat my half the CSR budget.
Thank you so much, Ravi. And I just love your passion of, doing all that. And interestingly, you have given a good vision for scaling up something which you did at a small scale, but at the same time using technology, power optics, all the buzzword, the keyword which have come out from this session seems to be getting implemented in that. Sorry, gentlemen, we are running out of time, so I'm not, coming for another set of round of, inputs. But at the same time, the theme which have been set by the you people will be carried forward by my co-panelists and also our chair of Women and Child Health, Dr. Hema Devakar, and some of the doyens of technology and also CSR who are going to join us in the next session. I would just try to take 1 minute of yours, since most of you are here, and to make a slightly personal request. We had a press conference today with the Indian Medical Association demanding for a memorial for the around 1,500 plus doctors who lived their life during the war against COVID-19. And during that time, we also came across a lot of stories of those doctors who were, their children are now, both parents have gone because of that. And IMA has started a fund for them to support those children of those health workers who died saving our lives. So it is just my request that under your CSR, if you anything can do for them, it may be tactical, but it is much needed. Please do, if you can do anything for them through IMA, Indian Medical Association, and their fund to help those children, those families who are now bereaved and have lost maybe the sole breadwinner of their family in this fight against COVID-19. With this, thank you so much for joining us on this inaugural panel. We did not get Dr. Bhaskar Chatterjee. I'm sure he will be joining. He was in jury also, so he will be joining during the day, and we will get to hear from him also. Now I'll pass it on to Dr. Hema Devakar. Over to you to take this discourse forward. And we are looking forward to see some wonderful work of many organizations who have been doing tremendous contribution to the health of our country in the evening today, and recognize many of them. Thank you so much for being with us.
Thank you.
Thank you. Thank you very much.
Thank you, everyone. Thank you.
Namaskar. Thank you, Kamalji, and my heartfelt congratulations to the brilliant panel, which has just concluded with many, many more insights into what we can do as a part of CSR, which is typically as a corporate social responsibility, but C is also for a collective, and the philosophy of connect and collaborate very well demonstrated by IHW Council as always. And S is not only for social, but sustainable responsibility, because it's often said that well begun is half done. Yes, ladies and gentlemen, it's often half done. That is the problem. It's so easy to begin something, but to sustain it, to scale it, to make an impact, there lies the challenge. So we have a very brilliant set of panelists in a panel which addresses how we have connected today in the COVID pandemic through technology. That is the power that we have harnessed, and any CSR activity requires the money. It has a vision. It has to get into action. And when you do implement it, you need some way of seeing the impact of where you have done what, and seamlessly the technology seems to be holding the bridge, the thought process and the action, and followed by the impact. So we are going to see in this panel today how the CSR implementation and the outcome that is expected can be tapped through the power of technology to learn your lessons, to get your big data, to check out whether you're on the right track or not, and see how we move forward. So I welcome on this panel, fondly on my own behalf and on behalf of the IHW Council, Kamalji and the team, Suja Warrior, who is the Corporate Diversity and Inclusion HRD Head of the Infosys Limited. Hello, Suja. Welcome to the panel. Sakina Backer, who is the Head of the CSR at the Philips India Limited. Kumar Anurag Pratap, the Vice President of the Digital Inclusion and Sustainability Leader at the Capgemini India. Nidhi Pudir, who is the Director of the HCL Foundation. And last, one of our very favorites, Raghavendra Prasad, the founder of Step One. So let's take that first step with Rags, as we very fondly call him. Story from rags to riches, if I may say. And the richness is in harnessing the technology for the benefit of mankind. Raghavendra, the first question to you. When you took that step one, knowing fully well with more than 2 decades of your industry experience, that here is an opportunity in the challenging times of COVID-19 that you can turn something around to connect and reach people where it is needed. So it's like a chicken and egg kind of a situation. Was COVID waiting for the technology to be exploited? Or was the technology always there and you wanted to explore it, but you didn't have it? So what has been your experience with Step One, both in the waves that you have made in the COVID-1 and COVID-2 waves, if I may say? Raghavendra.
Yeah, thank you, Dr. Hema, for that warm introduction. So the Step One was actually born as a not-for-profit from experience of starting companies and running them and scaling them. So it was born by a team of technology entrepreneurs and founders who have, who don't, at least I don't have, and most of the people who we got together to build Step One don't have much of a non-profit experience. We all have used technology to solve people's problems in a commercial setup, and we are very much used to running startups in a very fast-paced, fast growth environment. Right. And we knew that technology is going to become extremely important in this fight against COVID. All forms of technology, but particularly communications technology, which is very important to start by bringing all of them under one roof, or bringing them to a physical location. And technology was the only way to make that happen. Yeah. And in fact, if not for technology, we wouldn't have we wouldn't have been able to make the kind of impact that we did. Just in the second wave, we have been able to provide 3.6 million people with access to doctors, 3.6 million teleconsultations. And that's the kind of impact that a lot of nonprofits, which are traditional, who don't use technology, strive to do in their entire lifetime, right? We've been able to do that in a matter of few months, basically because we made technology as the core of our reach out to people. So doctors who are consulting and providing these free teleconsultations to the COVID affected patients, they are able to do this in the comfort of their home, which means that a larger number of doctors can volunteer. They need not fear of getting exposed to the virus themselves. A larger number of medical students, nurses can participate in this effort. So I feel technology, if harnessed in the right way, can go a long way in providing relief. And I think a lot of I feel any organization, whether it's a not-for-profit or for-profit, if you're able to clearly define your goals, and if you're able to systematically work towards achieving those goals, and use every management principle that is required in a non-profit setup, you can actually scale very fast and have a very huge impact, like it has been demonstrated with Step One. And but the key thing which I have learned over the last more than a year or so fighting COVID with Step One is the kindness of people. I think there is an inherent good nature among thousands and thousands of people. I think there have been over 25,000 people who have been associated with Step One, doctors, medical students, nurses, and also normal citizens, corporate employees, CSR organizations of various corporates who have seconded their employees and encouraged them to participate and support on this platform. Right. The inherent kindness in the society has been in a very, very large manner channelized to some good work via Step One. And I think that, I would say, is the key learning. The more easy you make it for people to participate, there is and use the latest technology to enable and give them comfort to do that, they will participate more and more.
Ravindra, two small follow-up questions on this. Beyond the COVID era, COVID, of course, doesn't seem to be a full stop. It's a continuum. We have all learned to accept it and we will manage. But beyond the peaks of the COVID era, how sustainable and impactful do you think the Step One with the kind of work that it's doing, it will continue? And how, more important question is, the kindness. It was only in the crisis that people rose up to the occasion, or how do you think the kindness also could remain sustainable? What is your take on that?
Well, I think we have the scale that we have attained is potentially unparalleled. It's still yet to be seen whether we'll be able to reach this kind of a scale in a non-pandemic scenario. But what has clearly proven is that public health delivery via technology is something that is here to stay. You yourself have been a pioneer in use of technology in public health, and there are so many initiatives that you have yourself taken up, and all of these are at a very early stage. It will require a lot of effort. For example, women's health, right? There's so much. I think we are in a unique era where, practically all of India we can individually reach the people via technology, right? We can have a one-on-one conversation with them. And this opens up so many possibilities, and use of this opportunity to communicate the right health messages is here to stay, and it will only get enhanced as we go forward. And public health is a lot about the right communication at the right time, and hopefully we will public health we can use technology to enhance public health and focus on the preventive aspect of healthcare, and I am hoping that this will only get enhanced. On the kindness part, I think we need to figure out a way to blend volunteering with full-time people, and I feel that is very much possible. Several organizations have done that. I think Gunj is an example. There are so many organizations which have done that. I'm myself learning, given I think MAD they have done that extremely well. In fact, they have done a 100% volunteer model. So even CRY has mixed volunteering with paid people, and I think it will continue in that manner. Getting the right mix of paid and volunteering post-pandemic will become very important to keep it sustainable.
Right. Thanks, Raghavendra, because the two words which you used, the cry, people were crying out there, and some mad people, some crazy people who thought who could reach out to them and help them, did it all. And more power to you. In step one, many more steps to go. I agree. And it has been a necessity of sorts in the pandemic, which has given a very unique experience to everybody who has been a part of it on both sides, the provider sides and the healthcare seeker side, which have experienced the timely connect and the necessary actions, which have transformed many tension-filled moments into life-saving experiences. So hearty congratulations for the initiative that you have started, only waiting to be scaled up and remain there for ever and ever. Thank you, Raghavendra. We shift now to Suja. Suja has been, has seen both worlds. Many initiatives in the metros connecting to the second tier, third tier cities, and even the remote tribal areas. Suja, I want you to say about the exploratory opportunities, the tremendous potential of getting the reports onto the doorstep of the doctor from any part of India with the help of technology, whether it's CT or MRI. You need specialists to interpret those reports which lie on your desk, and you can't reach there, so access is a problem, but the technology enables it. So can you just reflect on some of these examples which have made a difference to the healthcare, the reach, and also the benefits of investing the corporate funds into initiatives such as this?
First of all, namaste to all of you. I am very thankful to Shalu, Kamalji and all others, Hema, for getting me in this platform, because I am with some of the most efficient and eminent panelists here. Thank you so much for making me a part of this conversation. And having said that, I would like to say that if you look at the pandemic started in the year 2020, Infosys Foundation is the first CSR body came forward and said 100 crore for the pandemic relief work, rehabilitation or whatever. So the thing is, at that point of time, we were not even knowing what exactly is happening, what is the way we can contribute. And we have maybe at very initial stages, nobody had any clue, and we all thought that within 3 months we'll come back to office. But that is not what happened. And we found that on emergency basis, we were set up hospitals. I can say that Bowring Hospital with a separate ward for almost 140 patients and 140 beds. Thousands of people got treated. There are Chinmaya Mission hospitals and then Ramakrishna Mission hospitals. Lots of hospitals were supported by the foundation's work. And that is maybe the physical infrastructure and support system at that point of time, including the salary for the staff in the hospitals and all the food, nutrition and PPE kit and you name it, oxygen supply and all kinds of things we have provided. But having said that, the technology is the space we are in as an organization. Infosys is basically a technology company. We are good at it. So we all know that to scale up any initiatives, we need technology. And I still feel that Of course, I am a person who loves to work on the ground, and my contribution during this period was very minimum. Otherwise, I would have been in one of the areas where I will be working on the ground. Maybe in the initial stages, I worked for 10 days or something for packing the food for migrant laborers and traveling to West Bengal or somewhere in these railway stations. We were supplying food, maybe supplying food to some of the local community and supplying the kits to people. And later, I was a part of the vaccination drive in the city. I was sitting and I wanted to experience the what is called the exposure in the COVID time. In spite of, like, I did not even have the vaccination done at that point of time. Still, I wanted to be a part of it. But later I found that that is all the basic things which I could do as an individual, but organizations are really working hard on this space and their contributions are really big. And most of the companies have contributed in a big way to this particular period. And step one is something which I was like a kind of checking every other day what is happening. I even wanted to contribute some way or other. But I wanted to say that in that period, what I learned, or maybe any other citizen in India across the globe learned, the space technology. Over a period of time, we all become tech savvy, and
Suja, maybe if you shut down your video, you may.
code, postal code.
Yeah.
So I was so happy that, okay, this is the technology enablement. And then the telemedicine services. I don't have to go to a hospital during this COVID time. And then the e-pharmacy, a thyroid care person, the laboratory person is coming to my home to check the blood test. And the report is coming in the WhatsApp or email. And then there are X-rays or MRI scan, radiology, and all kinds of things which is happening with a click of your mouse. And this is something which I felt that this is the power of technology, even though I am using. But at the end of the day, what I felt is, of course, the technology is powerful, but it is applicable only for the haves. There is a set of people who are not having any of these things. Especially I am talking about a country or a state where it's supposed to be the 100% literate. There are places where technology is not still available. There are places where they cannot even access the very minimum phone with no touch screen. I'm not even talking about the touch screen, the regular phone. They don't have the accessibility, they don't have the electricity. And I know that there I lived for years for working for the community where electricity is still a dream. Even though many people have that mobile number with the 20 rupees, 30 rupees recharge they are doing. And here I am sitting in a city, I am seeing the development, I am seeing the technology enablement, I am seeing the people who are using a mobile for reaching out to anything, everything. But I think as a country, as a person, as an individual, as a group, we all have to work towards getting those have-nots into the have space. And the community still have a huge divide. And for me, of course, I am so privileged because I am working in a company with all facilities. My salary was not cut. My food was not reduced. My facilities were not at all interrupted. I was having everything. But what exactly we wanted is all of us have to contribute something to make everybody inclusive. Especially I am working in a space called the diversity and inclusion with disability, and LGBTIQ and gender is one area which I am focusing on now. I wanted to see all of us are inclusive, and the collaboration and commitment towards making the place inclusive and a healthy nation is something which I am really dreaming for.
I wish, Suja, you will win, because to win, you have to begin, and you have begun on a right note. Because, see, the haves and the have-nots you're talking about, I'm sure it's based out of the experience in the tribal areas where you have actually seen that they don't have any connectivity and it's very difficult anyways, even for the physical access, etc. So presuming that one day we will reach there. One day, let's just imagine a situation where everybody has the reach to the technology. Still, do you see some challenges in the mindset of people, and also the learning curve for, those who are not habituated and those whom we typically call is not so tech savvy. Many of the doctors also, we know that they are not just initiated into this. Do you see that as a huge challenge, or do you think the generation next is anyway, like, they're waiting in the wings to take over? What is your
There is
take
a
on it?
change in the mindset. There is a change in the way we are thinking. But I still feel that when I look back, like the way I worked in the tribal areas, we used to have the mental health camp. I was a part of the thing. We used to have 1,000 people, 1,500 people coming to a camp for getting the medicine. So for the slips, we used to write the slips, and the people are illiterate, they can't read it. What we used to do for a night medicine, we will create a picture of a moon, or daytime it says full moon means night, or maybe in the sun for the like 12 o'clock medicine. And that was the way we used to work. And that time it was so, even today it is a big challenge, that communication is a big problem, because for any time there is a natural calamity can happen, a flood can happen. We won't be able to reach out to the villages and say that today the camp is not happening. And then fortunately, some of the places we have access to mobile, so the communication is becoming slightly difficult, improved, and we can able to tell them that okay, the doctors are not coming today, may not be the camp is happening. But still, I feel that the internet is still a problem, and also the public health centers in those areas are not equipped with enough medicines. And of course now the technology can enable them with the training, required training, or maybe a consultation through telecommunications, this thing. But still I feel that there is a touch and feel of a doctor is something which requires now a caring nurse, or maybe a caregiver next to your bed, or maybe a doctor back on your, like that kind of a feeling is also making the hospitalization, which is good. And of course, like we don't have to go to a hospital for many things, but if you are in a hospital, the doctors, I feel that the doctors and the teachers made a huge impact in our life during the last 1.5 years. And I found that all these nurses or the technology not even available, they become all tech savvy in overnight, and they become the tech savvy heroes overnight, especially the teachers and the medical staff.
Yeah, excellent. Thank you for bringing in that point about the touch and feel, because though we are on the video consultation day in and day out, there are many patients. The moment the lockdown is done with and the unlock, they are very eager to queue up to see us in person. So I think that does make a difference, and hybrid seems to be, the way forward. So just touch point, come physically only when needed, but there are many other areas and issues where several unnecessary visits can be avoided, saving costs, saving the time, and also making it much more convenient. So it's a mix of both the traditional way of dealing as well as the new wave of technology, which is the good blended learning that this COVID pandemic has given us. Thank you so much, Suja. Next, we move to Anurag ji. The key word that I want to focus with Mr. Anurag Pratap, who is the Vice President of the Digital Inclusion Sustainability in the leadership position in Capgemini, is your strength lies in the long-term strategic planning and vision building. So, in your experience, about 5 years ago, when this whole technology in the Capgemini tech-savvy people, it was almost a given that it's got many pluses. Okay, now the new wave has expanded the reach of the tech-savvy population, and everybody is, onto it. So, long-term, sustainable, best uses of technology. What is your vision, sir?
No, the point is there are 2-3 things. One is that I can see Nidhi there, I can see Sakina there, and I can see Suja there. All three come from tech spaces. So for us, tech is our bread, butter, and omelette in all possible sense. Whether it's 5 years ago or 10 years ago, this is where we got our bread. This is the place where we got our omelette, sauces, whatever you want to call it. The canvas is changing, and everyone will agree and also in the sense recognize that requirement has changed, tech has changed. I'll say the character or contour of tech has changed in all possible sense. What has happened in the last 10 years or so is that one can witness to India in all possible sense. One India which is very high on tech, which is very high on the expertise, skill set, knowledge attached to tech. And this India is using all these to access all the opportunities which is there due to tech, whether it's when Raghavendra was talking about the Telmed, or when Suja was talking about some of the things. This is the India which is high on tech, is accessing all these opportunities. There's a sizable India which is lacking. They are way behind the tech skills, expertise, knowledge. And that's where I'll say huge amount of work that not just Capgemini, but I'll say SCL or Infi or Philips, all these companies where the tech is the key word they are trying to play there to ensure that we get larger number of people who appreciate, acknowledge, understand, and then apply the tech. So that's one catchment of work that's happening there, and happening there in a big manner. And I'm not going to restrict myself only to Capgemini, because I'm like, this is the ecosystem play that's happening there.
Right.
And then the second work that has happened there and happened in a very, very sizable manner is the work on solution development, on application development, where from, I'll say, using AI to what is called diagnose, reading your reports, to, in the sense, getting into a small center to get all your tests done, then test reports getting by default sent to designated doctor, and doctor studying that particular thing. There's a huge amount of investment that has happened on, I'll say, creating solutions and creating applications to ensure that you get the benefit of scale reaches out to people. So when Raghavendra was saying that getting 3.6 million people within few months is possible because tech, in the sense, acted as an enabler there, and that's what the role that tech is playing. So you'll find what is called online automated tests getting developed. I do find X-rays getting done using tech. I do find what is called people wearing devices, which is, in the sense, capturing your vitals. And these are the, I'll say, innovation that has captured the imagination of people. That's another element. And this is, in the sense, impacting a huge number of people. And this is reaching out to, I'll say, those last miles which were earlier difficult to reach out to. Tech is helping in that particular sense. Third, which has acted as an enabler in a major way, is the I'll say, cheaper data cost, which in the sense ensured that anyone and everyone can access some of these solutions that people are developing. And second is the speed of the data.
Yeah.
So, but today it's easier now. I remember the day when we were like 2 Mbps speed was considered to be a damn good speed as far as the internet connectivity was concerned. And today, if you get even 100, you are complaining, saying that, hey, I'm still getting buffering. So and that's where I'll say huge work that has happened both on the cost of the data and on the speed of the data, which has enabled some of these systems and some of these solutions to work. Create that connectivity that was needed to connect the masses with the health service providers. Fourth, which is, I'll say, I can see a huge role that, and it's linked with, I'll say, the IT companies also realize there's a huge business opportunities there in this particular sector. And the moment you bring in, I'll say, a business case to some of these challenges there, it in the sense, it captured the imagination of many of the, I'll say, business guys. And that's one of the reasons why you saw in the last, I'll say, 3-4 years, huge investment happening in this particular space. So that's overall, I'll say, the change that I have witnessed in the last few years. And what I can assure that coming another 2-3 years will be huge. in this particular space, and the impact will be at a level where if you are not digital, you are not available. Which in the sense means that if you're not, if you do not have, I'll say, digital presence, people are not going to believe whether you are present or not. And that's these days it's happening everywhere. So the moment you take Anurag name, or you take Nidhi's name or Sakina's name, people are going to check and on the internet to see who they are. Similarly, the moment they are going to talk about solutions, or they are going to talk about doctors, or they are going to talk about, I'll say, the revolution that has happened in health space, they are going to check and on the net. And if you don't have applications there, if you don't have a digital solution available there, you won't get the skill that Raghavendra was talking about. Yeah.
There are two little things again, Anuragji, which I want to quiz you on. You said business opportunity.
Mm-hmm.
The point of care devices, which are like the huge need, because even the semi-skilled or hardly any skill transfer is required to use those devices, but they provide such a fantastic bit of information from a remote place, and then it's so easy to use all those point of care innovative devices that are coming. So how do you foresee that as an advantage on one hand, and some flaws within itself where there may be some challenges in actually making the right kind of interpretations, the quality check of these devices, because a dime a dozen may just come through there, because the cost is again, a huge concern in our country. So whatever is available cheap they may, and then it may just get onto the circuit of misinterpretation, if you may call it. So what kind of challenges do you see, even if all these do come into force? Yeah.
Well, there has to be some control over some of these devices. It can't be, I'll say, anyone and everyone can come in there and start interpreting it. Because whenever you consult any doctor, they'll say that the worst enemy of theirs is Google for them, because people start diagnosing their health using Google there. And then they add, I'll say, anxiety on that particular thing, because if you go to any disease on Google, end of the day, end of the sentence or end of the blog, they'll be saying that this is fatal. You can die also. So from fever to, I'll say, any serious one, they'll say that one of the side effects is that you may die. And if you leave it open to anyone to come out with devices which is going to interpret, you are going to create huge amount of problem. Pricing certainly is India is a price sensitive market in all possible sense. So even oximeter, which is like 1,500 rupees to there was someone who was selling me, or they gave me a quote of 600 rupees per piece. So just imagine the gap that is available there, and you can also understand why something is being sold at 1,500 and why something is being sold at 600 rupees. So there's a huge need for regulating some of these spaces. But I also feel very strongly, Hema, that sometime market itself will regulate you. Sometimes the larger alliances will itself will regulate you. I don't think, and be very caustic, straightforward. Step one, or Capgemini or Infosys, we won't be able to operate in India on our own. We need, I'll say, huge amount of collaboration and huge amount of, I'll say, cooperation with each other. There's a need to build that critical mass so that we start deciding what is the right thing that it should be going there. Yeah. And let the market, let these kind of forums and these kind of, I'll say, platform, in the sense, put a stamp saying that, yes, this looks good, this is not good, this should go, this should not go. And there will be some heartburns here and there. There will be some, I'll say, frustrations here and there. But at the same time, in a longer run, you need to see that misinformation should not become another pandemic.
Right. Thank you so much for this very insightful and very, real situations which could develop in future, which we need to be guarded and plug it right at the start. So we now, whilst thanking Anuragji, we move to Sakina. where I understand that, Philips is working with a variety of social issues. We are just, largely focusing on health so far in the couple of deliberations which we have had. But your organizations, Philips India, I'm aware of the fact also that education, healthcare, water, sanitization, disability, skill development, and whatnot. So, as how ISW Council also believes, good air, good food, good water, and good health. It's a holistic, mix which just gets us healthy and prosperous in a way. So, again, taking the cue from Anuragji's thing of collaborations, it's good, but it's not always easy. And therefore, my question to you, Sakina, is these are clearly different sectors and segments, but all should merge to reach, a common goal that your CSR activity may have. So what kind of opportunities you've had to cross connect and make things happen on the ground, and what have been your challenges? Sakina.
I think what everybody said so far has been really great to understand from a viewpoint of what they would have faced from a technological point of view. Philips being a technology company, so always technology and innovation was part of our foray in CSR as well. So we never did any project, we didn't have a component of technology or digital innovation in it, to make sure that it is sustained, it remains for a long time, because we won't be able to support a particular initiative beyond a certain time. So what happens after that? But when you look at collaboration, the CSR law came into force, which is fortunately, unfortunately, only in India. So when you look at the law 2014 onwards, you see a lot of organizations working in silos. You see a lot of corporates struggling with how to manage those initiatives, how to make sure that they have the impact that they are looking at. Earlier, it was looked at more from a charity or philanthropic driven exercise, but gradually over a period of time, corporates realize that it's something that has become a part of the core competency that they have, how they link it with their business, how they have shared value in this particular aspect of doing social development through CSR. Now, when you look at collaboration, I don't think there's any other way for us in future. If we think that we'll be able to make a dent on anything that we pick up as a CSR initiative, I don't think that's going to happen. Obviously, you'll pick up and you'll do a small initiative for a small set of population, and a lot of things might change for them, and maybe have some sustainable solutions provided to them, but that's not going to be enough. So how do you make sure that those changes have a ripple effect and they are scaled up in other locations as well? So in Philips, we have a division called Access to Care. We work on access to care. Our motto is to reach out to 400 million people from the underserved communities. Well, underserved communities may have access to finances, but may not have access to services. So how do we make sure those services are provided to them? So Philips cannot be a solution for everything that has to be required on them. So we try to collaborate not only with like-minded corporates, but also with innovators, social entrepreneurs, and also non-profit organizations to see a mix. And you will see a lot of examples in the projects that we do that have technology as the base, that have service delivery also a component, because we cannot just say technology and just forget about service delivery. We have social entrepreneurs doing the stuff for us, which they have proved, but there's no taker for them. And we try to use and utilize their expertise into those innovative solutions provided at a particular location and try to replicate it. Now, when it comes to collaboration with corporates, we are also in touch with a lot of corporates who have very similar views of thinking. It's just a matter of trust. When two corporates sit together, so there's a first tussle of visibility. So is it my visibility? Is it your visibility? But I think we have crossed that path. I think we have crossed a path where corporates understand. If we work together, if we join hands, we'll be able to make a lot more difference, which is a lot more sustainable, and which can be replicated and scaled up as well. Obviously, considering India as a country, it is diverse. So you can't have one solution that fits all. You will have to customize it. You'll have to make sure that it is for a specific population or a region. And that happens with those discussions happen. Obviously, they are longer duration discussions where you talk collaboration, you talk about what is there, which is a part of their core competency, and what is there, which I have as a core competency. So when you look at examples of the diverse work that we do, whether it's education, healthcare, skill development, our core is healthcare, because we have skills in-house, which we can utilize in our social space as well, which help us a lot in drawing certain solutions and technological innovations for those CSR initiatives. But we also make sure what is there with other corporates which they can put into practice, where they can help and support and inform people. So healthcare becomes the core. While we have education in healthcare, we have skill development in healthcare, we have disability in healthcare. So these core components make a part of it, because you cannot just look at healthcare as only hospitalization, providing basic care. We talk about preventive healthcare. We talk about making sure that people are able to take care of their own basic health concerns. We also talk about service delivery. We also talk about telemedicine. So COVID was not a changing pattern for us. The only thing that happened with COVID was because we had to cut short certain projects because they were not permitted to work on ground. So we diversified those projects into COVID support. We made telemedicine centers, which may not have been there earlier in the project, but we made sure that they're up and running. So I think that was a collaboration with the partners. So that helped us quite a bit reach out to those areas which we couldn't been able to do.
Yeah. So another question to you, Sakina. Philips as a organization focuses a lot on research. So how they put in their energies onto research to identify the needs, the gaps, and come out with innovative devices, and then get that implemented. And where does technology lie in the midst of all of these?
See, I think any innovation you can't do without research. So everything is research based. So we have research centers which are very well known. We have in India, we have one in Bangalore, which is called Philips Innovation Center, where all the research usually happens. So while we are making innovations for the bigger hospital requirements, but we're also making and trying to create solutions for last mile. So just to give you an example, we have a solution called MOM, which is maternal obstetric monitoring, which is a solution which is required by women the day she conceives till the child attains an age of 2 years. So it's an entire pattern created for mothers in villages, rural areas, in small towns, and through ASHA. So where we trained ASHAs. We did obviously research follows a understanding of testing the solution. So we tested it in Karnataka, in Yadgar district. We did a test with 5,700 women, and not even a single maternal mortality during the testing year.
Excellent.
And it was a solution that was meant for the last mile. So it is a part of something which is a part of the business, but also making sure that it is reaching the last mile, not getting to one section of the society.
Right.
And research is definitely not only part of the business, but also CSR as well. So anything that we do, it is drawn from a particular research or need-based analysis that eventually leads to a particular initiative being implemented.
And do you cite an example where you started with some idea because you really felt that need? That's a huge gap there. And then there's a lot of, time and energy, money went into that research, but when it actually hit the ground, it did not work.
Well, yes, I'll say we're still struggling with MOM because it is working wonderfully, because we did it here, we started it here, it is working wonderfully in many countries. But in India, it is a little bit of a struggle for us because it's the acceptance that you have to understand the solution and the usability of it. Yeah. So the acceptance is there. Unfortunately for us, ASHAs and A&Ms was supposed to do it. They're anyways overburdened. And then giving them a technology, training them, making sure that besides the work that they're doing, they should make sure that this technology becomes a part of their core. They understand, they agree. It's going to reduce a lot of their workload. It's going to reduce the data entry thing as well for them. But I think that's something, I would not say I'll say it's a challenge, but I will not say it's not something that we won't overcome. Right. And it's an extremely innovative solution that we had created because mother and child is the main focus everywhere. When you look at even the Ayushman Bharat, you look at health and wellness centers, you look at mother and child as the main focus. Everything is around them. So what are you trying to do? You're trying to make things easier for them. You're trying to train ASHAs gradually on these aspects as well. So I think that is something that we are pushing, and we are trying to reach out to those and making sure that we close the loop, not just provide the solution, but making sure that the people who are going to use it are trained regularly on the usage and making sure that there are no discrepancies in terms of capturing those details that are required for a healthy mother and child.
Excellent. Thank you for focusing on that behavior change and the skill building. Both of these need to be in place to continually wait, because that's one wonderful moment when they realize that comes in so seamlessly that they can't do without it. So that is the stage that they have to reach, because even we have seen in our own settings in the metros as well, very many educated assistants, they're so used to manual documentation. You ask them to get onto the electronic mode. It is, in the healthcare segment especially, there seems to be more of a barrier than the usual as per our experience. So thank you, Sakina, for those wonderful inputs. Lastly, now Nidhi, who has been so patiently waiting for the question that we need to pose to you. She's the director of the HCL Foundation, Mother and Child, very important component. And then we move on to Nidhi, who has been working a lot on the actualization of the child's right, including the policy and implementation work on child protection. How does technology fit into this bit? The children, their rights, and the issues around that.
Right. No, thank you so much, Hema, for all the interesting deliberations. And I think a lot has been said around technology. And I think it's a panel where we are talking about health in general. Of course, child rights protection is a completely different piece of work, I would say. And so far, I don't think, lots of good stuff has been said, but I just want to be a little bit of a devil's advocate here. See, COVID also caught us with a lot of surprise. It's not that we were ready, and little bits of technology we had here and there. We just played with it, and we've somehow managed to get out of this chaos. Of course, we've also supported a whole lot of command centers, coordination centers. We've strengthened the disaster risk response centers. We've worked with the relief commissioners, and we've got ventilators on ground and PPEs on ground, and got so many hospital beds and oxygen and everything, like I would say, things were moving at a jet speed, because the wave 2 was definitely a much bigger disaster than the wave 1. I'll come to the child rights protection piece later, but coming to the topic of this particular panel where we're talking about health, of course, technology is playing a role, be it telemedicine and be it, even the entire biotechnology sphere as we talk about it in the healthcare sector. But, eventually, if I talk about public health in India, and if I talk about the SDG goal number 3 and our own health policy, 2017, which is very clearly laid down the universal healthcare for all, as well as reduction of out-of-pocket expense for people, I think we are lagging quite badly. Let's kind of be very truthful, such that we really set some realistic goals and leave the business aside. I think as a company we have quite a number of technology companies. We're all doing quite well, and we're really contributing towards the global technology solutions, so as to say. But if I talk about the CSR in India, of course, we all have programs which are quite focused, and with our communities, we are doing quite well. But the unmet need, as we call it, especially in the field of health, that's way too high as compared to the solutions which are available or the kind of projects which are being rolled out. I think earlier, Raghav talked about the scale, which essentially is the issue here. And health, it really needs to be broken up. Then health is not like one particular issue. If you really break down health into, different lives. Goal number 3, SDG goal number 3 is quite clear about well-being of all across life stages. And I think Sakina was talking about the first 1,000 days. We recently finished a research in urban slums, and the data is so stark in eyes. Less than 3% children covered for deworming, less than 10% children being given the vitamin A dose, less than 50% children with complete immunization, contraceptive supplies failing, and this is, I'm talking about the urban communities. So while, yes, we can boast about the technology solutions, but what's the reach? What's the reach? What is the gap between availability, accessibility, and acceptability, where the utilization of healthcare function is a function of all these three? So there is definitely a huge gap for that. Not only corporates need to come together and work, and we are a big believer in the concept of convergence. So it's about having the public and it's a public health, and health is a subject of the state. I mean, there is a complete budget allocation at the state level, at the central level. Now, we should not do the mistake of mixing the COVID-19 response with the regular public health issue, because we are anyhow on several indicators, infant mortality, maternal mortality. I mean, there are states like, Uttar Pradesh, and then you do a state-wise gradation. I think there is a whole lot of work. Look at Northeast. I mean, we are working in PHCs in Northeast. We've strengthened under our HCL grant. PHCs, when we entered there, I mean, women had to minimum, travel for 18 hours to reach the nearest possible PHC for her ANC checkup. And then we are talking about 4 ANC checkups to be, and, consumption of iron folic acid to be seen, and tetanus toxoid, TT injections to be seen as a complete antenatal care package. Now, just imagine these situations. Telemedicine, yes, it provides solution, but health is a matter of personal touch. Health is a matter of well-being. It's a matter of rights of the citizens, where the caregiver needs to be in contact with the person who is availing these services. So I think overplaying technology will do harm in this situation. At the same time, where technology really has a role is the larger biomedical solution, biotechnology solutions. Of course, the whole hospital care system runs around that. But the public healthcare system, I think there are 3 points where we really need to, whatever we are doing in our own individual programs or even as together, I think all of that is great. But where is the scale needed? The scale is essentially needed in having the right primary data. Primary data also, which is available right now, is madly divided into rural and urban. Within urban, there are stratas. If I start looking for slum data, it's just available for 9 cities through NFHS. Why? All cities have one or the other way urban poor. I mean, we really need to have specific data on the urban poor, followed by larger access. The patient doesn't know, or the mother in a slum or mother in a rural area doesn't even know where she can go. So the larger awareness part, where media partners also really need to participate in a big way. I mean, you'll see a whole lot of advertisements and some of the compulsory ads, but none of the TV shows will show you, hey, walk up to this distance for your first ANC or the second ANC checkup. So I think those are kinds of shows, and other issues. I mean, I'm talking about mother and child health more, but similar stuff for geriatric care, similar stuff for non-communicable diseases, NCDs, which is really entered across. I mean, for the second time, I guess we have NCD data in the NFHS also being counted. So that's another. And the third bit where we really need to scale up technology is that making the caregiver feel as close as possible. So I think the telemedicine solutions, there is a ray of hope out there. But how do we really, and that's where, public-private partnerships are critical, extremely critical. We can all join hands and join with the state, but eventually the responsibility and the accountability does remain with the state, and that's where we really need to, I'm a big believer of convergence out there, and need to have that. So thank you so much.
Absolutely. Thank you, Nidhi. I know that Anuragji wants to respond on one particular point, but I would also like to respond, yes, mother and child health care, public-private partnership, because when you're saying the NFHS data, whether it's in the slums or whatever, it is only the government data. The private hospital data is also completely a blotch. It is missing. So in my mind, the technology can actually help us in all the 3 prongs. One is the advocacy to raise the demand. The people, the girls, women should know what is their right to, access and what they need for themselves, even in terms of vaccinations and the number of times of ANC care and what they should be given, etc. So the advocacy is, like media, the technology, like WhatsApp University, everybody is aware of, and Dr. Google, as mentioned by Anurag. We have to be out there in the space as professionals to tell the right kind of messages, authentic and, the myths and misconceptions busted. And the data, yes, it is lacking. What you have found is not complete, but things cannot be better than that. They are maybe worse, but they are not better, as how, the 10% blood test for these, and instead of 4 checkups, 1 check, and this is the deworming has not happened, etc., etc. So that is for sure. So how can we make it better? There again, the technology driven data is actually helping us, guiding us, making us learn the lessons, showing the mirror to us. See, your perceptions may be different, that in your ivory tower, you're doing a great lot of work, but the reality out there is quite different. So the research part of it, the data, even if it is just in some parts of the data, just gives us a clue that here is where you need to invest your energies and time. And the training or the capacity building, which has been so well alluded to, again and again, reinforcing, we generate the demand, but we have to strengthen the quality of the supply as well. So all of these things, I do believe, that can be packaged into, a better reach with access through technology. And then, as you said, let's connect and let's make it happen. Anuragji, your response.
No, I know I'm hitting at, this is the fag end of the call, but there are a few things which I don't agree, in the sense that India is a huge country. India, you can't have touch point all the time. Let's move out from the whole romantic idea that a doctor should be there for every patient, and every doctor should personally touch that particular individual there. The problem is that we are huge. There are too many people. And somewhere tech need to, in the sense, reinvent itself, and there is one application work that's something that we are developing, where expecting mother, number of tests, you can do it using the device itself. You don't have to actually go to the PSC to get those tests done. You can use those reports and directly consult with the doctor. The point is, we can't ignore the very fact that this is a country where still a sizable population, you need to be explained that why you should get vaccinated. This is a country where a sizable population will still go on the street saying that, hey, you can't force me to get the test done. This is a country where you still have, I'll say, a civil society which will, in the sense, go out in the market saying that, hey, every person has a right to say no, even to the vaccination also. And in that particular space, there is a need to use tech to create or break certain myths, and in the sense also remove those physical touch points, boss, because we have lived with that particular fallacy for too long, saying that we need to create PSCs in every point, every place, and that's the reason why this is the state that we all are in right now. That's where I wanted to just add in there and pitch in there.
One small bit I want to add, Anurag, to your point, because when I said strengthen the supply side also, many of our girls and women do not find any value in visiting these centers, because they're just not, it's just they just come and go, and they're not even given few seconds, and the kind of it is a touch point, but it is not quality driven. It is not good enough.
This is taking 70% of your planned expenditure at the state government. If you remove these planned expenditure, you, in the sense, make it leaner and meaner, you can use this particular money to do some innovative work. Raghavendra, in the sense, talked about the 3.6 million. Can you do it through physical mode? And can we say that what they did was inferior to what the actual, I'll say, touch and feel will be doing that progression? That's a debate that we all should be getting in there.
This is a very exciting closure to this panel, because as intellectuals, we all should agree to disagree. Okay. That is where we are putting our minds really strongly with a clear intent of doing something better. And as we have always said, a collective directive to what best. Even then, of course, we will have to make course corrections as we go along, because scenarios change, our thinking process changes, the world is changing, as we can see right under our eyes, and we come together because nothing is right or wrong, and everything is needed in the due proportions. And always the philosophy in India should be something is better than nothing.
Yep.
If they cannot access anything at all, at least telemedicine. If they can come, okay. If they can use a remote device to check the baby's heartbeat, and the mom gets, little stronger into implementation, then Sakina, we should be much more happier. And step one, steps ahead, several more steps, and the long-term strategy inputs from Anuragji and the ground realities exposed by Nidhi and Suja, saying the best of both worlds. How can we bring together the haves and have-nots? So this has been a delightful churning of our brains that we have had in the last 60 minutes, which makes us reflect within ourselves about how much more and how much better we can do. But India is a complex country, but it is also a country of hopes, and it is a country where we have the courage and determination that we will be able to move the needle and change the healthcare ecosystem in the future. So on my own behalf and on behalf of Kamal Darayanji and the entire team of IHW Council, who's been doing an exemplary job of getting a variety of stakeholders together on a platform to think, because before the action, some thinking, some planning, plan your work and work your plan is the motto, and then we will together we can do, is always my closing mantra. And I really hope that we get together yet again to do something more, something better for this great country. Namaste once again, and may I now have the pleasure of inviting Dr. Nalini Kaushik for yet another very rare kind of a panel, which speaks of CSR for rare diseases. So Nalini will take us through in the next 6 minutes before we step ahead to the much awaited CSR award ceremony, so richly deserved by so many out there doing brilliant work. And we humbly recognize their efforts, appreciate them, and maintain our solidarity to do our best bit to get us moving far further than where we are from now. Namaskar once again, and over to you, Nalini.
Thank you, Dr. Hema Diwakar, and that was a really insightful session, and really great speakers we had in that. So moving forward, good evening everyone. I am Dr. Nalini, your host for the session. And on behalf of ISW Council, I thank all of you who joined us today for this panel discussion on the topic CSR for rare diseases. So today we have with us a very esteemed panel of speakers, who continue to make significant strides in supporting the rare disease ecosystem in India as well as abroad. Our panel comprised of Mr. Gopal Agarwal, Head Market Access Public Policy, Takeda Pharmaceuticals, Mr. Harsha K. Rajasimha, who is the founder and chairman of India-US Organization for Rare Diseases. He is also the co-founder for Organization for Rare Diseases India, and also founder and CEO of Jiva Informatics Solutions. We also have with us Mr. Himanshu Bansal. He is the Head Business Operations Rare Diseases Sanofi Genzyme. And last but absolutely not the least, we have with us Dr. Sanjeev Kumar. He is the Chairperson of Indian Academy of Public Health, Member Governing Board, National Institute of Health and Family Welfare. A very, very warm welcome to all of you, our experts, and also to all the viewers, who joined us today for this critical discussion on the role of CSR in supporting the rare disease community, and especially, supporting the patients in every which way that we can in the current moment. So rare diseases, a group of conditions that are individually rare but are collectively common, and at least 1 in 17 people being affected by it at some point in their lives. While India is yet to build a national database of individuals affected by such rare conditions, it is estimated that somewhere between 70 to 96 million of India's population is likely to be suffering with rare diseases in the moment. While India is not unique anyway, when it comes to incidence of rare diseases, however, the population demographics and the disease heterogeneity makes the situation really alarming. And recognizing this, in fact, recently the Government of India released the National Policy of Rare Diseases 2021 that clearly recognizes the resource-intensive nature of rare diseases hence recommended a critical role of PSUs and corporate organizations under the voluntary crowdfunding as one of the financing alternatives for patients affected by rare diseases in the country. So therefore, our today's discussion is going to be largely circling around the national policy and its specific provision on how can we leverage CSR in order to better support our patients, who have been waiting for treatment since so many years. So to begin our conversation for today, my first question is for Mr. Gopal. Sir, thank you very much for participating in this discussion. So to begin with, and setting the context of the entire conversation for us, could you please begin with briefly reflecting on firstly the nature of rare diseases and what really makes alternate financing options so critical to this category of conditions and specifically in the Indian context. Over to you, sir.
Thanks, Dr. Nalini, and my heartiest thanks, YHW, for touching such a topic which is so closer to patients, very patient-centric. When we talk whole of the world, but if we are not talking about patient access to treatment, as you rightly mentioned, the National Rare Disease Policy, which talks about patients and them. But yes, there are some critical challenges. But before we go into this, let me set some context why we need some optional crowdfunding or a CSR funding models. As you rightly mentioned, complexity of rare disease in India specifically is multiple-fold higher than most of the developed worlds. Some of the reasons could be probably our time to diagnostics takes many more years than the developed worlds, as we were discussing in mother-child session earlier also. We have 1.3 billion populations getting technology to get them diagnosed early. It takes many, many years. And even the percentage of people diagnosed is much lower because diagnostic facilities themselves are not open in the country. Then forget about the access to treatment and compliance to treatment. That's a very, very secondary stage. And as you rightly mentioned, more than 80% of our diseases are genetic disorders in the country. Maybe more than 1 in 50,000 you can say, with 70 million, definitely that's analysis plus in a country are there patients suffering with. And these are very debilitating disease which, if not treated timely, it will lead to significant complications in the country. Now, coming to the core part, as we say, rare diseases doesn't mean it's rare. First of all, let me say, if you are 70 million patients, it's not rare. But still, compared to diabetes, it's a relatively rare compared to diabetes or oncology. But still, for 70 million patients, government should think over. But people say limited number of patients, treatment options, drugs are limited. The cost of treatment is exorbitantly very, very high. Cost per patient could go into ₹1 crore per year, especially for group 3 drugs. There are 3 categories in rare disease policy. So for a country like India, which is still struggling to manage our big primary healthcare system, is still needing infrastructure. Mother and child still needs infrastructure support, which is not possible in primary healthcare centers. And India is investing heavily. COVID is a great example. We really tried to overcome. But when it comes to relatively, people say, can we deprioritize rare disease for the time being because highly resource intensive. Not only treatment, even from infrastructure, diagnostic, everything. So, based on all these things, critically important as the rare disease policy, I think it's a great step. First of all, let me compliment Government of India into this, and many other stakeholders really built the momentum to get this rare disease policy out, despite being COVID. So at least this is a very positive signal. Despite COVID, you have a first policy of rare disease in the country coming out. So these alternate sources really help us to long-term sustainable models. I think that's the reason why we need to have. Otherwise, if we just leave it to the state government, there will be resource crunches will happening, epidemics would be coming, and these are lifelong chronic diseases which needs long-term support. It could be CSR funding, primary funding, there could be financial models also, financing, or a patient support programs for multinational companies to make patients' life improving much better. So, because of resources, number of patients, I still feel there is an option, or I say it's a mandatory. I think we all should come forward and explore beyond just simple state funding or out-of-pocket funding. Both will not be sustained. Hence, alternate funding options are need of the hour.
Right. Thank you so much, Gopal sir. And I think you rightly pointed on, I think some very critical points. One is that, we call it rare. However, when we look at the incidence, it is really not rare. Collectively, they are really not rare. The treatment aspects and, when we individually count, there might be, certain issues which can absolutely, structurally we can figure certain solutions out. However, I think we need to change our perception of now continuing with giving it the rare, classification, first of all. Secondly, also you talked about the momentum that the stakeholders have really shown in India in last, very specifically 5 to 6 years, which has led us to, finally having a policy with so many rounds of discussions that, all the stakeholders, came forward with. Moving on to, our next set of question, it is for Mr. Himanshu Bansal, because you represent the same kind of ecosystem that, Mr. Gopal represents. And somewhere, I think both of your, the environment that you represent, your companies have really, supported a lot of patients, and, you continue to work in very close association so that, in whichever capacity you can, we can, support the patient, be it from the awareness side or be it, provisioning treatments, wherever applicable. But, before I move on to my question, I would just like to, point out a data which is from the Government of India sources, and it talks about that, the estimated cost of treatment for most of the genetic disorders in India, it may vary from 1.8 to 17 million. Now, this is a formidable challenge for a country like India. And hence, of course, we all, kind of continue to believe that we do need certain alternate financing mechanisms. So now, if this is the case, that how much of difference do you think a policy that has recently come up, specifically the National Policy for Rare Diseases, and it's one of the provision of alternate financing can make a difference, specifically in reducing the cost and the access barriers for the patients?
Thank you, Dr. Nalini, for that insightful question, and I'm very glad. First of all, thank you, the IHW Council, for inviting me for this particular session. I'm very glad to be here talking about the rare diseases. I have been working in the rare disease for about last 12 years. Specifically associated in the clinical development and as well as in the public policy, and then now into the business operations part of the rare disease. I think the first piece when we look about the rare disease, we talk about 8,000 rare diseases, and then we talk about India has identified about 350 rare diseases. But largely, if you really see the whole perspective of the rare disease, there are only handful of rare diseases, which is about 4 or 5% for which, first of all, the treatment is available. Absolutely. So I think the most important piece which has to be remembered, while somebody could say that, from the extrapolation of the data, that there are 70 million to 96 million cases in India, and there are, some 300 million cases in America. But at the end of the day, we are talking about, when we are talking about the crowdfunding or when we are talking about the CSR, we are looking at those 4 or 5% of the patient population of the extrapolated data, in terms of, providing the access. And largely, if you really see the whole policy, which has very recently been, in the March end when it got released, the most important aspect is, the group 1 and group 2 has been very, very well taken by the government. When we talk about the group 1, which is like a one-time treatment, even for diseases like lysosomal storage disorders, mucopolysaccharidosis 1, or many other diseases which needs one-time treatment, BMT, 20 lakhs, one-time treatment cost, and not only the BPL patient population, but it is also covering the, under the Prime Minister, Jan Arogya Yojana scheme, that the whole 40% of the population is getting covered. The group 2 is basically, it has also been asked to the, the state to consider the metabolic diets or the hormone treatment. Now, the third piece, which is the most important piece in the whole national policy, I would say, while we are saying it is a policy, but it is more like a guiding document. And, there is, what we say is that there is definitely a positive intent of the government, towards the rare diseases. When we talk about specifically the group 3A and 3B, the segregation between 3 and 3B is that government acknowledges with the expert committees that there are certain diseases for which there is a long-term evidence on the outcome for certain diseases. For example, the treatable lysosomal storage disorders, specifically, the Gaucher, Pompe, MPS, various types, and then Fabry diseases. And Group B is more like the Group 3B is more like, where there is less evidence, which is more like categories like DMD. Crowdfunding, let me put it this way: crowdfunding is definitely a very welcome step in the whole, from a policy perspective. This is what I would say is at par, the Singapore model, which is, in the last 2 years, Singapore also came up with this kind of a model of crowdfunding, where any voluntary or corporate funding of $1, the government will give the $3 into the same, the rare disease fund, that they have created. So while we are at, it is kind of very, in a nascent stage, but this is the way forward, at least for the long-term, patients who would need the lifelong treatment, and these are very expensive nature of the treatment. And when the other part of the question that you said that, the expensive treatment, there are three pieces to it. When we talk about the expensive nature, why this is so expensive, and why it is, when you have, as the weight of the child would increase, the treatment cost would increase. So, why this happens? Because there are three aspects. One is the research and development, which has been put by the pharmaceutical company or a biopharmaceutical company. It's like 15 years of research which goes in. Then the second piece is, the complexity of manufacturing these complex proteins. That is the second piece. And the third piece is the rarity of the disease itself. I can tell you just one quick example. A Gaucher clinical trial for one of our oral product. In the entire India country, we had 5 centers for a phase 3 clinical trial, where we were looking at 26 patients globally. For the 26 patients, we went globally to 34 countries, and India contributed only 1 patient. Can you imagine? India contributed only 1 patient in the phase 3 clinical trial of Gaucher disease. And the centers were, all India Institute, CMC Vellore, all the very renowned. So while we are talking about that there is no dearth of the patient in India, but we have to be very mindful of the fact that there has to be a selective patient population which needs really the treatment. And I think this is the first very important step which the ministry has also come up. So, that's my initial perspective onto your question with regards to, the CSR funding and
Thank you so much, Mr. Himanshu, because I think you've put like some really extremely important points in front of us today. And firstly, I think one, that, the policy itself, it is really not a policy, but rather more like a guiding document. Now, which is good in a way. However, now the question that hangs in front of us is that, the enforceability nature. Now, because there is no, enforceability mechanism, or the articulation is also such which is recommendatory in nature. Now, the question is that, how do we implement, and who needs to come together now in order to take the implementation forward? Now, that is one point, I would like to highlight. Another is, yes, there are different categories of rare diseases. Policy has, I think time and again, the draft policy and now the final version also, we know now, there are different categories, and, which also is determined by the kind of treatment they require, and, whether a child or a patient would be put on a lifelong treatment, whether it's a one-time treatment, or, nutritional or, metabolic diets, etc., which are required. Now, circling back to that particular point, the provision which is made under the voluntary mechanism in the policy itself, it says that majority of the fund has to first of all cater to the patients, which is from the treatment perspective. If there are any leftover funds, it needs to go for research. Now, my question is that, yes, the provisions are really brilliant, and my question is actually again to Mr. Gopal and to Mr. Himanshu, both of you, that yes, the provisions are really good. We have at least narrowed down on one alternate financing mechanism here. But how do we ensure that, who is going to implement it, first of all? And how do we ensure that, which category of patient are we selecting there, right? Because if somebody requires a lifelong treatment, is that the model we are going to be adopting? Or, What are we going to do there, and who gets to decide that?
Yeah, so let me take the first part of the question, and then probably I will ask my colleague Gopal to add to the perspective to this particular question. So the policy says about that there are 8 center of excellence, and AIIMS is like the AIIMS Delhi is like the nodal center in terms of coordinating with all the other center of excellence which have been identified in the policy. Now the whole perspective is that how would you create the digital account in this? First of all, the first pathway which has been decided is that you need to create a digital account in this center of excellence. The second ask in the policy, which has been clearly mandated, is that through the center of excellence, the patient application will be posted on their website, which means that there will be a profile of a patient which will be on the website of these centers of excellence, which have been initially identified as the 8 centers of excellence under the policy. And based on those patients, I think the corporates or the individual person can contribute depending upon which patient they really want to donate the funding. The question and which is, again, as I said, that it is kind of very evolving. It is just kind of initial release of the policy. When it policy for me, when you come out with a policy has to be inclusive in nature. You cannot have a policy which has a mechanism of exclusion, which means that if for example, PGI Chandigarh is saying that, I have 8 patients, I'm just posting an example, that 8 patients to get the treatment. Now, how an individual or a corporate, would decide which patient to, provide the treatment, and why the other patient, would be left behind when it comes to the crowdfunding. So there are those burning questions that needs to be answered in terms of the selection criteria, in terms of what would be the treatment cost, what would be the long nature, and then we say the long-term treatment cost. What is that long-term really means? Are we talking about a corporate who is going to adopt a child for a 1 year or 3 years? Whether this is going to be what kind of commitment we are looking at? And what is the what is the government's role in this? So what the point is, they have identified the center of excellence, but at the end, the health is a state subject. Where is the state health department is going to play the role in this? What is the state health department role? How they would take that charge in terms of the funding that is collected under the center of excellence, like you mentioned in your question, that any leftover which is there in that account can be used for research and development. But I think the first question is that there are so many patients already waiting, as a potential candidates. We need to really see that the right amount of money is first gets accumulated through the voluntary funding, and then can be adequately used for the patient's treatment.
So, I would like to add a few points. Thanks, Himanshu. I think you rightly mentioned. And the one we have seen, what we have is an intent from the government through a policy, and which will evolve. We know some of the thoughts because we have been involved into this process and how we can really make. And some of the learnings are coming from COVID example. So one, there should be a dedicated point of contact at the ministry, because that's the thread which will connect with states, which we don't foresee. If you today want to go, who is the real person you can get hold in the ministry is not there. One. There is no clear defined, there is a process, but I still say, how is it happening at the ground, which we are not aware? Are these meeting quarterly? Are they evaluating? I think there should be a guidance to make it effective at the ground, that people will meet quarterly, the reports will be published in public domain, patients should know, all the stakeholders should know what's happening at the ground. Third, as I already Himanshu mentioned, I want to reinforce it, there has to be dedicated account, and there should be a lot of awareness. Policies come, but I still feel 70-80% of the actual stakeholders who are the beneficiaries at the end of the day, they do not know about the policy. Right. So the government has to really put a lot of signboards, education, awareness in primary healthcare centers. People should really know, if I do not know my right, I will never be able to exercise. If I don't exercise, it will go into a dustbin after a few years. But we have a lot of policies in our country, And the critical point is this, is that we should really make these people part of stakeholders. I still feel patient representations in forming these policies is still not that level high. Which is just very, very critically important to get them involved. And the last, when we talk about selection of patients, I still feel we can develop an app like COVID, Arogya Setu, which people alike. There is a technical committee which evaluates, which approves. Very important, only the right patient should get that drugs, not everyone. And we'll really know the right. So in a way, we have to really link this together, which is possible and doable. So, but I would not like anyone to be neglected. I still like to emphasize on group 3 because from the current policy perspective, group 3 patients feels neglected. There's nothing for them as of now as versus group 1. Yeah.
Absolutely. Thank you so much, Gopal sir and Mr. Himanshu. I think the number of, challenges that you've posed, a naive response would be that, yes, it's a complex area. However, I think if we structurally kind of assess where the core of the problem lies, I think that's what, as a next step, we want here. And I think very particularly, Gopal sir, you have pointed out to the question of the role of, firstly, the state governments, because maybe the type 1 and the category 1 and type 2 diseases still, there is a mention of government there. But specifically, again, if we look at the type 3 diseases, I think it is all recommendations there. Who is going to be taking the sole responsibility and answering the questions? I think we don't have any guidance on that. That is one. And two, involvement and awareness, involvement of the patients and awareness for them. I think that again is kind of a big problem area, for India. And I think taking this particular point forward, I would like to involve Professor Sanjeev and Dr. Harsha to the conversation. And I will, begin with Dr. Harsha with you here, because when it comes to involvement of patients and giving them the information and the voice, I think you and your organization is doing incredible work, in the US. And I think, you have witnessed the evolution of rare disease ecosystem in the United States. And you work at the interface of shaping, on one hand, the health technologies, but also at the same time, building awareness and specifically capacity building for patients and their families, helping them get representations to the policymakers, sometimes, in front of the Senate officials, That's the mechanisms, you have been witnessing and have been closely part of in US. So what do you think, and I think you've heard the India story, in the initial part of the conversation. What do you think, India, with the kind of, complex problems that we have in front of us, what can we learn and co-learn from other countries, maybe Singapore or maybe, USA or many other European countries which are doing, slightly or relatively better on the financing options. So, what do you think, what are the options in front of India now?
Absolutely. Thank you so much, Dr. Nalini and IHW Council for having me today. And Mr. Bansal and Mr. Agarwal have made some fantastic comments and set the context really well. What I like to add to the conversation from my unique perspective is, the global aspect of rare diseases, right? So it's not, all of us view this more on a country level and a state level basis, which absolutely there is a lot of complexity at that level. But at the same time, when the revolution in rare diseases began in the United States in 1983, when the Orphan Drug Act was passed by President Ronald Reagan. And the then chairman of Sanofi, Genzyme actually, not Sanofi, Mr. Henry Termier had a big role in that. And that really spurred innovation in the orphan drug space, right? So, and that's about 40 years of advancements in the field of rare diseases. And the National Organization for Rare Disorders in the US, the Global Genes, the Every Life Foundation for Rare Diseases, they've all been doing phenomenal work. And the European Union has been a great next follower in that revolution. With the European Rare Disease Society and now the Rare Diseases International, which is now bridging all of the global rare disease stakeholders together. And so the key here that both Mr. Himanshu and Mr. Gopal mentioned is only 3 to 5% of rare diseases have any treatments. What that means is 95 to 97% of rare diseases are in research and development mode. That's the most important to recognize, right? So where we can help patients here and now is where treatments are already approved and available. And those are very expensive. And so to gain access to existing approved therapies, and two, how can we help patients in India access therapies which are free, essentially, right? In clinical trials, patients don't have to pay anything for accessing therapies in a clinical trial. So 98% of rare diseases are in that research realm, and patients should be informed about the role of research and development, which can go on for 5, 10, 15 years before a therapy is eventually approved by the regulators, such as FDA. And in India, most of these treatments are essentially accepted if it is approved by FDA without requiring any additional clinical trials in India. And for good reason, which I really commend, right? But then, like Mr. Himanshu also pointed out, only one Gaucher patient in phase 3 clinical trial. That's basically where our organization at Indo-US Rare focuses on as a huge gap, right? Which we need to inform and make patients aware that clinical trials are not experimental and highly risky like it is believed to be. These are highly vetted by scientists and physicians and regulators, and only approved with safety considerations and so on in mind. And they have to be adhering to the ethical principles that are globally unique. So the Belmont report and so on. And so that's the core aspect, the global aspect, and participation in clinical trials as a way to access therapies that for free, essentially, including the travel and logistical expenses associated with participating in clinical trials are all covered by the sponsor. So that's something patients are still unaware of largely in India. The second part is the undiagnosed part of it, right? So when we say 70 million estimated people in India with rare disease, a majority of them remain undiagnosed, and only about 450 diseases that are recognized in the NPRD have been diagnosed to some level, and even those patients remain undiagnosed for a long time before they eventually get diagnosed. With genetic testing, exome sequencing, the speed of diagnosis is improving. We are seeing more and more patients reaching out to our organization with a exome sequencing report in hand, showing which specific gene mutation the child is affected with, etc. And so getting a faster diagnosis is one focus area where globally all stakeholders are aligned with. Even to enroll in a clinical trial, the patient has to have a specific diagnosis to meet the inclusion-exclusion criteria. And so getting a proper diagnosis is extremely critical, which needs to be aligned with the global stakeholders. I'll stop here and I'll continue later. Thank you.
Thank you so much, Dr. Harsha. And I think, again, you've raised some very critical points. And I think one is that, Drug Controller General of India relaxed the policy guidelines approximately 3 years back, that we only need an FDA approval. And, still, like Mr. Himanshu said, one patient in Gaucher's clinical trial. That speaks, very well for itself. And I think that's really alarming now. So, Professor Sanjeev, this shows that we have immense systemic challenges when it comes to implementation of any kind of, policy, because while we have spoken about many challenges, and because, we are specifically discussing the national policy today and the CSR, I think it's very important to understand there are many barriers, but now there was a policy that we were waiting for since many years, and the community of stakeholders in India, we literally fought for it, and we have one, right? Now the problem is 3 years back there was a policy guideline. The implementation, in terms of at least in the regulatory space, has not been that great. Now we have a national policy, and if not implemented well, I think that makes a very kind of ripe situation for a policy failure. And I think given we have the complexities, because of COVID and many other things, the priorities for the government has shifted. And rare disease in India has anyways been largely about the community of all the stakeholders who've come together, firstly to, shape solutions, because these all recommendations somewhere, which are part of the policy, have been suggested to the government of India by the stakeholder community. Now, if that is a suggestion, what in your opinion, because you represent so many thousands of patient voices in India and you've core part of so many government programs, you work closely in that ecosystem. And you have also been part in certain ways shaping the policy itself. So what do you think, we have the document, a guiding document, where do we go with it? Over to you, sir. So you're on mute, I think. Yeah.
Yes. Thank you. And it's a pleasure to listen to three experts in this area. Nalini, I will look at it from two aspects. One is as a public health expert who was involved in drafting National Health Policy 2017 as Executive Director of NHSRC. NHSRC was the secretariat for the policy. So I will start with the good news. We always talk about bad news. So one thing is, we have a policy, lot of effort by three eminent people sitting here and many more people outside this panel who have contributed. I remember about 2018, we had a meeting with Additional Secretary Health who was responsible for drafting this policy. One thing was good, the first policy direction came out in 2017. And the government realized there were problems there. It is very rare for the government to realize and revise the policy within 4 years. So that's a good aspect. And the initial policy 2017 was only talking of treatment. It was in the title. Treatment of rare disease, but rare disease is a lot more, diagnostic, public education, support system, pharmaceutical intervention, but lot more on non-pharmaceutical interventions as well. And there was inadequate stakeholder involvement. And as I think Gopal Agarwalji said, that we did not have state involvement in 2017 policy. These were the two reasons why they took it up and revised the policy. Policy has addressed four important aspects. I will come to what are the weaknesses later. One is it clearly states what are rare diseases. We don't have data. It acknowledges, at least at two places, it quotes data from other countries except India. On prevalence, on definition of rare diseases. And on diagnostics, they are looking at delays, as has been, I think, highlighted by all three of them. There is a delay. No data from India. They are saying delay of about 6 years in US and 5 years in UK. So if there is a delay of 5-6 years there, you can imagine most of the people in India will never have access to any diagnosis. They will spend their life and move on to the next lifetime, even without getting diagnosis. So that problem has therapeutics availability and prohibitive cost has already been expressed, so I will not go into the operations and implementation. The policy is weak on that, but it certainly highlights that aspect. When we were drafting National Health Policy 2017, and it was kind of a dream come true for a public health person to be involved in policy making. We looked at policy experience since 1983 health policy was made. That was the first policy. And before that, unwritten policy, which was called Bhor Committee report, but it was never called policy, but that was the policy direction. We looked at what was wrong with the previous policies. Policies never had implementation strategy. There is a page, without really going into detail, point number 14 in this policy, which talks about implementation strategy. For National Health Policy 2017, we gave an implementation strategy with matrix, including accountability. We identified which division, by designation, not by name, division and designation will be responsible for implementation of which aspect of the policy at central level, and as rightly highlighted, at state level, because health is implemented there. So that is missing. Accountability has to be there. We advocated that there has to be a cell in the office of the minister to monitor, because you know the distribution of bureaucracy in India. If it goes to one secretary, it will go down to the joint secretary. The implementing person is, other joint secretaries won't be happy reporting to him. So the cell has to be in the minister's office. There are no targets. Policy lays down broad goals and targets by what time. I agree, you cannot look at reducing incidence or putting, say, X percentage of patients under treatment because we don't know magnitude of the problem, but at least some diagnostic centers will be established, some progress, research and development will be undertaken. One very positive thing which has been included in the policy is National Consortium for Research and Development in Rare Diseases. I recently reviewed the Indian Research Consortium for tuberculosis, because India advanced the global targets 5 years ahead. What was to be achieved globally in 2030 will be achieved in 20. It is a very good initiative, and we have experts sitting here who represent both private sector and also patient group initiative. That is a very good initiative, but that consortium, we can advocate for it, and those of you who are part of it needs to narrow down to specifics. Look at the whole picture, not just diagnostics or treatment. Look at the whole picture from epidemiology to implementation to operational research, including therapeutics and diagnostic, and where research can come and help. We know costs are prohibitive. How can we look at research and development in India? Not based on, you don't find, I heard from, I think, Himanshu, you mentioned that you did find only one patient out of 26 patients across 30 plus countries. So it has to be local, and ICMR is well placed. They have been held, they have been mentioned by name to lead this initiative. The last point I want to mention is innovation. We have so many. In the previous panel discussion, we had somebody from Capgemini. We have such a good experience of CoWIN. People can go there, register, the reports will come there, and then you get messages and updates, etc. We can use that. And R&D with help from technology companies as CSR can help in developing technology innovation. We also need program innovations. You know, there are two components to innovation. One is technology, where technology has a lot of scope to help in rare diseases. And then program innovation. Program innovation is done mostly by the people who are working in the field. CSR can support some programs in one district or one state or whatever they feel comfortable to come up with program innovation, how these problems could be done. My last problem, why do we call it rare diseases? Rare diseases, if you call it, it will rarely get attention from politicians who go for votes. Why not call it like they have non-tropical diseases? They call it neglected tropical diseases. And there is at global level the same name. There is a separate part of WHO looks at neglected tropical diseases, and funding comes from international donors. Why don't we call it neglected non-communicable diseases? Neglected tropical diseases are communicable diseases, they are there. Let's change the name, because if you continue with the name rare, it will rarely get attention of a common man, of a politician, or people who are running hospitals. They will not have a separate section for rare diseases, because of how much? Out of 100 beds, you will rarely get one patient coming there. So that's the last point I want to make. Back to you, Nalini.
Thank you so much, sir. And I think on your last point, I saw all the heads nodding, and even I had like a huge grin on my face, because I think mostly all of us agree with that point of yours, because a lot is determined by the kind of nomenclature and the articulation that we use. And I think maybe at a certain point in time, or maybe, as a response after this conversation, I would like to hear from many stakeholders that, if not rare, then what? And why? What do you think, what kind of difference that could make? But that is kind of, out of the scope of our today's discussion. And so I really like the optimism with which you started the conversation. And, but, you did point out that, you have been very closely in last, 4 decades of your professional career, you have been very closely associated with the government of India. And the policy document that we have right now, it really misses, it has really missed pointing at the targets. And implementation metrics or framework, all of those things are missing. However, if we go and, enumerate all the problems here, there are so many of problems when it comes to rare disease, because the nature is such, the heterogeneity of the issue is such. However, coming back to the point of discussion is CSR, because we all know that it may not be a very sustainable option in the long run. But in the immediate to a mid kind of an approach, CSR is going to make sense for us, because that's where we know we have the alternatives available given the Indian context. So reading out from the policy itself, it says that it has recommended to encourage PSUs and corporate houses to contribute as per the Companies Act, as well as the provisions of the CSR rules 2014. Now, this is a very unique development. Actually, if we see in the Indian context, we haven't seen any of such thing happening earlier for any disease area per se. Now, the problem is we all who are part of the health community and very narrowly part of, rare diseases community, we know about this development. The stakeholders for whom the development is intended is the larger CSR and the PSUs, organization which fall under the CSR mandate, and other PSUs who may or may not be health centric. How much awareness do you think they have of it? Because it's been some 3 months since the policy has come out. I have personally interacted, many of us have actually interacted with stakeholders outside, the awareness amongst them is missing. Now, in your opinion, and I think my question is actually for all the panelists today, quickly, if, before we close the session, we need a way forward. And, instead of, pessimistically enumerating the problems here, if we have a solution here, how do we operationalize the solution, and how do we bring in the people by sensitizing them, or, how do we bring them in and tell them that, yes, this is the mandate you have now?
Yeah. So Nalli, I have very clear message for this, and I was thinking on it, because the key is ground success. Key is not policy. Patient bodies are asking for approximately 500 crore rupees to sustain for the existing number of patients. Let me give you some specific facts from a public enterprise survey 1819, and PSUs are the part. Crowdfunding is not sustainable. CSR funding is sustainable. They have spent less than 70% of their fund. They spend roughly, I have a figure in front of me, they spend roughly 3,876 crore from 250 PSUs approximately. They could not spend 1,944 crore rupees. That's a fact. What they can do, Government of India needs to make it a little bit more mandate, a proportion of this fund, and they have to amend their Schedule 7 that will go to the rare disease. Just simple. I think they will not need any other money. If a proportion or the unspent money from the health and education, they spend on health education infrastructure, but if they can make it more targeted towards this is done. Second, for all PSUs, there is a central ministry. They need to have a dedicated nodal person, bring that PSU person in their technical committee or the monitoring committee. They were not part of the policy. If you're bringing them, and believe me, CSR itself will take care of all the funding access to treatment. Because the key is sustainability. Sustainability will only happen through CSR funding or public sector undertaking. Just a small targeted numbers will help. I think that's from a short, because interest of time, let other speakers, panelists first. Thanks.
Thank you so much, Gopal sir. Mr. Himanshu, your closing remarks specifically on the CSR. How do we?
I think this is a great question, and I from a positive note perspective, I think mid of the last month, Dr. Harshvardhan had this meeting with the various, corporate sector, Ministry of Corporate Affairs, public sector enterprises, and, all the Maharatnas were there in this mid-March meeting where, he posted the 1-hour meeting on the Twitter. I think that in itself says many positive things as a closing remark that, there is an intent of the government, as I said, that, with this policy document, whether it is a guiding document or whether there is some lacuna in terms of the implementation. But I think the most important aspect is that there is an intent to treat for the, to look at the rare disease seriously in the country. That is the first aspect. And the alternative source of funding, because of the various competing, the health priorities and the restricted resources. I think this is probably initially the way forward in terms of managing the rare disease patient, but probably the question would come in terms of how this alternative source of funding could lead a sustainable mechanism, towards these such kind of rare diseases. But I think to close, at least from my perspective, alternative source of funding, like Gopal mentioned about the numbers, the CSR, there is enough. The 2% of the CSR from the Maharatnas can definitely take care of those 500 identified treatable 3A group patients, largely between the patient organization. And the last piece is, the patient advocacy and the patient engagement. I think everywhere in the world, when it comes to rare diseases or orphan drugs, I don't see, as an exclusion criteria to this, that patient advocates have led the battle, with the government and have won the battle in terms of the access. So in this country also, it is patient advocacy, and because of the patient organization, the policy has taken this kind of a shape. And I think going forward also, coming together as all stakeholders, whether it is industry, whether it is patient organization, whether it is bureaucrat, whether it is, the IHW like councils, non-profit organizations, everybody has to rope in and bring in their own parts and, and help these, patient communities. And I like what Professor Sanjeev has just mentioned about, we need to see, maybe need to really look at, and thank you so much, sir, for that. In terms of the terminology, whether it is rare disease or, we need to really look in terms of the nomenclature in our country from a different perspective. Thank you very much.
Thank you so much, Gopal sir and Mr. Himanshu, because I think the interlinkages that act more sustainable is actually when all the stakeholders, they come together, and that's what makes the implementation more sustainable. Because any work done in silos, at least in the implementation process of a policy, we know that it's a recipe for a disaster rather than anything sustainable, anything close to being sustainable. Talking of Sanjeev sir and Dr. Harsha, again, involvement of patients and bridging the gaps in order to make CSR operational. What would you like to say? We've already heard the pharma side of the world, but how do we collaborate? Because there is no way that we can all keep acting in silos and think of a successful option here.
Yeah, maybe I can start and then Dr. Harsha can add. One is I have learned teaching management to doctors and other things, 1 minute speech. If I can tell health minister or a senior bureaucrat in 1 minute and convince him, things will move. What I would like to tell in 1 minute and where are the gaps? One is, what is the magnitude of the problem? In India, 1 in 10,000 means 140,000. 10 in 10,000 means 14 lakhs, 1.4 million. So, that needs to be done. We do not have exact data, but maybe with the people who have been working closely with, we can come up with some approximate figure. If I get hold of a minister in a lift and accidentally traveling with him to first floor to the fourth floor where his office is in Nirman Bhavan, I can tell him, sir, this is, then he will catch my hand and pull me to his office, tell his secretary or technical assistant, give appointment to Dr. So-and-so and I want to know more. So one is and even with patients, for general public, you have to tell them what is the magnitude of the problem. And that's an area where CSR can fund some studies, not for the whole magnitude of the problem. If they want to look at all these diseases together, welcome. But at least in one district in India, we get some idea. And then the policy will not be blank with no data about India. They're talking about data from UK, US and other countries. So that then what is the way forward? CSR can help us in this geographical area, what can be done. And then I can tell health minister, such and such company under CSR did this, and this is a wonderful work. And then the last point in 1 minute speech is, I want you to do 1, 2, 3 things. Yeah. That specificity is required for the minister, but at the same time for the general public to some extent. May not be as precise because minister ka attention span bahut kam hota hai. He will have some visitors coming or phone call coming or some interruption. So we have to be brief. For general public, we need to prepare maybe 1 pager, which we can do. And coming specifically to R&D, and the funding, I will look at government has the primary responsibility. CSR companies are doing a great job, but government has not allocated enough money to health. 2002 policy said 2%. In 2017, when we were writing the new policy, it barely gone to 1.2%. 2% was not reached. They had only reached 60. Who's accountable? And then in 2017, they got convinced we wanted to put 4%. They got convinced 2.5%. But where is that 2.5%? Even that is not there. So government has to increase funding. And if they're looking for areas to fund, this will be a priority area because we don't even know magnitude. It is a shame on the planners and the policy makers. We don't even know magnitude of the problem. So their responsibility, but CSR can step in whatever geographical area they feel, looking at the cost of treatment so that we can tell them these many patients, this is the cost of treatment, this is the money required. What government can put in under National Health Authority, Ayushman Bharat or whatever, but these people do need treatment. You cannot ignore them. That's what I will have. I have to say on this. Over to you, Dr. Harsha. Sorry, I stepped in before your turn.
Yeah, great.
Absolutely no problem, sir. And I think you rightly said short and specificity is the way forward. And Dr. Harsha, I would specifically, want closing remarks from you that, given the experience of the, global world that you have with yourself, what do you think, when specifically, when it comes to India and the implementation and sustainability of CSR, what do you think, what should we be adopting to make the solution more sustainable now?
Yeah, absolutely. To add my thoughts to the extremely great points that the rest of the panel has already made, I think India should really follow and piggyback on the great progress that the overall rare disease community has achieved globally, right? Rather than trying to start from scratch and reinventing the wheel, we have to accelerate 35, 40 years of progress since the Orphan Drug Act, that now India now has a inaugural policy, which is great starting point, but that we need to really fast track and accelerate that. And the only way to do that is by collaborating with the FDA, EMA, and Japan, who have established regulatory frameworks to really bring new therapies to market. That's number one. Two, on the patient advocacy side, in US and Europe, we see a couple thousand patient advocacy groups and nonprofit NGOs that are advocating for patient interests for specific rare diseases or groups of rare diseases, whereas in India, that number is probably less than 100 patient groups, maybe 40 that are really active in rare diseases. So that needs to change, which means a lot of awareness and education and empowerment of patient groups, giving them a voice. It's in our culture to not speak up to the doctor or regulators or anybody in authority. And so we need to empower them in a respectful manner. Patients can have their voices heard. And FDA has a patient listening session where they invite patients from around the world where their voices are listened to. And that's very critical to continuously keep their voices and perspectives and their problems being known to both the sponsors and the regulators. Lastly, what Professor Sanjeev Kumar said around advocacy to the legislators and the policymakers and the bureaucrats, we have an amazing program called Rare Disease Legislative Advocates that was pioneered in the United States by Every Life Foundation, where we are participating as Indo-US Rare, where we talk to the congressmen and senators across United States, asking them to become part of the Rare Disease Congressional Caucus and the India Caucus, because United States capital has the only country to have a dedicated caucus is India. And so we are saying make rare diseases, gene therapy and biotechnology, telemedicine a key part of your focus in bilateral relationships with India, which has huge complementary resources to offer. And so we want to see the same thing happening from the Indian side, so that that can really build a strong relationship with US, which has 60% of the clinical trials, originate in the US or sponsored in the US. Absolutely. Those would be my concluding remarks. Thank you so much.
Thank you so much, Dr. Harsha. And I think with this we do come, to the close of our session today. But I would like to, point out the WHO report from 2010. Which, were the initial times when it started talking about alternate financing, health systems is the road to universal coverage. And that particular report, also, kickstarted the conversation of collaborations and participations for sustainable health solutions, right? And I think today with the entire conversation of, while we know that, there are a lot of complex issues in the rare disease community, however, we do have certain solutions which have been, given to us by the government of India itself. Now it all, lies on the stakeholders, the onus lies on stakeholders like us. How do we, support the implementation process? And I think this, discussion today is, I think, the starting point for that, because if next year, this is the CSR Awards, started by ISW Council. And if next year there is an entity which is nominated for its contribution of CSR in rare diseases, I think that is a success that I will see by virtue of today's discussion. And I think in order for ISW to, reach there, we look forward to support from, all the important stakeholders like you. And I think it is not, a journey that ISW or any other stakeholder group can, possibly take in, isolation. So with that, we come to the close of the session. And I think a big thank you to all of you and to all our participants as well, because it is the encouragement of the community at large that wants to drive conversations on a topic which is rare. And like we said, that we do not want to call it rare anymore. So thank you so much. And I hope to collaborate and, speak with all of you in the future also for a successful implementation. Thank you so much. So here we, end the conversation of this panel discussion. We would be taking a short break, post which Mr. Kamal Narayan will be coming forward, and we would be starting the jury. We have the jury here also with us, so we will start the award ceremony of the event. Thank you so much.
Thank you.
Thank you.
And all the eminent participants who are present with us. A very good evening to all of you. Namaskar. And I think we've just concluded with the discussions and deliberations and panel discussions which we have had. But time now for one of the most awaited and anticipated section of the day, as ISW Council presents its flagship event, the 5th CSR Health Impact Awards 2021 COVID-19 edition, in association with Jagran Pehel. Good evening once again to all of you, and myself, Vimi Chaudhary. I'm the host, the facilitator of these awards today, and it's an absolute honor and a pleasure for me to be given this opportunity to bring to the forefront and highlight some very outstanding achievers, the contributors, the impactors of health, healthcare, and environment sectors for their sustainable development initiatives as we present these awards. And I think all of you will agree that preserving good health and environment is a constant process. And that has to be achieved through relentless awareness, through advocacy and actions. In fact, when we were having the panel discussion, many of our panelists had voiced this, that we need to have advocacy and create greater awareness. So towards that, the IHW Council, which you know is the Integrated Health and Wellbeing Council and is a not-for-profit organization, it has been very relentlessly working. It has been continuously advocating its high-fi missions, that is towards achieving good health, good food, good water, good air, and good lifestyle for all, so as to determine and propagate a world of gross domestic health and well-being progress and multi-sectoral engagements and actions, pretty much aligned with the United Nations global agenda of holistic approach to the sustainable development goals. And then through various advocacy initiatives, the Council has always been at the forefront in creating positive synergy among the people and living beings through accountable actions. And it has also been further inspiring them to maintain a healthy and a positive state of mind and make well-being a permanent act in life. And I think this, all of us so very much felt last year when the world was engulfed with COVID and we entered into a phase of health hazards, economy and social uncertainties due to COVID-19 pandemic. And so rising to the occasion, the Council, as a health and a well-being institution in India, became all the more firm and responsible in its ideology to promote health for all, engage more and more entities working towards uplifting the communities, the societies, and the needy, further support the government initiatives for health and environment for the people of our country. Further, I'm sure all of you are also aware that the Council in its journey in the last 4 years, we have been rewarding and recognizing organizations, companies, CSR arms, and other new social businesses, even startups and individuals who have been engaged in some very remarkable, sustainable, scalable, and responsible work for humanity and uplifting the health of communities and societies on various fronts. Till now, we have, in fact, as I mentioned, hosted some 4 mega CSR Health Impact Awards in conjunction with the CSR Health Impact Summits. And we have felicitated more than 300 individuals, institutions on this platform. So this year, with the pandemic, we felt all the more the need to highlight the contributions of organizations and individuals who have been fighting COVID-19. And then inspire organizations to drive a nationwide CSR-based health movement, and further appeal to the corporate conscience of others to participate at a much grander scale and make this movement more stronger and more impactful. For this is, ladies and gentlemen, the need of the hour. This is the need of the country. So with this in mind and with this very thought, we today bring you the 5th edition of the CSR Health Impact Awards 2021. Herein, we would also like to place our utmost thanks to our supporting partners who have been with us in this vision and mission. A very big thank you, IHW Council would like to place to BOP Hub, to World Toilet Organization, to Global Interfaith Wash Alliance. They have been our supporting partners. To IHW TV, which are our digital partner, to Teamwork Communications Group, which are our communication partner. And then a very big thank you to our very esteemed jury members. Each one of them, ladies and gentlemen, highly decorated and recognized public figures, policymakers, decision takers, promoters and propagators of good health, who actually helped us in going through these various nominations which we had received, and then selecting finally the winners who are going to be recognized here today. So a big thank you to our jury members. We have Mr. Salman Khurshid, a person I think who needs no introduction. He's been someone who's always supported us, the senior advocate. We have Mr. P.P. Chaudhary, Mr. Bhaskar Chatterjee, former Director General and CEO of the Indian Institute of Corporate Affairs. And as you can see further, ladies and gentlemen, on the screen, our other esteemed jury members. Once again, we have, as you can see on the screen, all our jury members present here. Mr. Love Verma, the former Secretary Health, and we have Mr. Hitesh Vaidya, Director, National Institute for Urban Affairs, Ms. Vibha Dhawan, Director General, the Energy and Resource Institute, Dr. Ashok Kumar Vaid, Chairman of Medanta Cancer Institute, Medanta Medicity, Dr. Shujin Bajaj, the founder director of Ujjwala Cygnus Hospital and expert market access program, PMJ, Ms. Nisha Narayanan, the chief operating officer and director, Red FM and Magic FM, and Sushma Oja, the consultant, Adani Foundation and advisor, CDMC, Mika, and Mr. Avinash Dwivedi, head CSR and trustee, TPC DT, Tata Projects. We're really glad that many of them are also present with us today, joining us. So a big thank you to them once again. And yes, a big thank you to all the participants for making this evening very special, not only with the discussions which we have had, but as we now move into this award ceremony. And I'm sure it's going to be very inspiring and motivating for everyone present here. So now, ladies and gentlemen, to set the ball rolling at the very onset, we bring you a short video of the CSR Health Impact Awards. Let's view in this.
Health is one of the most critical indicators of countries' development. A nation whose citizens do not have access to quality healthcare cannot hope to become a global power. With rising incidence of lifestyle diseases and continuing prevalence of malnutrition and communicable diseases, India has been facing a complex healthcare scenario. Given the range of health challenges, it was deemed imperative to create neutral spaces to get everyone talking about health. Thus, the Integrated Health and Well Awards, a jury-driven initiative, has judged various health CSR projects across multiple domains based on their effectiveness, sustainability and scalability. Impactful initiatives were recognized and the many organizations were awarded for their CSR efforts. The initiative has received wholehearted support of the leading policymakers, industry captains, community leaders, innovators, health experts, celebrities and influencers. The forum also received an overwhelming response from the industry. Several legendary brands have come out to support these efforts and have become the real change agents. CSR Health Impact Awards became yet another IHW Council platform to launch various impactful programs that aimed to drive the country towards better health. While the world entered into the year of health hazards, economy and social uncertainties due to COVID-19 pandemic, we become more firm and responsible in our ideology to promote health for all, engage more entities working towards uplifting the communities, societies and needy, and trying to support the government initiatives for the health and environment for the people of our country. Therefore, we felt the need for continuing our CSR Health Impact Awards with the focus on highlighting the contribution of organizations and individuals fighting COVID-19 and also the noticeable achievements in the main CSR categories. We thank our distinguished jury members for their kind help and contribution as the jury of this edition, and also prominent organizations as our supporters and partners. We are truly honored and thank them for their most valuable support for their health initiative and to the Council. Continuing with our efforts, we bring to you the prestigious CSR Health Impact Awards COVID edition.
Gentlemen, it's so remarkable to see such amazing work which has been taken by various organizations and individuals for the humanity. And as our panelists had also expressed that CSR is definitely making a difference, reaching out to the unreached and creating better facilities for them and providing good healthcare to them. So now I would like to invite the man, the energy, the driving force behind the show, the CEO of IHW Council, Mr. Kamal Narayan, present with us, and I would like to request him for his opening remarks.
On mute, sorry. So thank you so much, Yumi, for your kind introduction, and thank you everyone. Good evening and welcome to the CSR Health Impact Awards 2021. CSR Health Impact Awards is a flagship event that we are immensely proud of, and we keenly look forward to it every year. This has been so special because it is based on our most fundamental philosophy that health is everyone's responsibility. When we initiated this in 2017, the idea was to encourage our industries across sectors to channel their CSR efforts and investments more towards areas that contribute to health and well-being outcomes. And so was the point of discourse in our summits. I must recognize here that our conviction got more and more firm every year when we saw so many well-thought and impactful projects being taken up by many companies. And in the past 17 months of pandemic, pandemic has given unprecedented dimension to this discussion. And also the work our industry, businesses, and civil societies have taken up. During the insightful sessions in the evening, we tried charting out a way forward to build a more resilient India that thrives on its people's health. And during the pandemic, we saw colossal work done by industry and civil societies to support the health infrastructure and many other challenges the crisis threw on us. And many of them are being recognized on this forum today. However, we at the IHW Council would like to reiterate that the cost of preventing a pandemic is just a fraction of the cost of managing it. And that's where we all need to work. And we need to work towards preventing these infectious outbreaks and many other pandemics and epidemics that kill millions of Indians every year. NCDs such as heart and lung diseases, stroke, cancer, diabetes kill nearly 6 million Indian, every year. If you look at the global toll of COVID-19, it is around 4 million till date. The number of under 5 deaths, mainly caused by undernutrition or unavailability of clean water and absence of hygiene many times, stood at 8.25 lakh in 2019 in our country. And if you see the number of COVID deaths happening in the last 17 months is around 4 lakh. This just show these few numbers so that health needs the maximum of our attention and can yield great social and economic returns for our nation. And I'm sure that you will continue shouldering the responsibilities of the communities you serve and the people who need it most. And I want to take this opportunity to thank each one of you for doing outstanding life-saving work in the last 2 years. And I thank all organizations who submitted their work for the 5th CSR Health Impact Awards COVID edition. We had got the highest number of entries this year. Every work was remarkable in itself. And I must thank our jury who meticulously reviewed and evaluated each work to find the best among the bests. And my hearty congratulations to all those who will be awarded today, and to those whose work is not selected. I must say that your work is not lesser than that of winners. You too have touched several lives, and every sigh of relief or a smile on face you brought with your work is most significant award. So let us all continue work towards building a healthy, happy India for all. Thank you so much.
Thank you, Mr. Narayan, for your very thoughtful expressions and also putting the very thought and idea which has been behind these awards. And as you mentioned, that this time we received the maximum number of nominations, and definitely a very humongous task for the jury also of selecting the winners out of going through all these nominations and having so many sittings. So as we thank them once again, we would also like to now listen in to their views, their experiences and observations. And as I can see, we have our esteemed jury member, Dr. Shujan Bajaj, present with us, the founder director of Ujjwala Cygnus Hospital and Expert Market Access Program, PMJ. Sir, if I can request you to please address this August gathering, and if you can share with us your views and your observations as you were going through these various nominations. Yeah. Dr. Shujan Bajaj, if I can request you, sir. Sir, your mic is off. It's on mute. Dr. Bajaj, if you can hear me, your mic is on mute. Okay, I think we're facing some problem there. So we'll just send a word across to him in the chat. Meanwhile, if I can request Dr. Ashok Kumar Ved, present with us, again our esteemed jury member, Chairman, Medanta Cancer Institute, Medanta Medicity Hospital. So if I can request you, sir.
Good evening, everyone, and thanks once again, Kamalji and the entire team at the IHW Council for the wonderful work you guys have been doing and bringing healthcare into the discussion and bringing the focus on healthcare. And especially during the pandemic, when so many people have contributed enormously, all the frontline workers, those who are in the supply chain, working in the hospitals, intensive care units, and so on and so forth. Recognizing them, and of course, the support system, recognizing them also is so very important. And a lot of these entries were in the COVID space, and a lot of good work is being reflected through these entries. And I can tell you that of the ones I went through, the ideas were brilliant, and it spoke of the intent of the society to come forward and help the rest of the society at large, those who were suffering, be it only the distribution of the masks or going to the masses and distributing food or food packets, and even going to the hospitals, providing the oxygen cylinders, concentrators, so on and so forth. The ideas have been brilliant, and I must congratulate all the participants that they have done a great job. And as Kamalji said, that it's not about winning. I think it's about performing. And the performance has been great. I congratulate everyone once again. Thank you so much. Keep doing the good work. Stay safe, stay healthy, stay protected. Thank you so much.
Thank you. Thank you so very much, Dr. Ved. And we have also Mr. Avilash Dwivedi present with us, the head CSR and trustee TPCPT Tata Projects. So if you would like to express your views on the nominations which you had received, and yes, the ideas which you had seen during as you were going through these nominations.
First of all, thanks to the IHW Council for this opportunity. And while going through the applications, honestly speaking, it was quite a challenge to looking at the work and trying to impartially judge. Everyone is a winner, according to me. I mean, somebody could contribute through their competencies, somebody could contribute by being on the ground and trying to make a difference. All of them are winners in their own way. It requires courage to be there when everybody is asked to be at home. So all these people who have applied and shared their story basically are those champions and warriors going unnoticed. And IHW Council has undertaken an amazing job of recognizing these people and celebrating this thing. In such difficult times, we seem to have forgotten how to celebrate. But here, celebration and saluting the spirit of never give up of humankind is something which IHW Council is doing, which is amazing. And it was great learning for me to even know what is happening in terms of the quantum of effort. It's simply amazing. It talks at large about our nation as a whole. And it's very much to be a part of this nation building in terms of at least learning from them. And in our organization, we'll try to even include some of these learnings going forward. Thank you very much.
Thank you, sir. Thank you so very much. And truly, we had seen so many stories of compassion and care during this 1 year, people reaching out to others. And as you said, that they have been all these stories have been so very inspiring and motivating for everyone. I'm sure as we have these awards, more and more people will get inspired with that. We'll just once again try connecting with Dr. Bajaj. I think he's traveling, he's on the road, but we'll just try connecting. Yes, now we have him. Yes, welcome to you, Dr. Bajaj. And as you stand as a very esteemed jury member, would like to request you your views and observations as you were going through these nominations which we received.
Thank you so much for having me. I hope I am audible now.
Very much audible.
Thank you. Thank you, Vimiji. And thank you, Kamalji, for taking this wonderful initiative. And I echo all the judges' thoughts that it has been a very difficult decision for us, considering the volume and the impact of the work having been done by all the entries. And some of the entrants I've seen personally as well, working very hard in the fields when it was a difficult task just to get out of the house. It was a personal risk as well, a risk to the families of the frontline workers who were coming out and doing everything from healthcare to distributing food to organizing Zumba sessions for COVID patients. So I have seen all of these things being done by all these entrants, and it's been a wonderful, wonderful experience just reading about their stories. And I wish them all the best, and I hope that the most deserving ones will win. Each and every entrant is a winner, of course, But I wish them all the best. And even if you don't win this time, please do keep working and please continue your good work, because the blessings of the communities and the people that you work with, I think, are much, much bigger than any award that we can try and give you. Thank you once again.
Yeah, thank you, sir. Thank you for sharing your experience also. And ladies and gentlemen, we've just now been joined by Mr. Love Verma also. Thank you, sir, and welcome on board. We were just talking to our jury members, and in fact, I was requesting them if you can share your views and observations as you went through the various nominations. Over to you, sir.
Thank you. And I would like to congratulate the council. It is a great initiative. And I was really overwhelmed by the kind of initiatives which people and organizations had undertaken in these difficult times. I think it is very important to recognize and encourage them, which is what the council is doing. So, and it has been doing it for the last couple of years as well. So my best wishes, and I hope it continues to honor and recognize these individuals as well as organizations. Thank you so much.
Thank you, sir. And so once again, many thanks to all our jury members, all of you who have been very tall and stalwarts in the health and the healthcare sector, and judging these various nominations and all the winners receiving the awards at your hands. I'm sure it makes a big difference, and it's an honor for them. So I would like to request all our jury members also to kindly stay with us as we move into the awards, and I would like to request you to present these awards. But before we roll out the red carpet and we take a deep dive into the ceremony, I would just like to quickly also run you through the process of these awards. So, ladies and gentlemen, the CSR Awards team evaluates all the entries on various criteria. And these are the nominated project, the scaling capabilities, the impact created among people, society and community, the territories which have been covered, investment and sustainability of the project. So these are some of the criteria on which we had judged the various nominations. And then these evaluated nominations are further evaluated and screened by our respected jury for the final ranking, and then select the winner in each category. This year, we received more than 140 nominations, and as has been told by all our jury members, it was very difficult to select winners in each category, as all of them have done a very remarkable work, especially in these very difficult and challenging times. And therefore, with the intention to reward maximum initiatives, we have created subcategories like the gold, silver, and in some categories we also have the bronze awards. And in certain cases we have also a tie in some of the award sections. We have also created large corporate, mid-corporate, and broad segments just to highlight the position in each category. I would also like to mention, and in fact that has been mentioned by Mr. Kamal Narayan also, has been mentioned by all our jury members also, that by following this process, we do not have any intention of undermining the efforts and the intentions of people who have not been able to make to the final list. In fact, to be very precise, we value the thoughts, we value the actions and the sincere efforts which have been behind all the initiatives which have been taken. So in fact, everyone stands as a winner today. But as we have the process of the awards, we have to choose the best performers and announce them, and we celebrate their efforts and success. So that is how we have the winners who are going to be announced. But then once again, reiterating, everyone, we thank them for the tremendous work which they have been doing, and the society, the community, this country needs more and more people like you to build a strong gross domestic health and well-being progress graph for this country. So without much ado, let's begin the proceedings of the awards, the 5th CSR Health Impact Awards 2021. And I would like to request first Dr. Ashok Kumar Vaid, our esteemed jury member. May I request you, sir, if you can do the honors of presenting the first set of awards. So today, ladies and gentlemen, we have the individual awards and we also have the institution awards, and we begin with the individual awards. And in this, the first category is CSR COVID Protection Project. And in this, the Gold Award is being conferred on
the Gold Award in individual category. CSR COVID Protection Project goes to Neerja for her project, My Wish for You.
Many congratulations to Neerja Sonowal. The My Wish for You project supported over 2,000 slum dwellers across India with authentic safety kits to prevent infection and dehydration. I would like to invite Ms. Neerja Sonowal, Ms. Suhani Sonowal, the co-lead for the project, and Ms. Bhairavi Bhutt Sonowal, the CEO of HED Healthcare, to receive the award. And I request Dr. Vaid to kindly do the honors.
Good evening, everyone. Thank you so much. This is such a big honor, and we are really grateful to have received this award. Back in the start of 2020, we saw the rise of a major global humanitarian challenge, the coronavirus pandemic. And the underprivileged sections of society were really hard hit and were suffering in terms of lack of sanitation measures, protection from the virus, and basic necessities that they need to stay safe. So the My Wish for You Talent Contest fundraiser, which was our debut event, 2020 to 21, was a collaborative event that was organized by the National Level Development Organization Smile Foundation India and HED Healthcare. The program embraced the significance of using one's talent, especially the youth's talent, to contribute towards the development of society. So we had children from ages 15 and under participating. We had over 50 participation registrations from over 8 schools across India and made an impression on over 30,000 people all over the internet. Fulfilling our goal, we procured over 2,000 safety kits for the slum dwellers of India. And the campaign was brought to a conclusion on January 22nd, 2021, when our team visited the slum region in New Delhi and carried out the distribution process effectively. So I would like to thank Smile Foundation, the NGO who collaborated with us and helped us carry this project forward, Ms. Naini Singh, without whom this project would not have been possible, Ms. Shrishti from Smile Foundation, who guided us to the final distribution portion of our event, Mr. Bhaskar from Rasta Foundation, who helped us distribute the 2,000 safety kits amidst the slum dwellers. And of course, our core team, which had Suhani Sonowal, Pavit Gogia, Anika Taneja, Heti Majmudar, Arav Dogra and Pranav Dogra. And these were all our youth participants who organized this event with me. And of course, HED Healthcare. And I would like to invite Ms. Bhairavi Sonowal, who is the CEO of HED Healthcare, to actually describe this event further.
Yeah, good evening, everyone. It's an honor to be here at the council, and I thank you so much, all the jury members and the participants out here. HED Healthcare was founded in the year 2011, and we have been working in the field of bringing healthcare to all. Our goal is to provide best treatment, best solutions in terms of healthcare, but that was all with respect to bringing about change in healthcare, bringing best healthcare to the patients. But this year, we really wanted to do our part of CSR. We wanted to give back to society as an organization. And when Neerja and her friends reached out to us saying that they would like to do something for the people of underprivileged society, they wanted to give back. I thought that was the best idea. When the youth gets involved in giving back to society. So right from the conceptualizing to planning to executing, this event was entirely managed by the children. It was by the children for the children of the underprivileged. So that gives me a great satisfaction and lot of pride in saying that children of today, the youth of today, the responsibility lies in the youth of today in a very good hands. My Wish for You was conceptualized with the intent to bring out the talents of the children and how they can contribute through their challenge for the underprivileged, how they can contribute to towards the pandemic. So it was decided to reach out to various schools of India, give them the opportunity to reach out to the children and ask them to participate in the talent show. The talent show was divided into 5 categories. It was an art, music, dance, and storytelling. That was what we had as categories, and we had judges on panel who were there to judge the entries of the children. And also through these entries we had decided to arrange funds. We reached out to various individuals, various organizations to raise these funds. And once the event and the funds were raised, HED Healthcare really wanted to collaborate with an NGO which brings impact. We did not want to just sit down with a fundraiser. We could have easily, collaborated with someone who just does the fundraiser, but we really wanted to collaborate and involve ourselves into, getting the impact of this fundraising, that the fund reaches to the grassroots. And that's how, Smile Foundation came to our help, and Smile Foundation helped us out to kind of, distribute the fundraising right through the, the grassroots of the people that they work with. And we decided to provide, hygiene kits and the safety kits, which used to have contents like, ORS, which used to have contents like PPE kit, personal protection kit. And while at the distribution ceremony, the children of the My Wish for You team did a small awareness.
Request, Ms. Sonowal, because of the paucity of time, if you can be concise.
Yeah, definitely. So we did a small awareness as well. So, thank you so much. Through My Wish for You, we raised close to 2 lakh rupees for the underprivileged children. We distributed 2,000 hygiene kits, and we reached out to 50, schools all over India and gave an opportunity to children to participate. So thank you so much. Really obliged and honored to receive this.
Once again, many congratulations, and we've been receiving many congratulatory messages on the chat box. And Neerja is such a bright young girl, and so heartening to see that the children of today stand so aware and so responsible. Once again, congratulations.
Thank you so much.
So with that, we move to the next category, and as we are not physically presenting the awards, so I would like to request all our esteemed jury members who are present here, if all of you can collectively join in doing the honors and extending your blessings to our esteemed winners of the day. So we have now the second category, and ladies and gentlemen, that's COVID Essential Heroes. And in this, the gold award goes to
The Gold Award in individual category COVID Essential Heroes project goes to SK Singh and Akanksha Singh for their project Help for All.
So congratulations to Mr. SK Singh and Akanksha Singh. The app connected the needy and helpers in challenging COVID times. I invite them now, along with Ms. Kaniz Fatima, to receive the award.
Hello.
Yeah, you're audible.
Yeah, but I'm not able to open my camera. It has been stopped by the host.
Okay, we'll try putting it on. Meanwhile, we can hear you loud and clear. If you can, yeah.
Yeah, I thank.
Brief, if you can tell about your project. Yeah. What do you have?
Yeah. This is SK Singh. I thank ISW Council for selecting the Help for All for this award. My journey started when the COVID started in the 2020 in the month of April. I used to see the news how these migrant workers and poor people, they were traveling to their homes and they were not having anything. Then the idea came in my mind that how they can, if they are in need of any emergency, how they can alert the authorities or nearby people. So I thought of developing an app. So within a few hours, I spoke to a few of my friends. They are all techies. So we shared the idea and we started on the work to develop the app. And within 15 days, we launched this app, Help for All. It's a very simple app. Just by downloading it and pressing registering, any poor people can register through OTP and just they enter their name. So it's very simple for the layman. They don't have to register through any social media or anything else. They just need to enter their phone number and name, that's all. And as soon as they register, their location starts showing on the map, and then they can press their few SOS buttons, like if they need food, they need medicine, if any medical emergency is there, if any other emergencies are there, if they need oxygen, if they need any kind of job. So later we developed, first we started with the food support and medical support, because that was the need of the time. So and we started within few hours only. When we launched the app, we started getting the request, and our motto was to help them as soon as possible. So generally we try to reach them as soon as we see the SOS in our app. It shows their location, exact location, with their name and phone number. So we try to contact them. What's the problem? What problem you are facing? So they tell ki we don't have food, or there is some emergency of medicines and all. So we started our at the time of when we launched this app, we were having only 2-3 people. So they started tackling all this SOS, and then slowly.
जी आपको बीच में इंटरप्ट करना चाहूंगी, समय के थोड़ी सी कमी के कारण आपसे थोड़े में यदि आप बता सकें, पर वैसे आपने
I told you this is a very simple. This is a very simple app. It is called Help for All. Any poor people or needy people, they can download and use it. Pardon?
Many congratulations आपको और बहुत बहुत मुबारक, and may you continue to have these bright ideas in reaching out to more.
Yeah. Thank you. Thanks.
Thank you. And with that, ladies and gentlemen, in this very category, we now have the Silver Award, and the Silver Award is being conferred on
the first Silver Award in individual category, COVID Essential Heroes Project, goes to Dr. Jaita Chaudhary for her COVID relief project.
Congratulations to Dr. Jaita Chaudhary, and I invite her to accept this award.
Hello.
Yeah, we can hear you, ma'am.
Thank you, ma'am. Thank you for this opportunity to be part of this grand event. Receiving this award has not only boosted my confidence, but also given me opportunity to explain in brief that homeopathy and Ayush has played a significant role in prevention of COVID-19 in large outbreak areas, which was a major concern, especially in the second wave. And being in government myself, it was not only a challenge to play a key role in vaccination and home isolation duties, and ICU, but also understanding the psychological needs of COVID patient and making them available the respective medications. So really thank you to all of you for this award. Thank you so much. This is a real special evening for me. Thank you so much. Thank you so much.
Thank you so much, Dr. Chaudhary, and once again, many congratulations.
Thank you, ma'am.
That, ladies and gentlemen, we've moved to the next award. That's the Bronze Award in the individual category of COVID Essential Heroes, and this award goes to
The Bronze Award in individual category, COVID Essential Heroes Project, goes to Dr. Chaitali Mandal for nutrition consultation and mental counseling.
Congratulations to Dr. Mondal, and I invite her for her views now.
Hello.
Yeah, ma'am, we can hear you.
Yeah. So, am I audible to everyone?
Yeah.
Yeah. Hi, I'm Dr. Chaitali Mandal, and I've done my graduation on BSc Nursing, and I've done my PhD on nutrition. So, actually, during COVID, I served the community because I was posted in COVID. So, I actually directly come attached to the COVID patients. I give treatment to them during vaccination program. I was their vaccinating officer till now. And also every day evening, I give counseling regarding food, regarding mental health to the patient in my community. I live in Calcutta, so I provide support to many patients who are suffering from COVID or post-COVID complications and all. So, and I also have a clinic that the name of the clinic is Charm Wellness and Eat Clinic. So that's all for everyone. Thank you very much.
Thank you, Dr. Mondal, and once again, many congratulations to you. So,
And
ladies and gentlemen, these were the individual awards, and now we move to the institution awards. And in this, the very first category is CSR COVID Relief Project Large Corporates. And under this, the Gold Award is being conferred on
The Gold Award for the large corporate segment for the institution category, CSR COVID Relief Project, goes to TCS for their project COVID Protection and Relief.
So, COVID protection and relief, ladies and gentlemen, has created essential intervention in the areas of health and well-being, education, technology, and human capital. Would like to invite Mr. Balaji Ganapati, Mr. Joseph Sunil Nalapalli, Ms. Aditi Trehan, and Ms. Natasha Joshi to receive the award, and would like to request our esteemed jury members to kindly do the honors of presenting this award. And I can see Mr. Ganapati present with us. Sir, would you like to say a few words?
Thank you so much. I think, first of all, congratulations to all the winners. And it is the healthcare workers and the frontline workers that are keeping India healthy and alive during this tough time. From a TCS perspective and the Tata Group perspective, we are here to serve and doing what is best for India, what is best for the people of India has always been our mission. Our response to COVID started when about 16, 17 months ago, and we looked at it from three perspectives. The immediate response, and then relief, and then resilience. And a variety of initiatives undertaken at a group level and TCS level is continuing to alleviate the suffering that many of our fellow Indians face even today. From providing PPE materials initially and supporting doctors and nurses and healthcare professionals, to then setting up COVID centers and hospitals and extension hospitals to support their needs, providing equipment which is life-saving, and then supporting migrant workers and those who have lost livelihood. It has been a journey of 16 months that still continues today. Especially with the second wave hitting, I think the focus on oxygen and other life-saving devices has been even higher. In addition to that, we also have used our research and our network of partners and allies to support these efforts. Once again, I want to thank the organizers and the jury for conferring this award, but rather than accepting it on behalf of TCS, I would definitely confer this on all of the healthcare workers and frontline workers that continue to support us during this time of need. Thank you so much.
Thank you so very much, and once again, congratulations. And with that, ladies and gentlemen, we move to the next award, and that's the Silver Award in this category, which is being conferred on
The Silver Award for the large corporate segment for the institution category, CSR COVID Relief Project, goes to Johnson & Johnson Private Limited for their project Putting Our Purpose in Action Towards COVID-19 Response.
So congratulations to them, and once again would like to request our esteemed jury members to kindly present this award, and as they do so, would like to invite Mr. Sachin Salian to receive the award on behalf of Johnson & Johnson Private Limited. I not see Mr. Sachin Salian, I think. Anyways, I believe he's not been able to join, but yes, many congratulations to Johnson & Johnson Private Limited, and may they continue to do the good work and reach out to the people. With that, ladies and gentlemen, we move to the next award. That's the Bronze Award, and herein we have a tie. That is, there are two awardees. So in no order of priority, the first Bronze Award goes to
The first Bronze Award for the large corporate segment for institution category, CSR COVID Relief Project, goes to Tech Mahindra Foundation for their project TMF COVID Response.
So Tech Mahindra Foundation, and we have Mr. Sajid Ali, who's here to receive the award. I believe he's, if you have anyone else also from the organization would like to speak? It's from everyone also, as we are getting the messages. Congratulations to Tech Mahindra Foundation for the good work. And with that, ladies and gentlemen, as I mentioned, we have a tie in the bronze award, and the second bronze award goes to
category. CSR COVID Relief Project goes to Gemini Technology Services India Limited for their project COVID-19 response.
Capgemini, ladies and gentlemen, through their technology and innovation drove sustainable and social development as a part of COVID-19 relief. I would like to invite Mr. Anurag Pratap to receive the award from our esteemed jury members.
Thank you, jury member, for the recognition. I value the recognition given to us in respect to category. Thank you.
Thank you, Mr. Pratap, and once again, congratulations to the organization.
Thank you.
And moving on, ladies and gentlemen, now to the second category. That's the category CSR COVID Relief Project, Mid-Size Corporates. And in this, the very first award, the Gold Award, is being conferred on
The Gold Award in Mid-Size Corporate segment for the institution category, CSR COVID Relief Project, goes to Cosmo Foundation for their response to COVID-19.
Ladies and gentlemen, this project facilitated people with the necessary help in several locations across India. Would like to invite Ms. Mamta Baksi to please receive the award on behalf of Cosmo Foundation. We've not been able to join, but yes, many congratulations to Cosmo Foundation and the entire team.
Thank you very much to the organizers. Thank you very much to the organizers, to the jury members on behalf of Cosmo Foundation. The relentless work being done by our community-based teachers, our frontline workers, and also we have partnered with various government departments like district panchayat, block panchayat, gram panchayats, police, health department, and also various non-profit groups like ISKCON, Smile India Foundation, Langa Society, AK Foundation, Prayas, and many more organizations. And we have catered to the various category of the COVID affected people. It included the COVID patients, their relatives, their families, and also to the migrant laborers, rural migrant laborers, and pregnant women, lactating women, school children, school dropouts, and we have reached to the various affected people, even elderly abandoned citizens. Through it included the food distribution, grocery relief, and also the hygiene kits, safety kits, safe travel for the migrant laborers, and also to the rural people and rural community children. We have organized the digital education. And that was the most challenging part, and COVID awareness, because we always felt that the giving things is easier, but making them aware and bringing a behavior modification is the most challenging task, and which we have addressed. I heartily thank my trustees, especially Mrs. Yamini Jaipuria, who has led this entire campaign as a managing trustee, all the colleagues of the Cosmo Foundation, all the coordinators, trustees, and my teachers. Thank you. Thank you very much.
Thank you once again. Congratulations, Ms. Bakshi, for creating this awareness. Thank you again. And ladies and gentlemen, we move to the next award, and that's a Silver Award. And this award is being conferred on
the Silver Award in mid-size corporate segment for the institution category. CSR COVID Relief Project goes to Aster DM Healthcare for their project Humanitarian Response to the Pandemic.
And ladies and gentlemen, throughout the project, they kept fighting the threat of COVID-19 and supported medical professionals and people in need through online and offline initiatives. Would like to invite Dr. Malathi Archana Pillai, Dr. Nisha Nair, Mr. Zalil, Mr. Muhammad Sohail, and Mr. Nihad Nazir to receive the award. Any of the recipients who's present here, just put on their camera and their audio, and if you can hear your views.
Mr. Mohammed, I request you to please switch on your camera and your mic.
I think it's present with us, but facing some problem. I request you to please put on your camera. Any of the awardees who's present here. I can see Mr. Mohammed present. Mr. Mohammed Sohail, sir, if you can put on your mic, please.
Hello, hi, this is Jalil here.
Yes, sir.
Sorry, there was some technical delay in connecting and with the camera and mic. I think my colleague, Dr. Malathi there, who is our Group Chief Medical Officer and Quality Officer, is supposed to take this award on behalf of Aster DM Healthcare. If she's able to get connected, I really like her to talk on this one, because this was an activity from the forefront led by the doctors in Aster DM Healthcare, representing 27 of our hospitals across India and GCC, and representing around 2,500 doctors on board. So if Dr. Malathi there, I would like her to speak. I don't know whether you could connect her. Otherwise, I can receive the award on her behalf. Seems there is a technical error in connecting on her behalf, and
Dr. Malti is there. Dr. Malti is online. She just needs to unmute.
Hello. Hello, am I audible?
Yeah, ma'am, you're audible.
Thank you so much. I'm so glad I could make it at the last minute. At the outset, I sincerely thank every one of you, and it was so heartwarming to hear the earlier awardees. It made me feel so humble at the work that has been done. But most important is recognizing this work and bringing it on the forefront is so encouraging. I bring to this forum the vision of my chairman, who believes always, though we are a corporate sector in healthcare, a private company, but for us, he says, serving the community has to be a priority, and the rest of it, whether it is financial, is only a lateral benefit. Today, we are so proud that we were able to give to the community something in a small way. There are lots of things that can be done, no doubt about it. And I must say, there is huge amount of things that every one of us can contribute. We at Aster believe this is a small drop in the ocean that we thought we must contribute. But this is a journey, and like many things, it is not a destination. We hope to continue on this journey with the team, the excellent team of Jalil, Sohail, and all of them, because anything to the community cannot be one person. It is a concerted efforts, consolidated efforts, and we promise to this forum and to the world around that this is something that we would like to continue to the extent that we can to the community at large. Thank you. Thank you very much for recognizing the team. Thank you.
Thank you, Dr. Malati. May you continue with your good work, your good thoughts and action. Congratulations.
Thank you.
And now, ladies and gentlemen, we move to the next award. As I mentioned, these are the bronze award which we are presenting, and there's a tie. So the next bronze award in this category goes to
The first bronze award in mid-size corporate segment for the institution category, CSR COVID Relief Project, goes to Keysight Technologies India for their community outreach programs for COVID-19.
Congratulations to Mr. Naresh N. Asnani, and I would like to invite him to receive the award.
Thank you, team. It is an honor and privilege to receive this prestigious award. I think in these unprecedented times, the challenging times that we are living in, strengthening and supporting the local communities was one of our key focus areas. So at Keysight, our corporate social responsibility vision is to build a better planet by accelerating innovation to connect and secure the world. And also to achieve this vision, so Keysight business and CSR efforts are positively impacting the global community through our solutions, or whether they are about when it comes to CSR efforts. So our program is aligned to this vision. At this stage, so we definitely believe that the hope is the best thing that we can give to make anyone truly happy, and collectively we can make a huge difference in this specific time. So talking about the COVID relief work, so whether we started this work around 16, 17 months back, and it is a continuous effort. So as mentioned earlier by some of the earlier awardees, so we also created kind of 3 buckets. So one is the immediate relief programs, the sustainable programs that we can do. So whether it was to support the essential supplies to families, to people who were displaced during the initial stages, whether it was to support the MCG to set up a RT-PCR testing facility at that time. So we were there to support them with that kind of first of its kind testing facility when there were few testing centers available in the city. Then we moved on to the next stage when the second wave hit us. So we kind of are supporting hospitals with oxygen plant setup. So there is one hospital that we are supporting in Bangalore. Then we also started supporting the vaccination van logistics program by the local administration in Bangalore and Delhi. So this has been our effort on the vaccination front. We are also kind of partnered with Doctors for You to accelerate the vaccination outreach program in Gurugram. So these are some of the constant efforts that we are doing, and we are thankful that we have been partnering with the local authorities, various NGOs, United Way Delhi, United Way Bangalore, and Doctors for You to fulfill what we had thought about and touch and fully touch lives of people in these times. So thanks a lot. This award really means a lot. Thanks again for the jury for considering this nomination. Thank you very much.
Thank you, Mr. Asnani. Thank you for talking to us about your project, and once again, many congratulations. And ladies and gentlemen, the second bronze award, mid-size corporate segment for the institution category, CSR COVID Relief Project, goes to
The second bronze award in mid-size corporate segment for the institution category, CSR COVID Relief Project, goes to Amplus Solar, a member of Patronus Group, for their project, Million Smiles.
Many congratulations to them, and we commend them here for the initiative to donate high-quality, reusable masks across the country. We have Ms. Aditi joining us to receive the award. Many congratulations, and
Thank you.
we can hear about your project here.
Right. I would like to thank the IHW Council and the jury members on behalf of Amplus Solar for this prestigious recognition. The Million Smiles initiative has been a very special initiative for our organization. It has been the largest CSR drive for us till date. And Amplus, a part of Petronas Group, is already a distributed energy company providing low carbon solutions. So we are already working in the renewable space, a segment that deals with sustainability. So we understand the importance of sustainability and society. So we decided to just try and go out of the normal way and help people out during this extremely catastrophic and trying pandemic. Just like it was mentioned earlier in this webinar, health is everyone's responsibility, and we just decided to acknowledge ours. That's when we decided to go ahead with Million Smiles, our mass distribution drive, in the very initial stage of the pandemic, where we decided to distribute 1 million good quality masks to non-medical frontline workers who sometimes could not afford these or sometimes did not have the access to them, because this was at a very initial stage and the masks were not being sold in abundance. Our employees initiated the distribution drive, and eventually many donors joined our drive via Keto. Further, we had tied up with Urmul, an NGO that works for women empowerment, for procuring these masks. So all the capital with which these masks were being procured went to the female artisans who stitched these masks for enduring or for supporting their families. So for us, it was a dual initiative as we helped these women from losing their jobs or falling into poverty traps, while also distributing good quality masks to the vulnerable section of the society. And thus, we were trying to cater to the entire socio-economic spectrum with this mass distribution drive. The entire journey was possible because of this idea that germinated that it is our duty to give back to the society in this need of the hour. So eventually we attained our target of distributing 1 million masks across 2,800 plus locations span India. Our work got recognized. It was covered as a story in the Mint, and now this award by the IHW Council. So as one of the drivers of this CSR initiative, I'm elated to receive this award on behalf of Amplus, and would again like to thank IHW Council for this honor and appreciation. Congratulations also to the other winners. And more importantly, a big shout out to all the people who have gone out of their way to help the society. Thank you.
Thank you. So, as you said, dual work of not only providing masks to the people, but also generating employment for women and people who are involved in making these masks. So, once again, many congratulations.
Thank you.
And to all the people and participants, some of you who have just joined us here, and we are presenting the 5th edition of the CSR Health Impact Awards. And we have our esteemed jury members present with us who are doing the honors of presenting these awards to our awardees. Mr. Lal Verma is present with us, the former Health Secretary, Government of India. We have Dr. Ashok Kumar Ray, the Chairman of Medanta Cancer Institute, Medanta Medicity Hospital. Dr. Shujin Bajaj, the Founder Director of Ujjwala Cygnus Hospital and Expert Market Access Program, PMJ. And Mr. Avilash Trivedi, Head CSR and Trustee TPCDT Tata Projects. These are some of our esteemed jury members who are present with us and doing the honors of giving the awards. So with that, we move to the next category, and that's the CSR COVID Relief Project NGOs. And in this, ladies and gentlemen, the Gold Award winner is
The Gold Award in NGO segment for the institution category, CSR COVID Relief Project, goes to Lord's Education and Health Society for their project Healthy Aging.
The project, ladies and gentlemen, revolves around strengthening healthcare scenario through initiatives in digital health capacity building and risk communication and containment strategy. We'd like to invite the awardees, Mr. Rajesh Ranjan Singh, Mr. Joy Podar, Ms. Aparajita Ray, Mr. Ramashankar to receive the award.
Thank you, IHW Council. A big thank you to the jury. Congratulations to the various, those 50 agencies who have really applied for the award. I'm really proud and happy to really receive this award on behalf of my team. big thank you to everyone who has really helped us over a period of time, be it the government, be it the national government, the state government, the corporate, the various foundations who have really worked over a period of time with us. This award is basically for them, and of course on behalf of the team who has really worked tirelessly, not only in the COVID-2 or the Wave 2, but also in the Wave 1. So a big thank you to the Council, and also congratulations to other awardees also. Thank you very much.
Thank you, sir, and many congratulations to your entire team. And ladies and gentlemen, the next award, we have the Silver Award in this category, and this is being conferred on
The Silver Award in NGO segment for the institution category. CSR COVID Relief Project goes to the Akshay Patra Foundation for the project Akshay Patra's food assistance during the pandemic.
the project. Ladies and gentlemen, provided food assistance to support the government's relief efforts during COVID-19 pandemic. We'd like to invite here Mr. Sandeep Talwar to receive the award.
Thank you, Mimi. Good evening, everyone. Thank you, jury of ISW Council, for this honor and giving this award in my hand. It makes me feel great on this day on being rewarded for the hard work put in day in and out by our 7,000 hunger warriors of Akshay Patra. Last 15 months, we have served over 12 crore meals across the length and breadth of India to the marginalized communities, attendants outside the hospitals, cabbies, millions walking barefoot last year or stuck on the railway stations and bus stands, waiting for a bottle of water. Based on our research, we found our government-going school children were neglected, and hence we introduced the Happiness Kit. Happiness Kit for the children, which had nutrition, hygiene, and education for these children. I would like to also thank my donor partners, state governments, teachers for their continued support in the last 15 months to us. And I'm sure the next 1 year is going to be all challenging. And I'm happy to share that we have also now moved on to vaccination program. And last 4 programs we have done in Delhi has been receptive, and we've received almost 7 times the response what most of the government programs do receive. It's a pleasure to witness this beautiful moment in the presence of you all. We are honored and graceful today to receive this prestigious award. Thank you, jury.
Thank you, Mr. Talwar, and once again, congratulations to your entire team.
My pleasure. Thanks, Vimi.
And now, ladies and gentlemen, we have the Bronze Award. Once again, we have a tie here. So the first Bronze Award winner is...
The first Bronze Award in NGO segment for the institution category. CSR COVID Relief Project goes to Oxfam India for their project Sanjeevani.
Project Sanjeevani ensures support to healthcare facilities with medical equipment that are necessary for life-saving. We'd like to invite here Mr. Pankaj Anand to receive the award on behalf of Oxfam India. In case we have anyone else also from Oxfam India. Mani, do we have anyone joining from the organization?
Looks like some connection error. They are here, but not switching on the camera. Let's move on to the next.
So I think we've not been able to connect with them, but many congratulations to them. And we now have the second Bronze Award winner. And this award goes to
The second bronze award in NGO segment for the institution category, CSR COVID Relief Project, goes to Swadesh Foundation for their project COVID-19 Relief and Recovery Fund.
Ladies and gentlemen, this fund is set up to address the many challenges of the pandemic and to prepare the communities and health facilities to address any such future challenges. Would like to invite Mr. Mangesh Wange, Dr. Surendra Yadav, Dr. Sachin Ahayar, and Ms. Ashdeep Kaur to receive the award.
Okay, so thank you. Good evening, everyone. Thank you, jury, for recognizing Swadesh Foundation's effort. It has been a very humbling experience for all our team members on ground. We are working in Raigad and Nashik districts of Maharashtra. We looked at this entire situation at two levels. One institutional level where we work with government hospitals and machinery to provide medical equipments, not just in first wave, but also in second wave, and frontline healthcare workers. And second, very important, is also with the community. And in community, when we work, it was at three different levels. First one was creating basic awareness and COVID protocol, supporting them on meals and rations. And finally, the capacity building and leveraging government. For example, eSanjeevani is such a beautiful program from Government of India. Our frontline healthcare workers of Swadesh Foundation, about 800 of them, we call them Swadesh Mitra. They were trained on eSanjeevani and they used it over last 1 year. We have a very good data of utilization and we have seen fantastic results and response from community. We also tied up with district administration for community mobile vaccinations, especially for tribal and elderly population, where 3 of our mobile vans are, as we speak, are doing for last 6 weeks village to village, door to door vaccination drive with district administration. And also very important, we are very happy to share this. Our team members, about 250 of our employees, are continuously engaged on counseling COVID patients in Raigad districts, again in coordination with district administration. So lots of very satisfying activities which we have been doing. So that is on COVID relief. And the second part of COVID relief fund is we calling it COVID relief and recovery fund. As the things improve, very important for rural areas to focus how they build back their livelihoods. So recovery is going to work on that, where nutrition program for mother and child, improving income, especially for tribal population and migrant population. So these are the focus areas. Work continues and we are getting a lot of interesting insights, data and results. Thank you again. Thank you, jury, and congratulations to all other winners. Thanks a lot.
Thank you, Mr. Wange. Once again, congratulations. And now, ladies and gentlemen, we have the next category, and that's the CSR COVID Protection Project. And under this, the Gold Award winner is...
The Gold Award for the institution, category CSR COVID Protection Project, goes to Lupin Human Welfare and Research Foundation for their project combating COVID-19.
The Combating COVID-19 project, ladies and gentlemen, has been responding to the pandemic, to lockdown and resultant migrant flight and livelihood loss. I would like to invite Mr. Ravi Deshpande to please receive the award. Mr. Deshpande, your mic is not on. Yeah.
Am I audible now?
Yeah, audible, sir.
Yeah. Thanks ISW for this award, and actually this is a tribute to the work of our team, which was on the street in this pandemic, whole pandemic and lockdown period. We had a holistic approach in COVID protection. We worked with district health administration, district police administration. We strengthened government machinery to enable it to fight it effectively with COVID. We provided the protective gears and all the equipments that were needed to for district administration to face this challenge. Apart from this, when there was a lockdown, and migrant crisis, and the huge number of migrants were trailing, walking to their homes. We were there at every big, every important strategic points. We set up almost 26 camps. We had advantage of having operations in 9 states and in our presence in 20 districts. So we were able to reach out to them, and we serve them food, medicines, everything they needed, including charging points for their phones, which were quite needed that time. And we were able to serve them, and we are glad to serve almost 13 lakh population during this whole 1.5 years, we can say, of pandemic and lockdown. And I'm thankful to ISW for conferring on us this gold award. This is really tribute to my team, our team, which risked their lives to serve the people. Many of us had COVID, including me, and some of them, almost came back from the jaws of the death from hospitals, but still we came doing the work, and this is really tribute to those workers, and I'm very much thankful to you for recognizing us, our effort. Thank you very much.
Thank you so very much, sir. और इस आपदा में, in spite of yourself suffering from COVID, you reached out to so many people. Hats off to you, sir, and your team. Many congratulations. And now, ladies and gentlemen, we have the next award. That's the Silver Award, and the winner is
the Silver Award for the institution. Category CSR COVID Protection Project goes to Huntsman International India. For their project, Huntsman strengthens India's COVID-19 fight.
So Huntsman project, ladies and gentlemen, has been working towards strengthening India's fight against COVID-19 through their initiatives focusing on rural communities. Would like to invite Mr. Raymond Sabawala and Mr. Rajkumar Dalmi to receive the award.
Thank you, Ms. Chaudhary. We would like to be very grateful to the IHW Council, the respected jury members, for honoring and recognizing the work done by Huntsman. We remain committed to the cause, what we have embarked on, and we would ensure that we would continue this work going ahead. And may I remind that this is a teamwork. This is the teamwork of the CSR committee at Huntsman, as well as the employees, and it's because of their participation and level of engagement we can reach out to these masses. So thank you very much for this recognition. Thank you, Miss.
Thank you, sir. Once again, congratulations. And ladies and gentlemen, the next award, the Bronze Award in this category, and the winner is
the Bronze Award for the institution. Category CSR COVID Protection Project goes to Association of Maharashtra Obstetric and Gynecological Societies. For their project, AMOGS Raksha Suraksha.
the project focuses to bring the latest updated scientific evidence regarding COVID-19 to obstetricians and gynecologists throughout Maharashtra and the rest of India. Would like to invite Dr. Nandita Palshetkar and Dr. Arun Nayak to receive the award. Dr. Nandita, your mic is on mute.
Yeah, sorry. You know, we will never learn. I think Dr. Arun Nayak, our secretary, is not well. So we have Dr. Rajendra Singh Pardesi. Can I invite him along with me?
Yeah, please.
Yeah, Dr. Rajendra Singh Pardesi, thank you for being here. And on behalf of AMOGS, which is the Association of Maharashtra OB/GYN Society, I'm really grateful to the IHW Council and especially Kamal. I think thank you very much for appreciating the work that we're doing. We are an association of gynecologists, which is 8,000 strong. Oh my God, 1 minute. Sorry. We are an association of gynecologists, which is 8,000 strong. And we are committed to women's healthcare. And this COVID has been very testing, because during the COVID times, all kinds of healthcare was not accessible, was very difficult to access, especially for women. And we as gynecologists have taken a lot of care. We have done a lot of things during COVID to help our population, which we take care of. There are a few things which I would really like to tell you is that especially the reproductive health and the sexual health, the WHO had concerns whether this kind of help would reach the women. And we have touched nearly 20 lakh children in talking to them about adolescent health care, about mental health care. We have taken care of anemia in the women. We have delivered more than 2,000 COVID positive women, and all our gynecologists have worked in the front line and given care. Not only that, we've also collected money so that we can give PPEs, etc., to our frontline workers, because all our children, all our kids were working in the medical colleges absolutely without any protection. And especially in the first wave, I think we mobilized all our societies. We have 42 societies in the different cities, and each society worked towards giving the care. Then the other thing that I really want to talk about is that we have been working towards maternal mortality rate. Remember that 30 years ago in our country, it was nearly 600 women died per year out of 10,000. And today it's only 113. And it is the effort of all the gynecologists along with the government. So AMOGS, especially in Maharashtra, the rate has come down to 113, which is what the SDGs are expecting. It is much lower than what is expected in SDG 2020. And I think we are very proud to say that our association has played a major role. And during this pandemic, especially the domestic violence where the women are in an environment where they do not get protection, they're scared. We have launched helplines and we have reached out to the women so that they can get assistance wherever necessary. And I think these are some of the things that we've really helped out, and especially Dr. Rajendra Singh Pardesi's pet project is anemia and delivery, the free delivery which he has launched, that every gynecologist must do a free delivery of a patient in the private setting, nursing home. We have given quality care in the private nursing homes, which is our Lakshya Manyata project. So I'm really happy that today IHW Council has appreciated our effort, and the unsung heroes, you are felicitating us. I'm really happy, and I would just request you to give permission so that Dr. Rajendra Singh Pardesi can also come. He's taking over as the president after me in February, and I would like him to also say a few words.
Yeah, please request Dr. Rajendra.
Good evening, everybody. It's proud privilege and honor to be a part of this function. Our AMOGs, we are having more than, as Dr. Nandita Palsetkar, our president, she told, we are having more than 8,000 members, and we are working hard for women's health in all aspects, as Dr. Nandita told, and our president, Dr. Nandita, is working very hard for the women's health, and she has projected many projects. Still the projects are going on, and we are propagating these projects. I am taking over after Nandita Palsetkar ma'am in February 2022, and we will work together. We will work together with government, and we will do activities. And thank you so much encouraging our AMOGs. Thank you so much.
Kamalji, I must place on record appreciation to the IHW Council, because it really gives us inspiration to do more. Thank you. Thank you very much.
Thank you.
Thank you.
Council.
Thank you once again, Dr. Nandita, and to Dr. Rajendra Singh. Thank you. Congratulations. And ladies and gentlemen, we now have the next award and the next category. This is the CSR COVID Indigenous Response Project. And under this, the Gold Award winner is?
The Gold Award for the institution category CSR COVID Indigenous Response Project goes to DOSI Turtle Shell Technologies for their project Million ICU.
Million ICU, ladies and gentlemen, is an initiative that addresses the massive shortage of ICU beds and staff in public hospitals. We congratulate the team and I'd like to invite them, Mr. Mudit Dantwate, Ms. Nirupama, Mr. Vinay and Mr. Santosh Mishra to receive the award.
Yeah, thank you so much for this honor. DOSI was started in 2015 by Mudit and Gaurav with a vision to, save lives with the help of connected technologies. Our experiences during the COVID, first wave and the second wave, we started the Million ICU initiative with a very ambitious goal of using our proprietary remote patient monitoring solution to transform 1 million beds into step-down ICUs. Till date, we have converted more than 4,600 beds into step-down ICUs, monitored more than 33,000 patients, and saved an estimated 74,000 nursing hours during the first and the second wave. We hope to, use this initiative to really transform the face of public healthcare in India, and we look forward to collaborating, hopefully, with a lot of you to achieve this goal. Thank you once again for this amazing honor.
Thank you, Ms. Nirpa, and may your wish come true.
Thank you.
Congratulations. And now moving to the next award, that's the Silver Award, and the Silver Award winner, ladies and gentlemen, is
The Silver Award for the institution category CSR COVID Indigenous Response Project goes to Glenmark Foundation for their COVID Response Project.
COVID Response Project focused its efforts on improving access to food to the underserved, including migrants and daily wage workers, pregnant women and children during the pandemic. We have Ms. Tinsy George joining us. I congratulate her and request her to say a few words on this occasion.
Thank you so much. Good evening, everyone. And thank you for this award. I would like to thank the judges and also all the other winners and the nominees as well. Really happy and so great to see such good work in being awarded. So, that just goes to show the amount of good work out there, and also at the same time reinforces, that we are doing something good. So just, like we know that there was the health pandemic, that was running, and along with that, there was the hunger pandemic, and that's where Glenmark Foundation really came into the picture, and we pledged 5 million meals to the underserved. And I'm happy to say that we've done this through various partners that we partnered with. We believe that partnering is what multiplies impact, and I would like to take this opportunity to thank all the partners that we worked with, who because of which we are really able to complete our pledge. And obviously I'm here today saying thank you to everybody and winning the award. So thank you once again, and congratulations to all the winners.
Thank you so very much. Congratulations. And ladies and gentlemen, in this very category, now we have the Bronze Award, and the winner is
Bronze Award for the institution category CSR COVID Indigenous Response Project goes to Honeywell Hometown Solutions India Foundation for their COVID-19 Response Project.
And through this project, Honeywell worked on enhancing the healthcare capacity of the state by implementing COVID care centers and providing all the necessary healthcare equipments. We'd like to invite Mr. Atul Pai as he joins us, and many congratulations to him.
Hi, sorry, Atul had to just drop off immediately just a few minutes back. So I'll be very honored to take this on behalf of Atul. This is Dipankana, and I'm a senior CSR manager at Honeywell. Really honored for this, and thanks to all the jury members, and on behalf of the team, I would like to congratulate everyone. And sorry, am I audible?
You're audible. I think there's some other voice also coming. But anyways, you're clear.
Okay. So yeah, I think, I would, want to utilize this podium to really congratulate and acknowledge the efforts of all the Honeywell, employees, the support that we have received from, the global teams, the Indian teams. Everybody came together to really, address the needs. So starting from, the requirement of oxygen concentrators to, the COVID care centers to, the vaccination drive for all the employees. So really, really happy and very honored to, get the award in this podium. And again, thank you for all the support. And the idea and the intent is to just solve for the problem collectively and continue getting all the support from the state governments to, each and every other community members. So thank you again.
Thank you and good luck. Thank you. So we move on to the next category, and that's the COVID healthcare providers, private sector. And under this, the Gold Award winner is
the Gold Award for the institution. Category COVID Healthcare Providers, Private Sector, goes to EMIDS Technologies Private Limited for their project Iron Woman.
So EMIDS developed an autonomous visitor management system that specializes in customer interactions and helps in maintaining social distancing through features like registering and navigating patients and medicine delivery. To receive the award, we have Ms. Surabhi Sinha, founder and CEO of EMIDS, Pramod Chonam Kandathil, Karthik Ramesh, Lakshmikant Gopalakrishna, and Himachala Gavitham Maya. I hope I pronounced the name correctly, but many congratulations to the entire team.
Yeah, thank you, Vimi, and thank you all. This is Saurabh Sinha. I'm the CEO of EMIDS. Thank you to all the judges for their work, shortlisting, and then obviously selecting us. COVID has just been such a tragedy for the entire world, and the second wave was probably the hardest that we all had to endure. Was a very strong wake-up call, and we always knew right from the beginning when this started that technology can play a big role in helping us go through this pandemic. So we, being a technology services organization, really put our heads together. Coincidentally, EMIDS services healthcare technology. So not just technology, but we are very focused on healthcare technology. All our clients are hospital systems, insurers, pharma, med devices companies. So we found that we not only had tech capability, but we also had great domain awareness and how to help. So we put our heads together and we did what we did. Very happy for my team here who's on the call. Congratulations to all of them so that we got recognized. Really appreciate it. Appreciate the encouragement. Thank you for putting up such a show and going through the process. I think as we all go forward, we have a lot of lessons learned, but it's also and obviously very difficult to see how some people have suffered, but also in some ways encouraging that the community can come together and be of help to each other. Thank you again for the recognition. Really, really appreciate it.
Thank you, Mr. Sinha, and once again, congratulations. And with this, we move to the next award. This is the Silver Award in this very category. And the winner, ladies and gentlemen, is
the Silver Award for the institution. Category COVID Healthcare Providers, Private Sector, goes to Apollo MedSkills Limited for their project Paramedics Training.
Project Paramedics Training is working towards providing healthcare skills and quality education to a large number of unemployed youth and healthcare professionals in India to fill the resource gap in the rough times. As we congratulate the entire team, delighted to have Mr. Kamal joining us, and I request him to accept the award.
Thank you. Good evening to all of you. Thank you, jury and
Thank you, IHW and the panelists. They wonderfully spoke about the CSR partnerships, and we are really honored to receive the award. Particularly, it's a double bonanza for us. On a World Youth Skills Day, we could able to receive this award from IHW. And I would like to little bit narrate about the CSR projects for upskilling the BPL segment, unemployed youth particularly. It was a great challenge for us during the COVID pandemic period, particularly last year. And starting this year again, second wave came up. And it is very, it was quite difficult to identify the beneficiaries who are really deserving to get the employability skills from us. And we could be able to do such 1,200 people, beneficiaries have been identified through the CSR funding organization Bosch, and we could be able to train them, and we could be able to place all these frontline workers, create livelihoods for them through employment. So which is like they all are now the COVID warriors, we would call it as, and we really appreciated all these COVID warriors who got trained through us and got placed in the healthcare establishments. So thank you once again for the consideration, and thank you very much for honoring us. It's really a privilege to us. Thank you very much. Thank you, Kamal Naringji. Yeah.
Thank you, sir. And once again, congratulations to the entire team.
Thank you very much.
And now, ladies and gentlemen, we have the next category. That's the category of COVID Public Health Warriors. And in this, the Silver Award is being conferred on
The Silver Award for the institution, category COVID Public Health Warriors, goes to Srimad Rajachandra Sarva Mangal Trust for their COVID-19 relief activities across the globe.
The project, ladies and gentlemen, sets an example for volunteers across the world to begin serving their local communities affected by pandemic and the resultant crisis. We'd like to invite Dr. Bijal Mehta to receive the award.
Thank you very much, Vimi, to IHW Council for giving us this award. I would like to dedicate this award to Srimad Rajchandra ji, who was Gandhiji's spiritual guide, and Puja Gurudev Shri Rakesh ji, who is our present spiritual master, who, when the COVID first wave came, had told us that if virus is contagious, but if we make our compassion more contagious, and we are sure to win over this virus. And with him, we had 2,000 volunteers across the globe. We did it in 5 continents, but 30 cities very actively in Mumbai in first wave. And the projects, like over that time, we supported the hospitals in the metropolitan cities where health was required for the health, also to daily wagers, migrant workers. Every possible need of that city was catered to. In second wave, when the wave was more affected in rural area, we were supporting 4.5 lakh population tribal zone in Gujarat. Also, the same model was replicated in Karnataka and also Saurashtra, Banaskantha. So, wherein their myths were broken, we went door to door to help them break their myth and come for early detection. Also, vaccination awareness and door to door vaccination in rural community we've been provided. More than 8 million lives we have been able to touch through the different projects. And would like to thank Puja Gurudev Shri Rakesh ji for the inspiration and the guidance and the passion put into each volunteer. We were 2,000 volunteers on the road, so would like to thank all the volunteers, front end, back end, to support. We have created facilities in cities as well as rural area, created infrastructure, hospitals, did training. So all the work. Would like to thank all my frontliners, my back end support. Vidhi Doshi is here with me on this award. Would like to thank all team members. And thank you, Vimiji, for giving us this award. Thank you so much.
Thank you, ma'am. And once again, congratulations to you. And may God continue to give you the strength to serve the community. Thank you.
Thank you.
And now, ladies and gentlemen, we have the next category, and that's the COVID Social Champions. And under this, the Gold Award winner is
The Gold Award for the institution, category COVID Social Champions, goes to CanKids for their C3IP project.
The C3IP project devised special COVID cancer interventions to help children with cancer and their families and affected stakeholders to deal with the challenges faced during the lockdown and during various unlock phases. Would like to invite Ms. Poonam Bagai to receive the award.
Not being able to turn on the video, it appears. Can you hear me?
Yeah, we can hear you. So without the video also, ma'am, I request you to...
Are you going to miss seeing the beautiful me? Thank you. Thank you, Vimi. I don't know why we didn't start my video, but thank you to IHW for all the wonderful work you do in terms of creating awareness and advocating for a healthier, happier world. I cannot imagine a sadder world this last couple of years with the COVID pandemic. And while we have all fought COVID at CanKids, we have also really worked hard to look after children with cancer. And our entire effort since March 2020 has been to keep our children safe, to keep the children on therapy. Somehow, with COVID, with hospitals being declared COVID, working across the country with over 115 childhood cancer treating hospitals, somehow working to make sure that children continue to stay on treatment, children continue to get all the help they needed. We set up a CanKids.
Ma'am, we've lost your voice.
Ma'am, we cannot hear you.
Yeah, ma'am, we can't hear you. We've lost your voice. We can see you now.
Can you hear me now?
Yeah, we can hear you. Now the face and the voice.
You can see me or you can hear me.
Yeah, the face and the voice both here now.
Okay. So I don't know where you lost me, but if I'm starting all over.
Again. Can't hear you. Your mic is on mute. Mic.
Now?
Yeah. Now getting you. Yeah. Again, on the mute.
Better?
Now we have your voice.
Yep. So once more, at the risk and cost of repeating myself, I sound like a stuck record. Thank you, and thank you for the work that IHW does in creating awareness and advocating for making the world a healthier, happier place. I don't think it's been a very happy place the last 2 years, what with all of us fighting COVID. And at CanKids, we have worked really hard with many stakeholders, with hospitals treating children with cancer, with state governments, with all the stakeholders to try and keep children on therapy wherever they were, to try and get them home, to try and bring them to hospitals. We created a series of almost 27 interventions which allowed our children to be well looked after. We kept all our home away from homes open. We worked with other NGOs, we worked with stakeholders. It's been hard, and we've got a third wave coming up. Hopefully, inshallah, not as severe as the second one, but we have to gear up for that. It's also difficult because we don't know how many children we would have lost in terms of not coming in for treatment. But we're determined to keep working. I want to thank a lot of people, especially the team at CanKids that has stayed motivated the whole time. A lot of our teams are in the hospitals. We've lost a few social workers. A lot of people have lost a lot of people. Our kids have stayed mostly safe, and that's important. Their parents, we've looked after them too. The work is hard for all of us. So I just want to say thank you, everybody who's done so much hard work. I think it has brought us together, even on Zoom calls like this, to be able to work better together to make the world a happier place. So thank you one more time.
Thank you once again and good wishes to your entire team.
Thank you. Thank you.
Now, ladies and gentlemen, we move to the next award. That's a bronze award in this category. And once again, we have a tie. So the first bronze goes to
The first bronze award for the institution category, COVID Social Champions, goes to Society of Community Health Oriented Operational Links for their project Healthy Aging.
the Healthy Aging Project focuses on ensuring comprehensive support services to help the elderly remain both healthy and independent within their own homes. As we congratulate the team, I would like to invite Dr. Benazir Patil and Dr. Pavan Pathak to receive the award.
Hello, can you see me?
See you and also hear you.
Yeah, thank you everyone. Thank you IHW. Thank you all the juries, and it's an honor to be here. We have been working for past 3 years with the elderly population and have an approach which is completely away from the old age homes. We reach out to every single elderly who's vulnerable, who's in the slums. And at the moment, we are reaching out to more than 9,000 elderlies in 4 locations in the country. The collaborations are mostly with the municipal corporations because in 3 locations, Pune, Mumbai and Bhopal, we are in urban areas. And in Gwalior, it is our first rural project in one of the blocks. And it is amazing to see that every single elderly we reach out to has a comfortable, peaceful and happy life. So it's all about improving the quality of life of the elderlies. And during COVID, I must say that there was much more fear, there was much more sadness, and there was a lot of challenge in the first wave. But this year, it was strange that all our elderlies were much, much stronger than their own family members. More stronger than their younger family members. It was rather that the elderly were taking care of the younger family members. And they all attribute this strength to all the warriors that we have who, almost, I think, whether it was lockdown or no lockdown, not a single day any of us have stayed at home. We've all the time been in the homes of our elderlies, either doing their health checkups, either helping them, go virtual with our doctors, giving them consultations, providing them multivitamins, providing special medication, or, raw ration was a very natural course that happened that COVID brought into picture. But everything else that we were doing was by sitting together with the elderlies in their homes. And they used to wonder that, the whole world is talking about the lockdown and how these people come down and be with us all the time and support us. So it's been an amazing journey of last 3 years, but last 1.5 years, it's been completely different. I mean, when we actually started, the project is called Healthy Aging. And when we actually started, we kept on telling everyone very clearly that the concept of healthy aging as per WHO is about social health, economic health, spiritual health, physical health, and psychological health. And it's not just the pure health the people understand. But somehow COVID brought us much more closer to their physical health and their mental well-being. So I think past 15 months or so, it's been just an incessant and tireless effort to make our elderlies comfortable in their own homes and create peace for them. And we feel that there are many organizations that talk about reach, but the reach of 9,000 elderly may be very small for many organizations in this country. But for us, reaching every single elderly 100% has been, I must say, our achievement, and seeing them happy is a greatest blessing to see, So I thank IHW, I thank all the juries, and it's a great platform to be. Thank you all.
Thank you, Dr. Patil, and God bless your entire team. Thank you.
Thank you.
And ladies and gentlemen, the next award, that's the second bronze, and the second bronze winner is
the second bronze award for the institution. Category COVID Social Champions goes to Advantage Support for their project Serving Humanity.
Serving Humanity, ladies and gentlemen, focuses on providing free services to the needy to ease their struggle during the pandemic. And we have Mr. Khurshid Ahmed present with us. Many congratulations to the CEO. And I request you to accept the award and say a few words on this occasion.
Thank you, Ms. Vinny Chaudhary. And I'm very humble and thankful to CSR Health Impact Award and all the respected jury and recognizing this award. जैसे कहते हैं कि इस वक्त जो सेकंड पैंडेमिक में जो हम लोगों ने देखी वेव 2 में काफी मौतें हुई, लेकिन अच्छी बात यह हुई कि कम्युनिटी आगे आई, लोग आगे आए, वॉलंटियर आ गए, उसी में एक मैं भी था। मैं कहानी से शुरू करूंगा, थोड़ा सा खत्म जल्दी करूंगा, क्योंकि 2 बजे रात में फोन आते हैं कि खुशी साहब आप 7 आदमी की जान बचा दीजिए। हमने कहा क्या हो गया? तो बोले ऑक्सीजन नहीं है, ये एशियन हॉस्पिटल पटना। तो मैंने बातें की और सुबह होते होते 5 मिनट पहले वो सिलेंडर मुजफ्फरपुर से आती है पटना और 7 आदमी की जान बचती है। 2 दिन के बाद दरभंगा से फोन आता है कि 26 आदमी की जान बचाई, सिलेंडर नहीं है। देन आई वर्क विद ऑल द एडमिनिस्ट्रेशन, डिस्ट्रिक्ट मजिस्ट्रेट एंड द हेल्थ सेक्रेटरी, और वहां भी 3 बजे रात तक मिलती है सिलेंडर और फिर वहां जान बचती है 26 आदमी की। तो मुझे लगा कि ना, अब तो लगता है आगे आना चाहिए और हम लोग को काम करना चाहिए। उसी टाइम हम लोगों ने एडवांटेज केयर शुरू की इसी में, और हमारी टीम और हमारे जो ट्रस्टीज हैं, डॉक्टर हाई साहब और सभी लोग ने मिलके एक संकल्प किया कि नहीं, हम लोग को आगे आना चाहिए। और फिर हम लोगों ने मिलके सबसे इम्पोर्टेंट जो बातें हुई, एक हमारे दोस्त कोविड में परेशान थे, एम्बुलेंस वाले बहुत पैसा ले रहे थे, 35,000 40,000 सिर्फ 1 किलोमीटर का। वो एक तकलीफ हुई तो उनकी बेटी ने फोन किया कि अंकल वो पापा को 10,000 मांग रहे हैं। हमने कहा दे दो बेटा, लाइफ इज प्रीशियस। फिर हमने बातें की और फिर 2 एम्बुलेंस फ्री हम लोगों ने शुरू की। इसी तरह कारवा बढ़ता गया, फिर हम लोगों ने शुरू की फूड दिया जाए परिजनों को, फिर अच्छा लगने लगा, जज्बा एक आया लोगों का और लोग रिकॉग्नाइज करने लगे। फ्री जो एम्बुलेंस दिया तो काफी लोगों की जान बची। बेड चाहिए, डेली 40 कॉल्स आते थे, रमजान का वक्त था, नमाज पढ़ते थे, तो एक्चुअली जो जान बच रही थी, लगता है कि मैं कुछ कर रहा हूँ। और फिर हम लोग करते चले गए और आज हम लोग यहाँ हैं और आपको रिकॉग्नाइज किया, बहुत बहुत शुक्रिया। और अच्छी चीजें क्या हुई कि अब हम लोग रूरल में जा रहे हैं, गाँव में। बिहार में गाँव में एकदम नहीं है, जैसा कि आप जानते हैं कि बिहार इंडिया की जो हेल्थ केयर है वो बहुत अच्छी नहीं है। GDP इज ओनली 2%, जबकि दूसरे कंट्री में 5 to 7 है, और कुबा से छोटी कंट्री में 15% है। तो GDP बढ़ाना पड़ेगा हम लोग को, बहुत इंपॉर्टेंट है हेल्थ के लिए, तभी जान बचेगी। जब हमारे माननीय हमारे मोदी जी जो हमारे प्रधानमंत्री हैं वो कोशिश कर रहे हैं, लेकिन हम लोग को मिलकर करना होगा। GDP के लिए हम लोग को कन्वेंट का कैंपेन चलानी होगी, एडवोकेसी करनी होगी बढ़ाने के लिए। तो हमने गांव में गए, क्योंकि 70% जो मेडिकल है वो प्राइवेट के पास ऑपरेटर का, 30% सिर्फ गवर्नमेंट के पास है। तो हम लोग गांव में 2 गांव को अडॉप्ट किया है, अररिया एंड मधुबनी। आपको जान के ताजुब होगा, पटना हाई कोर्ट ने एक दिया था स्टेटमेंट की कितनी पॉपुलेशन है अररिया की, तो 24 लाख पॉपुलेशन है, आप समझेंगे। अब बेड सिर्फ 400, सिलेंडर नहीं थे उस टाइम, तो हम लोग वहां पर एक 30 बेड फ्री दे रहे हैं। और मधुबनी में क्रिप्स हॉस्पिटल के साथ तो 10 तारीख को हम लोग लॉन्च कर रहे हैं, 30 बेड फ्री हम लोग करेंगे सारे मेडिकल सर्विसेज गरीबों के लिए। और साथ में अभी जो हम लोग सबसे अच्छा काम करने की कोशिश कर रहे हैं कि मेडिकल ऐप बनाया है, उसमें डॉक्टर आ रहे हैं एवरी टाइम। और हम लोगों ने शुरू की है कॉलम डॉक्टर की मशवरा, तो न्यूज़पेपर जो है उर्दू लीडिंग में लोगों को एडुकेट कर रहे हैं कि आप वैक्सीनेशन जरूर दिलाएं, उसमें प्रमोट कर रहे हैं एजुकेशन एंड अवेयरनेस के लिए। डायलॉग सीरीज भी कर रहे हैं हम लोग, 12 डायलॉग सीरीज किया है डिफरेंट, उससे इम्पैक्ट बहुत अच्छी पड़ी, अच्छे लोग। इम्पैक्ट ये पड़ी कि बिहार सरकार ने कैपिंग कर दी एम्बुलेंस पर कि आप 6,000 से ज्यादा नहीं ले सकते हैं। वो हमारी कैंपेन थी एडवोकेसी की मीडिया के थ्रू। दूसरा, हम लोगों ने जो परिजनों को खाना खिलाया, तो गवर्नमेंट ने भी शुरू की हॉस्पिटल में कि पेशेंट तो चले गए अंदर, लेकिन उनके जो बीच में बंद थे लॉकडाउन, तो खाना कहाँ खाएंगे लोग। तो गवर्नमेंट ने भी इसको शुरू की हमारे कैंपेन से। और तीसरा जो सबसे इम्पोर्टेंट है कि वैक्सीनेशन टू द किड्स, वो भी कैंपेन में हमारे प्रोफेसर नफीस सदर ने कहा था कि बच्चे स्कूल उसी वक्त जाएं जब उनको वैक्सीनेशन पड़ जाए। हमारे बच्चे छोटे हैं, नहीं जाने के लिए की ख्वाहिश हो रही है उनको, बोलते हैं मैं नहीं जाऊंगा पापा, आप लोग जा रहे हो, आप लोग वैक्सीनेशन लिए हुए हो। तो एक फियर है कि ये सब कैंपेन है सर, कोशिश है आप लोग के साथ, लेकिन स्टिल रॉबर्ट फॉस के एक लाइन है स्पेशनल, माइज टू गो बिफोर आई स्लीप, द वर्ल्ड इज डार्क एंड गिव, माइज टू गो बिफोर आई स्लीप। ये बहुत जाना आप लोग के साथ, बहुत बहुत शुक्रिया, थैंक यू सो मच।
धन्यवाद अहमद साहब, आपके काम और आपके जज्बे को सलाम और बहुत बहुत शुभकामनाएं आपको।
सलाम सर।
And now, ladies and gentlemen, we move to the next category. That's the Health CSR Project, Health Campaign of the Year. And under this, the Gold Award winner is
The Gold Award for the Institution category, Health CSR Project, Health Campaign of the Year goes to Apollo Tyres Foundation for their CSR projects.
Apollo Tyres CSR caters to healthcare for trucking community, solid waste management and sanitization, livelihood for the underprivileged women, and biodiversity conservation. Would like to invite Ms. Rinika Grover to receive the award.
Ms. Grover is not here, and Shivani Mehrotra from her team. I would like to receive the award.
Congratulations. Yeah, please.
Thank you. I would like to thank ISW Council for recognizing our effort, and I would like to just talk about little bit about our initiative. So, Apollo Tyres Foundation is working for the trucking community from like almost 2 decades, from 2000, and the program was started with the Healthy Highways. And initially our focus was on the HIV/AIDS prevention care, but slowly, gradually, looking at the various kind of diseases, the organization has integrated various healthcare services for the trucking community, like tuberculosis, vision care, treatment of NCDs and all. And pandemic actually showed us the way that healthcare is very essential, and we cannot neglect that thing. And trucking community, because they are mostly on the roads and they lack access to the treatment. So we try to tweak a little bit of our service approach, and we provided door care solution to the trucking community. We provided telehealthcare facility for the trucking community so that they can access the healthcare center and they can get the doctor consultation. Recently, we have also introduced the COVID helpline services for the trucking community, where they can actually get the details related to COVID vaccination, COVID care, if they are not able to access the COVID portal. Those kind of supports we are providing. And in collaboration with the government, we have also introduced the COVID vaccination testing facility for the trucking community. Apart from providing the essential healthcare solutions to the trucking community, during the pandemic time, Foundation was dedicatedly working for the trucking community who were stuck at the Transport Nagar. They provided them the ration support and food support to the community. So I would like to thank once again to all the jury members and to all the winners working in the healthcare space. Thank you so much.
Thank you, and once again, congratulations to your team. And ladies and gentlemen, in this very category, as we move to the next award, that's a Silver Award, and the winner is
The Silver Award for the Institution category, Health CSR Project, Health Campaign of the Year goes to Tech Mahindra Foundation for their project, Tech Mahindra Smart Academy for Healthcare.
So Tech Mahindra Smart Academy for Healthcare is a long-term sustainability project that focuses on training and capacity building of frontline workers, healthcare professionals, and government school teachers. I would like to invite Ms. Swapna Shetty, who's present with us. As I congratulate her, would like to request you to accept the award and say a few words on this occasion.
Yeah, thank you so much, ma'am. It's a great privilege and honor to receive this award on behalf of TMF, and it is an earnest gratitude for recognizing our effort. So TMF Smart Academy works towards the training of the healthcare. So we provide, during this pandemic, we supported the healthcare system by training the staffs. In fact, that was the main crux where they were not getting healthcare system. Though it was challenging for us in terms of we could not call the students to the academy and train them. But what we did is we trained them on, we did an online training for them. We gave them a lot of videos so they understand the practical of the job, what has to be done, and then we put them in hospital for the practical training. So during this pandemic, they could use our students for the as a frontline warriors, and our students readily went there and did a great job in terms of supporting the healthcare system. So that was a great thing what we could contribute towards the society. And also being a healthcare academy, we one more thing what initiative we took is people who are in the frontliners like the NGOs, Anganwadi and Anganwadi teachers. We train them on COVID Swayam Suraksha. So this is a training where we train the people towards safety. So whenever they go to the community, they know how to have the precautions to be taken during the COVID pandemic, because there are a lot of slums who do not know what are the precautions, what is to be done if the disease comes in. So this is where we train the teachers, the Anganwadi teachers and NGOs. So there's a lot of great work which is going on, and we will continue to do great work and whatever we can contribute towards the community. So our mission is to support the healthcare system at the moment, and we are all our 4 academies, Delhi, Mohali, Mumbai and Pune, are doing it. So thank you so much for recognizing us, and this kind of award definitely motivates to do a great work. Thank you everyone. Thank you jury, and once again congratulations to each and everyone. Thank you so much.
Thank you, and again congratulations and good luck to your entire team.
Thank you so much.
So now we have the bronze award, and once again we have a tie here. So the first bronze award goes to
The first bronze award for the institution, category Health CSR Project, Health Campaign of the Year, goes to Aadhar Housing Finance Limited for their project Ayushman Aadhar.
So Ayushman Aadhar bridges the gap between healthcare services and communities by empowering community people to improve health-seeking behavior. Congratulating Ms. Archana Kohli and Ms. Rutvi Mehta, who joined us, and I request him to say a few words on this occasion.
Am I audible?
Yeah, audible.
So at the outset, on behalf of the entire team of Aadhar Housing Finance Limited, I would like to thank IHW and the jury members for recognizing our efforts. At AHFL, our mission and vision has always been to empower the community and we try to reach out in the best possible manner. These initiatives would not have been possible without the amazing support that we received from our various implementing partners. And under the umbrella of Ayushman Aadhar, we have initiated a lot of projects with different focus areas like early child care and education and menstrual hygiene management, and we've conducted around 200 health camps in the last 5 months. So while we continue to serve the community in the best capacity, it's recognition and awards like these that just reinstates our confidence, and we look forward to continuing to support the society. And I just wish all the team members and all the family members at IHW a very happy and healthy year ahead. Thank you so much.
Thank you so much, and wishing you the same. Many congratulations.
Thank you.
So moving on to the next award, as I said, there's been a tie in the bronze award. So the second bronze goes to
The second bronze award for the institution, category Health CSR Project, Health Campaign of the Year, goes to SBI Card for their CSR project.
Congratulations to them, and would like to invite Ms. Seema Kapahi to please accept the award.
Mr. Jha, please unmute yourself.
Yeah, Mr. Jha from SBI card. Congratulations, sir.
Thanks. Madam Seema Kapahi is not there, so I'm representing SBI card. And on behalf of SBI card, I would like to thank the jury members, IHW. And I must say that these award motivate us to do more for the society. And you'd like to do more and more and more. This is something. And I do believe that CSR per se, I mean, it is not it's not obligation. It is just more like what you're giving back to the society. We enjoy doing CSR, we enjoy doing our work, and we derive lots of pleasure from it. Thanks, IHW. Thanks, Judy.
Thank you very much, sir. Thank you for your noble thoughts and actions. Thank you. So we move to the next category, and that's Environment Impact Initiative. And under this, the Gold Award winner is?
The Gold Award for the institution, category Environment Impact Initiative, goes to NTPC Limited for their project Revival of Municipal Solid Waste Plant, Karsada, Varanasi.
So the project in Karsada, Varanasi manages solid waste collection and disposal. Congratulating them, and would like to invite Mr. Dilip Kumar Patel to receive the award. We have someone from NTPC, Mr. Patel, if you've been, Himani, is Mr. Patel joining us?
There is not switching on mute. Okay, he's there.
Sir, we can see you, but your mic is on mute. Sir, your mic is on mute. Mr. Dilip Kumar Patel, sir? I think is not getting our voice. So I think, sir, your mic is on mute. Okay, I think he's not getting a voice, but many congratulations.
Ma'am, am I audible?
Yes, sir. Yes,
Yeah. Actually, Mr. Patel and Mr. Sahu is not present right now.
Okay.
And I am Madhuraj, manager CSR from NTPC. And thank you so much for conferring this award to NTPC. And it is my privilege to receive this award on behalf of NTPC from ISW Council. Thank you so much.
Thank you and congratulations, sir. And we move to the next category, that's Swachh Bharat Impact. And under this, the Gold Award winner is?
The Gold Award for the institution category Swachh Bharat Impact goes to Jackson Group for their waste to manure program.
Program, ladies and gentlemen, aims to promote household waste segregation at source and set up decentralized waste processing facilities for a total of 5,000 households in Karkaduma village and Saini enclave of Anand Vihar, Delhi. I'd like to invite Mr. Kumar Abhishek, Ms. Shilpi Kumar, Ms. Neetu Chauhan to receive the award. I think Mr. Jha is present with us. Anyone from Jackson Group?
Mr. Abhishek, please unmute your mic.
Hello everyone.
Yeah. Hi, we can hear you.
Am I audible?
Yeah, you're audible.
Oh, thank you so much. First of all, I congratulate the IHW Council and the jury member, and it's an absolute pleasure to receive this award on behalf of Jackson Group. So, our aim was to, means objective was to zero waste in the area of Kakkadnuma Anandya. So once again, thanks for us to give the opportunity to having this award.
Thank you. Thank you and congratulations to your team.
Thank you so much.
And we move to the next category, that's WASH Initiative. And under this category, ladies and gentlemen, the Gold Award winner is...
The Gold Award for the institution category WASH Initiative goes to Jamna Lal Kaniram Bajaj Trust for their CSR program.
So the program focuses on providing sustainable solutions to recharge more water in the available water sources and to solve drinking water, take initiative to promote roof rain water harvesting structures so that women get safe water for drinking purpose at the doorstep. I'd like to invite Ms. Rakhi to please accept this award and also to say a few words on this occasion.
Thank you, Virmiji. I'm grateful, and on behalf of my trustees, higher authorities, and all my team members, I'm thankful to Integrated Health and Wellbeing Council and the jury to give us opportunity to participate in this program and to win this award. I'm really thankful to you all and all the winners on this evening. Thank you very much.
Thank you and congratulations, ma'am. And we move to the next award, that's a Silver Award in the category of WASH Initiative, and the winner is...
The Silver Award for the institution category WASH Initiative goes to Nandi Community Water Services Private Limited for their Community Safe Drinking Water Program.
Program, ladies and gentlemen, aims to provide safe, reliable and affordable water in underserved communities in India where the sources of water are contaminated and unfit for consumption. Congratulating the team and would like to invite Ms. Divya Yachamane, Ms. Shivani, Mr. Praveen Kumar and Ms. Anusha Vadlamudi to receive the award.
Thank you so much. Are you able to hear me?
Yeah, able to hear you.
Okay. Okay. Thank you so much. Thank you, jury, for choosing us for this award. After an especially tough year, this is great validation of the work we do on the ground. As Vimi mentioned, we've been set up with the mission to save lives by providing access to safe drinking water to underserved communities in a sustainable manner. We are working in 7 states across the country, providing water to more than 850,000 people and 25,000 children every day. So I would like to thank you all again for giving us this award. Thank all the donors, the state and local governments for their faith in us, our board for their continuous support and guidance. A big thank you to our team for fearlessly serving the underserved through the pandemic. And last but not the least, our consumers for their trust in us. Thank you so much.
Thank you, ma'am. Thank you. Congratulations. Thank you. The next category. This is a category of CSR Health campaign. And under this, the Gold Award winner is...
The Gold Award for the institution category CSR Health campaign goes to AstraZeneca for their project New Normal Same Cancer.
The campaign, ladies and gentlemen, was launched with the very objective to raise awareness about the importance of diagnosing cancer at early stage and accessing treatment once diagnosed, even during the pandemic. We invite Ms. Amita Yadav to receive the award.
Dr. Yadav, you're on mute.
So thank you, everyone. I would like to thank IHW CEO Kamal Narayan ji for organizing this event and giving us a platform to showcase our work. I would like to extend my thanks to jury member who saw value in our campaign. As I would also like to extend my sincere gratitude and a lot of sincere thanks to my NNSC core team, task force team, country leadership team for giving guidance and support as and when required. They were always there. Our global team for giving overall picture for this campaign. So as very rightly mentioned by Kamal Narayanji in the opening remark that during Corona pandemic, we ignored many other issues. And there was a paper which highlighted that in the country, in India, there was a 40% decrease in screening and diagnosis of cancer. So that was the punchline which we hit us, and we thought of having a campaign where we'll generate awareness, like don't ignore, we take proper precaution and go and get checked up by a doctor. If in any adverse event your treatment got stopped, interrupted during the Corona pandemic, that when the whole world was standstill, then please go and resume your treatment. So that was the intent, and for this, we had partnership with the Indian Cancer Society. I would like to thank them as well. They really put hard work into this. So with this campaign, I think in a year, we have touched more than 3 million people. We have reached out to more than 3 million people. And the response was so good that we are starting second phase of this campaign. And in the next phase, it was actually it will be an amalgamation of screening as well as awareness. In the first phase, where we were focusing more on awareness, this time we are bringing call to action on board, and we will be promoting actual screening as well. So thank you so much for this award. It actually motivates us to work more hard on this.
Thank you, ma'am, and congratulations, and thank you for talking to us about your project. Thank you.
Thank you.
And moving on, ladies and gentlemen, now we have the Silver Award, and the Silver Award winner in the category of CSR Health Campaign is...
The Silver Award for the institution category CSR Health Campaign goes to Sanjeevani, Life Beyond Cancer, for their project Can Chetana, an awareness initiative.
So this initiative of theirs focused on creating awareness about healthy lifestyles to build immunity and thus avoid the incidence of cancer. As we congratulate the team, I would like to invite Mrs. Ruby Ahluwalia, Mr. Anil Ahluwalia to please accept the award.
Thank you so much. Good evening, everyone. And it is such a pleasure to see all this wonderful work being acknowledged on this platform. And I'm so honored to be felicitated on the same platform. COVID has changed lives, and it has changed lives for cancer patients like anything. Actually, cancer patients, when they reach the hospital, they are told that your treatment had to start yesterday. And when COVID happened and the lockdown happened, suddenly, the next day the hospitals are closed. There was so much of uncertainty, and the patients were so much in distress, actually. And that was the time we took around 2 days to kind of work around this, and how will we operate physically, how will we operate in the virtual world. And we ended up working with more than 85,000 patients during the COVID times. And the awareness sessions that we have been doing, we took it virtually. And I really want to thank all the 200 social work colleges who collaborated with us for this work, and the NSS, the NCC, and the government cancer hospitals with whom we work. And I also want to thank the beautiful team of Sanjeevani without which this was not possible, who has been working on ground physically in the 17 government hospitals that we work across the country. So thank you so much for this award. It means so much to the whole team. And thank you, jury, and thank you, IHW, for this opportunity. Thank you so much.
Mrs. Arwalia, and once again, congratulations. And we now have the next category, that is CSR Food Initiative, and under this category, the Silver Award winner is
The Silver Award for the institution category, CSR Food Initiative, goes to Siddhi Philanthropic Foundation for their project HOPE, Hope, Help Other People Eat. The
gentleman has been an initiative to feed the underprivileged and vulnerable communities who are hit by the crisis during the pandemic. I'd like to invite the team, Dr. Meena Mahajan, Ms. Monica Singh, Mr. Ajit Singh, and Ms. Basanti Subba to receive the award.
Thank you very much, and what a beautiful and an inspiring evening. Thank you, Bimiji, for being such a fantastic host. On behalf of my team, I feel very humbled and privileged to receive this award. We have been working for more than 2 decades in various initiatives. Siddhi is a philanthropic and a social entrepreneurship organization, but as we've all said, I don't want to repeat myself, life changed during COVID, and we were doing a lot of work on ground. In fact, all of us were risking our lives every single day being on the ground, which wasn't easy. 22nd of March, I still remember when the Janta curfew was announced, we decided to launch a very big initiative called COVID Nights, where the entire volunteer team across India was on ground, and we were distributing food and cooked food and ration kits and health and hygiene kits. But as we approached August, September, we realized that food is something very, very basic, and how much can we distribute? And there was a need for, because it had rendered so many people unemployed, and people were struggling. So we got this beautiful idea, and one night I just came up with this thought that help other people eat through food carts. So we designed some fantastic food carts, and we made it a very nice sustainable model where we started employing people who had lost their jobs during COVID. We groomed them to be on the carts, to cook food, to ride the carts. We started paying them, and then we started distributing healthy food, healthy, nutritious food only in ₹5. So in no time, this was a very well accepted thought, because it was an entire supply chain, I would say. We are an absolutely green organization, so we are not using any plastic. So obviously we had the rural population making pattals for us, and we were paying them for that, and the food was being served in the pattals. So this became a very beautiful, sustainable model, and I think everything has been great ever since. We are fulfilling our targets. We have been able to reach the most tribal areas of our country, which makes me very, very happy. And I think we have been able to touch more than 1 million lives ever since last March. So thank you very much on behalf of my team. Extremely proud that my team is here supporting me. So thank you all very much. And thank you, IHW. What a fantastic way of applauding all the people who have done great work. Thank you very much. Thank you.
Thank you so very much. And your words also inspire us also to continue to bring people like you and organizations like yours to the forefront and highlight them. Thank you.
Thank you.
Moving on to the next category, ladies and gentlemen, is that's Rural Health Initiative above 1 crore. And under this, the Gold Award winner is
The Gold Award above 1 CR project and large corporate segment for the institution category. Rural Health Initiative goes to Can Oil and Gas, Vedanta Limited, for their project Swasthya Nidan.
Swasthya Nidan, integrated health intervention for improving the access to healthcare services in the various communities. We'd like to invite Ms. Harpreet Sehra to kindly receive the award.
Thank you so much, Vimi. I would also like to thank the entire jury as well as the ISW Council for this award on behalf of the entire team, Kane Foundation Vedanta. As the tagline says, Desh ki zarurat ke liye, we are working for the entire community. We are working for the entire community across 4 states, around 250 villages and 12 districts, at the grassroots level, the block level, as well as the state level. I wouldn't want to say much, but I just want to share that, the team has been working very passionately, and we never feel that we are satisfied and it's never enough. But, with this award which has been coming today, it's really pepped up the entire team and it's so encouraging because of this. Of course, we've been working for 2 years on COVID also, and it's been 1.5 years, and, you would not believe none of our team members have taken a holiday. So literally on the ground, apart from all the work we are doing, and rest assured, on behalf of the entire team, I would like to share that from tomorrow, it's day 1 again for us. So thank you so much and wish you all the best.
Thank you. So that's the spirit. Go on with that. Again, congratulations.
Thank you so much.
So moving ahead, the Silver Award, ladies and gentlemen, in this category, and the winner is
The Silver Award above 1 CR project and large corporate segment for the institution category. Rural Health Initiative goes to Hindalco Industries Limited, Unit Renukut, for their project Arogya.
Project Arogya focuses on providing access to quality health services and to the target beneficiaries of selected villages. Congratulating the team and inviting Abhijit, Arunune Kumar and Prashant Kumar to receive the award.
Thank you on behalf of Hindalco Industries Limited, to the jury members, ISW councils, for recognizing the Hindalco initiative and health, particularly in rural area. And this is a tough time during COVID-19, and providing all the services, quality services to health during COVID-19 is really challenged. We worked on it on the ground level. So thanks to our team members, thanks to our managements for providing all kind of supports during these periods. Thank you very much, ISW and jury members. Once again, thank you.
Thank you, sir, and congratulations again. And with that, we have the next award. That's the Bronze Award in the category of Rural Health Initiative, and the winner is
The Bronze Award above 1 CR project segment for the institution category. Rural Health Initiative goes to SBI Life Insurance for their Project Navodaya.
So Project Navodaya, Rajasthan, and Project Ayushman Bhava, Madhya Pradesh focus on the approach of the first 1000 days of life, where pregnant lactating women and children up to 2 years of age are supported through government and social platforms. Once again, inviting Mr. Abhijit, Anune Kumar, and Mr. Prashant Kumar.
Yeah. Once again, thank you very much. And the project, we will continue, the journey will continue. And thanks for, and we believe on journey, not in destination. Thank you very much. Thank you, the team members.
And we move to the next category. That's the Rural Health Initiative below 1 CR. And under this, the Gold Award winner is
The Gold Award below 1 CR project segment for the institution category. Rural Health Initiative goes to Glenmark Foundation for their project Health on Wheels, Sikkim project.
Ladies and gentlemen, they have implemented projects related to child health interventions, addressing issues such as nutrition in pregnancy, need for immunization, correct breastfeeding, among many. So would like to once again invite Lindsay George to kindly join us and receive the award. We have someone from Glenmark Foundation. Any representative from Glenmark? Okay, so I think we don't have, but many congratulations to the team. And we move on to the next award, and that's the Silver Award. There's a tie here, ladies and gentlemen. So we have the first Silver Award, and that goes to
The first Silver Award below 1 CR project and large corporate segment for the institution category Rural Health Initiative goes to Cadila Healthcare, Zydus Group for their project Zydus Medical College and Hospital, Dahod.
the hospital, ladies and gentlemen, is the only ultra-modern multi-speciality hospital in 200 kilometers and is the first medical college to be set up at Dahod. Currently, 550 MBBS students are enrolled in the institution. So congratulations to them. And if we have the representative from Zydus, we would like to say a few words on this occasion. Pretty late in the evening, I believe, but yes, many congratulations and thank you to the participants for staying so late with us also as we extend these recognitions. So I think we move on to the next award. And as I said, there's been a tie here. So the second Silver Award goes to
The second Silver Award below 1 CR project and large corporate segment for the institution category Rural Health Initiative goes to Vedanta Limited, Manjigarh for their project Arogya.
the project, ladies and gentlemen, aimed at providing excellent care and advanced healthcare services for the benefit of the communities. Would like to invite Mr. Gigi Paul, Dr. Niladri Bhushan, Ms. Garima Yadav and Mr. Dilip Kumar Prajapati to receive the award.
Good evening, ladies and gentlemen, esteemed jury and all the delegates. It's really a pleasure and honor for me to receive this prestigious award on behalf of our team here, all those frontline COVID warriors and the fighters, as well as the communities and the people of Lanjigarh and Kalahandi and Odisha. And finally, for on behalf of Vedanta, it's a really great honor to receive this, and I must thank the jury as well as IHWC for honoring this. It's really, I must also express our gratitude on behalf of everyone, to our chairman, who has dedicated almost 201 crore to fight the COVID. So, and just for your information, what we did, apart from to ensure the livelihood and the life of the people during this time, recently we have set up a 200-bedded hospital, COVID hospital at Bhavanipatna, which is a district headquarters of Kalahandi, which has a 20 ICU bed, 20 HDU bed, and all the beds are fixed with your oxygen supply. It has been developed and funded completely by Vedanta Lanjigarh. And we have also created a pediatric ward because it has been told the third wave that is being expected is going to impact most of the people below the 18 years. So we have created a pediatric ward to take care that the children and their requirement taken care. We are really, really grateful to all, and we are also grateful to this council for honoring our efforts. And we look forward. It's a really motivation for all of us to continue to work. As our chairman says, that we are here to work for देश के जरूरत के लिए, and we will continue to work for the society. Thank you all for honoring all of us. Thank you very much.
Thank you so very much, sir. And though we all really hope that the third wave doesn't come, but it's good to hear that all of us are actually standing prepared for that. Thank you. So moving on in this very category, the Bronze Award, this is a category of Rural Health Initiative. The Bronze Award goes to
the second Bronze Award below 1 CR project segment for the institution category Rural Health Initiative goes to Jan Vikas Samiti for their project Tele Rehabilitation. Project Sambhav, reaching the unreached.
the project operated with the motto of reaching the unreached using the web portal and the mobile app for a better individual rehabilitation plan and service delivery. Congratulating the entire team, and would like to invite Mr. Chandran Raymond, Mr. Felix Thomas, Mr. Ranjit Singh, and Mr. Vince John to receive the award.
Thank you very much. On behalf of the Jan Vikas Samiti, Chandran Raymond is unfortunately is not there. However, I thank ISW for bestowing this award to Jan Vikas Samiti. This project Sambhav, reaching to unreached, is one of the wonderful and very innovative projects to reach to the children with disabilities in the remote areas of India. We have reached in 10 states of India with the help of 18 partners, and we have reached around about 600 children with disabilities. We are providing them interventions, rehabilitating them physically, and also trying to provide them an enabling environment. So thank you very much for giving this respectful award. Thank you.
Thank you, sir. And once again, congratulations. In fact, congratulations to all the award winners. And ladies and gentlemen, what a day it has been. The journey of celebrating these outstanding performers and achievers and contributors and impactors to the society, to the community, reaching out to people. Remarkable work which is being done by them. And I'm sure it has motivated, inspired many of us to reach out to more and more people and do something for our communities and for our country. So with that, as
I would request you to please invite Mr. Pramod Kumar Sahu from NTPC to receive the award. He was not able to receive earlier.
Okay, yeah, when we announced the awards, there was no one from NTPC, but yes, congratulations to them. And may I request Mr. Pramod Kumar to say a few words on this occasion. And
Am I audible? Am I audible, ma'am?
Yes, sir, you are audible, sir.
Sorry, this was really, I was very saddened because my organization was getting the reward and due to its magnanimous work in environmental impact category. And thank you very much to the jury and ISW for honoring us. As a public sector, it is our motto and it is our responsibility for nation building. And this is a small step regarding in that direction. And we contributed a lot for Ganga cleaning of this Banaras city, so that it was from 2014 it was ranked 418 in Swachhata Sarvekshan, and after our intervention it climbed up to 27th position in 2020 Swachhata Sarvekshan. And this was the abandoned project of UP government, Banaras BNN, that means Banaras municipality, and it was handed over to us as a crisis driven, because NTPC known for its project management skill and taking up the project. So we took it in 2016, and we made it such operational, and now we have contributed a lot for near about 50 crore plus, and contributing that amount to giving impact in all the direction of health, environment, and clean water, and we reduced the ecoticity of the ground level water quality. And with this, we got this award. I'm really excited. It is dedicated to my passionate management and to dedicated to my team. All of were waiting from 7 p.m. to 9:30 p.m. And at last, when we could not been able to, due to technical glitch, I suppose, then I'm driving. In the way, I stopped my car, and I could not resist my temptation for my great organization. I'm thankful to this organization for contributing a lot to the society. Thank you very much, ma'am.
Thank you so very much, sir, and good that you could join us, and we could hear your work which NTPC has been doing. और स्वच्छ रहेगा भारत तो तभी स्वस्थ रहेगा भारत.
Thank you,
धन्यवाद. And in fact, once again, congratulations.
The Gold Award for the institution, category Environment Impact Initiative, goes to NTPC Limited for their project Revival of Municipal Solid Waste Plant, Karsada, Varanasi.
Thank you, ma'am.
Thank you, sir. So once again, congratulations to everyone, and ladies and gentlemen, people who could not join us, devotees who could not join us, either due to some technical glitch or we could not hear them. Don't worry, our team is going to be reaching out to you. But yes, many congratulations, and we really hope that you continue to do the good work, and we continue to keep honoring you on this platform. So with that, as we come to the end of this very rewarding day, I would like to once again invite the CEO of IHW Council, Mr. Kamal Narayan, and this time inviting him for his closing remarks.
Thank you so much, Anisha, and it has been a wonderful evening, and sorry, I'm so overwhelmed with the kind of work which we got to saw as part of the nominations, and also to hear the people live their stories, how they kind of rose to the occasion and ensured that their organizations, and many of them were even individuals, and they despite all those limitations, the fear of virus, everything, they did best which they could have done for the service of the humanity, for the people, and for the health of our nation. So thank you so much, all the awardees. Congratulations to all of them again, and many of them are still with us, though it's quite late in the evening, and I think it took much more time than expected, but we thoroughly enjoyed all that, because your work is much more, I think, seminal than the time spent today. So thank you so much, all of you. And I would like to take this opportunity to thank our jury members again, and I can see Sri Love Verma is still with us, and he also stood with us all through this program. Thank you so much, Mr. Verma. This shows that how passionately you have been serving the country as many positions in the government of India and many other governments, and also as in your present capacities. Thank you so much for being with us. And I would also like to thank Vivi for the flawless execution of the program. Thank you so much. I have been, seeing you on the physical events. It's been 2 years, and now after 2 years almost, we are doing this program. Last time I saw you in the Ayushman Bharat, that Gyan Manthan, which happened at the Vigyan Bhavan with the Prime Minister's presence. Thank you so much. And also, I would like to thank all our team members who have been relentlessly working to put this together and to bring all of you on this platform, to persuade all of you to, kind of be part of this journey. Our secretarial team, Himani, she has been working like a backbone. she was here and speaking in between. So Himani, thank you so much. And if my team members are there, they can open the videos so people can see them as well. In a physical event, they do come on stage. So thank you so much, Himani. Shalu was in our secretarial team. She has been putting a lot of effort. So Shalu also, thank you so much. Rajiv, our head of network, forums, has been doing a lot of, all the production which you saw was, coming under his guidance and under his team, Mirza, Akshay, and our industry reach out team, Dushyant and Neha. They have been, and many of you might be knowing their name because they must be, kind of pestering behind you to send your entries so that we can, kind of see the good work. So thank you so much for thanks Neha and Dushyant also for their wonderful work. They are led by Mr. Vivekanand Misra. So thank you so much, Mr. Vivek, for all your efforts. Swati, Jayati, Saurabh, many people were part of in the, while we were awarding you, a lot of information was going on social media so that the world can know that the wonderful work you have done. So thanks to all of them for their untiring efforts for doing all that. And more than that, thank you all of you for doing whatever you are doing. It's just extraordinary. Keep doing the great work and keep serving our great nation, and let's make India a healthier, happier world together. Thank you so much. Good night. Sabha khair.